1, 2. Madam Speaker,
there will now be a moment of silent prayer and meditation. May we be seated? Honorable members, the first item on the order paper is a motion in the name of the Chief Whip. Honorable the Chief Whip.
Good afternoon, Madam Speaker and honorable members. A draft resolution that the House suspends Rule 290, subsection 2A, which provides inter alia that the debate on the second reading of the bill may not commence before at least 3 working days have elapsed since the committee's report was tabled. For purposes of conducting the second reading today on the Division of Revenue Amendment Bill 313-2024 National Assembly, Section 76. Thank you, Madam Speaker.
Thank you. I now put the motion. Are there any objections to the motion? There are no objections that I've seen or any hands that I've seen from the floor. Therefore, the motion is agreed to. The Secretary will read the first order of the day.
Debate on World AIDS Day, equal rights, equal access to quality care for all.
I'll now invite the Honorable the Minister of Health, Minister Mswaledi, to take the floor. Yes, to the podium.
Honorable Speaker, honorable members of the House, that time of the year has finally arrived where we reflect on one of the biggest pandemics ever to befall the world, the issue of HIV and AIDS. And unfortunately, while this is a world phenomenon, while the World AIDS Day, as the term reflects, is for the whole world, we in South Africa has a dubious distinction of being the country that is very highly affected, more than any other. So when this day comes, the reflection is more in our country than in any other part of the world. We started the biggest antiretroviral program in the whole world. If you remember, in 2010, at that time, there was a lot of skepticism as to what is that which we are trying to do, whether we are going to afford it, whether we are going to achieve it. Today, 14 years later, we have got 5.5 million people who are on ARVs or antiretroviral program, which makes it the biggest program in the world. We are not necessarily proud of that because we shouldn't have so many people who are HIV positive, but they are there. What we are proud of, perhaps, is the fact that while we started wrongly, but we are able. Honorable Speaker, I've got a flu, so I'm going to keep on stepping you. Please forgive me for that. Can I rush to have some bit of water, please? Yes, we have responded in a proper manner, even though we started late. Now, what we want, Honorable Speaker, to warn about, which is being discussed throughout the whole world, is that we must not get used to the idea that we are having a disease called HIV and AIDS, which now have been with us for more than 40 years, slightly more than 40 years, that we are prepared to live with it. As long as people are alive and they are on treatment, the disease called HIV/AIDS must keep on being there. You are aware that the United Nations Millennium Development Goals, among some of the goals is that we must bring an end to TB, HIV/AIDS, malaria, and other sexually transmitted disease by 2030, like we are with the other goals, like maternal mortality, child mortality, poverty, climate change, etc. So some of the Millennium Development Goals is what we are going to be achieving by 2030. Now, it is not that we are just moving into 2030 blindly. In 2014, UNAIDS, the United Nations AIDS structure that coordinates AIDS around the whole world, came with a concept called 90-90-90, whereby they are saying the dashboard towards ending HIV and AIDS must be the 90-90-90, meaning that 90% of the people who are HIV positive need to know their status. And out of those who know their status, 90% of those need to be put on treatment. And out of those who are on treatment, 90% of them need to be virally suppressed. If a country or a region or an area reach that status of 90-90-90, it is believed by scientists that then HIV/AIDS could no longer move from one person to the other. It will no longer be infective. That's what they mean by virally suppressed. And we were chasing those 90s, but scientists said again and moved the figure of 90-90-90 to 95-95-95, meaning now we want 95 of HIV positive people to know their status. And then out of those who know their status, we want 95% of them to be on ARVs. And out of those who are on ARVs, we want 95% of them to be virally suppressed. Then we'll have achieved the end of HIV or AIDS, or at least the situation where we could no longer talk about HIV and AIDS as a scourge of the world. Now, where are we? In South Africa, in the first 95, we have reached 96, which means we have exceeded the first 95. That means 96% of all the people who are estimated by scientists to be HIV positive in South Africa, they now know their status. They have actually tested. The second 90 The second 95 rather is at 79%. And the last one is at 94%, which means out of the people who know their HIV status, 79% of them are now on ARVs. It translates to 5.5 million people. And it means out of 5.5 million people who are on ARVs, 94% of them are virally suppressed. They can no longer pass the virus from one person to the other. So as you can see, our problem is at the middle 79. I mean, at the middle 95, sorry, which unfortunately is still 79%, is a massive improvement from what it was about 18 months ago when it was only 73. But we moved very hard to move to 79. So where lies the problem and what do we do? As I'm standing here in front of you, in order to reach that second 95, we need to put 1.1 million more people on ARVs. We need to look for 1.1 million people who are still not on treatment, but we know they are there because they've tested and they know their status. And we must put them on ARVs in the next 12 months or maybe 18 months if we are to reach this target. So it's a whole lot of work that is lying ahead of us. Now, when we move deeper into looking for these people, who are they and where are they? We found that an overwhelming majority of them are men. And I want men in this house to be still and listen carefully. Because the problem of ending HIV/AIDS, it now lies with men. Women have done their part and they are doing their part. Right from the beginning, women have been doing their part in this battle. It is men who have been lagging behind. So the 1.1 million are men and also children who we can't put the blame on them because they cannot take responsibility for what should be done by us as adults. So the issue here is men, and we need to go and look for where men are. When we started this program in 2010, programmatically saying now we are treating anybody who has been tested and is HIV positive. When we started, we said we wanted to have tested 12 million South Africans in 12 months. That's when the ridicule started, that won't do it. Experts stood up and said, no, you can only reach 3 million people. This is a pipe dream. It will never happen, etc., etc. We insisted that it's going to happen. And after 18 months, we had reached 18 million South Africans who had tested. What worries us at that time, which unfortunately still continue, is that when we analyze that statistics of 18 million people who were tested in a period of 18 months, we found that 65% of them were women and 5% were children, which means men constituted only the remaining 30%. That was underwhelming. Today, we are still faced with the same problem. Men are not really playing their part in the fight against this battle. Women have contributed a lot. Now, I was told some weeks back that in moving towards the World AIDS Day and looking for this 1.1 million people, they said we must identify where are we going to find this men. And somebody told me that if you want to find men and put them on ARVs. Don't go to the clinic. You will never find them there. They don't usually go to clinics. Their health-seeking behavior is very, very low, much lower than that of women. Then they said, Minister, also don't go to the church. You won't find them there. You'll find women. Then I remembered there was once a GP. I said, oh my God, so this is really true. When I was a GP, and even thereafter when I started this as a minister, when you call men to come and test and know their status, they say, no, my wife has tested, you know. My wife has tested, there's no need for me to test. And she's negative, so I must be negative. That is the science which men believe in. The woman must test for you. And if she has tested, you don't have to do anything. Same thing as church. If you ask a man whether they go to church, I'm not really trying to put the value of going to church or the morality. I'm just putting facts. Don't judge me on value or morality or whether going to church is very important. But when you ask men whether they go to church, they say, no, my wife goes. I don't have to go. So women represent you in church. They even represent you in fighting a disease. My brothers, that cannot be. Let us stand up just once for these 6 years that are left to take the burden from women and fight this disease. I once made a statement which people said is controversial. I said, if you take all women, rather, if you take all men and send them to the moon and leave them there for 10 years, when they come back, HIV/AIDS will be over. There will be no HIV/AIDS anywhere in the world. But if you take women and send them to the moon for a period of 10 years and leave men here on earth, after 10 years when they come back, you'll find HIV/AIDS still ravaging the earth. That's the problem that men are contributing to this problem. And we are calling them over today to stand up and be counted.
Thank you very much, Minister. Honorable N.M. Gasa.
Thank you, Honorable Speaker. Revolutionary greetings to His Excellency, President Jacob Zuma, the MK Party Caucus, the Progressive Caucus. Today, as we commemorate the World AIDS Day, we gather to honor those we have lost, respect the resilience of those living with HIV and AIDS, and recommit ourselves to the fight against this pandemic. While progressive has been made, the reality on the ground exposes the deep failures of the current ANC-DA coalition government, whose misplaced priorities and lack of vision are failing the people of this country. We, the MK Party, the government in waiting, acknowledge the strides made in increasing access to antiretroviral treatment and reducing AIDS-related deaths. Much of this progress was driven by the momentum established under His Excellency, President Jacob Zuma. Following a denialist phase that's cost South Africa no less than 300,000 lives. Under President Zuma's leadership, the largest HIV treatment program in the world took shape, reversing the tide of neglect and saving millions. However, the campaign against HIV and AIDS has been relegated to the sideline in recent years. Complacency has replaced agency, leaving our communities vulnerable. The normalization of living with HIV and AIDS, though a positive development, has led to dangerous laxity, particularly among our youth. Many now rely solely on the availability of medication, overlooking the necessity of prevention. Yet, the statistics paint a grim picture. TB, the leading cause of death among HIV-infected individuals, continue to claim lives. Over 304,000 new TB cases among people living with HIV were reported globally in 2020. A disproportionate number of these in South Africa. The CDC reports that South Africa has 6.4 million people living with HIV, with a staggering prevalence of 18.8% among those aged 15 to 49. Despite these figures, the current statistics fail to capture the full scope of the crisis. This data blind spot cripples our ability to respond effectively. The MK Party believes that South Africa can and must do better. Njengo hulumeni olindile iMK, we are prepared to lead with bold and decisive action to combat the dual epidemics of HIV and TB. Our key commitments include ukuqinisekisa ukuthi abantu bakithi bayaqhubeka nokufundiswa ngobucayi bokulala benze ucansi olungaphephile. Abantu bakithi bayekelelwe abasafundiswa nobungozi bokungavikeli uma benza ucansi. Furthermore, we will declare HIV and AIDS an identifiable disease. This critical step will ensure accurate data collection, enabling us to craft targeted, effective responses. We will also integrate TB.
Order, honourable member. What's the point of order, honourable member? Under what rule?
Is the member prepared to take a question about Fezekile Kuzwayo?
Honourable member, are you able to take a question?
No.
Thank you. You can proceed.
Furthermore, we will increase funding for research and treatment. In this case, we will prioritize investment in HIV and AIDS research, prevention, and treatment programs, ensuring universal access to life-saving care. Address social determinants in order to find the root causes of vulnerability, poverty, inequality, and lack of education must be addressed if we are to defeat these epidemics. Our call to declare HIV and AIDS an identifiable disease through legislative action is not just a policy proposal. It is a moral imperative. Accurate
Order,
data.
honourable member, if you can please step. Honourable member, what's the point of order?
Honourable Speaker, I want to check if it is parliamentary for an MK member to stand there without the uniform of MK.
Order, that's not a point of order, honourable minister. You can proceed, honourable member. Order, honourable members.
Accurate data is the foundation of effective governance, and without it, we cannot win this fight. The current ANC-DA coalition government has shown neither the interest nor the capacity to respond to these challenges. Their neglect is evident in the underfunded healthcare system, lackluster prevention campaigns, and fragmented service delivery. This coalition is failing to protect the health and dignity of our people. The MK Party stands ready to take the reins and provide the leadership South Africa so desperately needs.
It's coalition.
On World AIDS Day, we reaffirm our commitment to building a nation where health is a right, not a privilege, and where no one is left behind in the fight against HIV and AIDS. The time for action is now. The MK Party is prepared to lead South Africa into a future where our people's lives are well-being and prioritized, where we address crises with determination, and where we truly leave no one behind. Bantu base South Africa, may I take this opportunity to invite all the people of South Africa on the 15th of December this year in Moses Mabhida Stadium to celebrate with us the first birthday of Umkhonto weSizwe Party. Amandla! The MK Party is ready to serve and deliver.
Honorable order, honorable members, order. Honorable Dr. K.W.G. Leroux.
Honourable Madam Speaker, it is a great honour for me to participate in this debate for World AIDS Day, which will be commemorated this coming Sunday, 1 December, which is also my 50th birthday. World AIDS Day is deeply personal to me, but not because it happens to be on my birthday, but rather because I have spent a significant part of my working life as a doctor caring for patients living with HIV in the deeply rural Eastern Cape. Working at Zitulela Hospital and helping set up its ARV program in 2007 has been one of the great privileges of my life. And I want to dedicate this speech to the many brave people from Zitulele and its surrounding villages who live with HIV with such courage, dignity, and dedication to their and their families' health. Dianibulela, difunde lukhulu kuni. Honourable members, as someone who has worked in HIV, I would like to share with you some of the progress we have made in South Africa, but also some of the significant challenges that we continue to face in delivering care to the largest cohort of people living with HIV anywhere in the world. Let us start with the big picture. We currently have approximately 8 million South Africans living with HIV, of which nearly 6 million, or 75%, are on antiretroviral treatment. Only 69% of all people living with HIV are virally suppressed, meaning that nearly 2.4 million HIV-positive people are not benefiting from the life-saving drugs impact of ARVs, and therefore are still able to transmit HIV to their sexual partners. Tragically, nearly 3.8 million South Africans have died of HIV since 1990, an absolutely staggering number, and 50,000 people continue to die of HIV each year. Thankfully, we have made enormous strides in the management of HIV in South Africa over the last 25 years. When I qualified in 1999, there was no ARV treatment available in the government sector, and to be diagnosed with HIV was effectively a death sentence. The scientific innovation and progress that we have seen over the past 15 years that has transformed a universally fatal disease to a chronic illness has been unprecedented.
Order, Speaker, order.
Sorry, who's raising the hand? Okay, thank you very much. Order. What's the point of order, Honourable Reddy?
Thank you, Madam Speaker. I rise on point of order 66, and I want to bring to your Rule 66. I want to bring to your attention the behavior of the ANC members across in an important debate such as this, which involves the lives of millions of South Africans. This is an important debate. They continue to be disruptive. They insult the dignity of this House. They raise
Order,
pity,
honourable
and there's
member.
ministers that do this. I want to mention Minister Pammy Majodina, and look at her behavior.
Order, honourable
the
members.
whole country is watching us.
Honourable Majodina.
Sit down.
And look at the behavior of these members.
Prefect, you are not a
Thank you.
prefect, man.
Order, honourable members. Honourable members, can we please not interrupt the speaker on the podium? We can converse, but quietly. No discussion across the floor. Honourable Titebe, Honourable Titebe, can you please be in order? Honourable members, no gestures that may be misinterpreted. Can we please ensure that the debate go accordingly? Honourable member, Honourable Paulson, what is the point of order?
Thank you very much, Honourable Speaker. Honourable Speaker, is it parliamentary for a Member of Parliament to show another Member of Parliament the fist? Because I have Minister of Water and no sanitation.
Honourable member.
No, I have Minister of no water
Honourable
and no
Paulson.
sanitation on video showing
Honourable
fist there.
Paulson.
And
Honourable
she does it
Paulson,
again.
can
She
you
does it
please
again.
take your seat? That's why I had asked members not to make unparliamentary gestures. I had already ruled without you saying so. Yes, Honourable member.
Thank you, Speaker. The Honourable Paulson is actually out of order because he knows he's not supposed to use his phone in the House.
Honourable member, can you please take your seat? Can I address members? This is an important debate that all of us must respect. Members of the executive, as well as members of parliament. I think this is an important debate for all of us, and let's not make light of it. Can I really ask us just to respect, if not ourselves, but actually respect the issue that is important for us and the whole country? Honourable member, you can proceed with your debate.
Thank you, Madam Speaker. The scientific innovation and progress to see HIV transformed from a universally fatal disease to a chronic illness that can be managed with medication over a relatively short period of about 15 years has been unprecedented in the history of medicine. As South Africans, we can be extremely proud of the incredible work so many South African researchers have done in the fields of HIV and TB, helping South Africans access better medication with fewer side effects and dramatically decreasing mortality. Though South Africa's ARV rollout was delayed by AIDS denialism, tragically costing nearly 300,000 lives according to a Harvard study, we need to credit the policies and plans put in place in 2008 and 2009 under Minister Barbara Hogan and Minister Motsoaledi for the remarkable expansion in ARV uptake in South Africa. As a result, we now have free HIV testing available extremely widely in South Africa, and mother-to-child transmission rates of less than 1%, down from 30%. The introduction of an extremely effective, easy-to-use once-daily combination pill of tenofovir, lamivudine, and dolutegravir, or TLD, is a testament to our progress and is available even in the most rural of rural government clinics. However, there are two major HIV challenges that need to be addressed urgently. Firstly, something has to be done about the nearly 150,000 new HIV infections that we see every year. Although oral pre-exposure prophylaxis, or PrEP, has helped decrease the incidence somewhat, and the new long-acting injectable ARV drugs used as PrEP show great promise, the last 5 to 10 years have shown us that South Africa cannot treat itself out of this HIV epidemic. We need a broader, whole-of-society approach like Uganda's highly successful zero-grazing education campaign, which came before the ARV era and which recognized long-term concurrent sexual relationships as one of the drivers of the HIV pandemic and reminded all sexually active people that they are at risk of HIV and not just certain high-risk groups. Secondly, there are nearly 50,000 people who die from HIV each year. 31,000 of these from tuberculosis, despite excellent treatment being available for both HIV and TB, and despite effective TB preventative treatment. And so even though we have a pretty impressive ARV program, the medical wards in our hospitals remain full of patients with advanced HIV disease who are severely immunocompromised and have a high mortality. The reason for this high mortality appears twofold. Firstly, some patients present for the very first time when they're already very ill, sometimes due to fear, denial, or stigma, or because they believe testing for HIV will hasten the onset of the illness. Studies have shown that men often present late because they perceive being ill to be a sign of weakness. They also believe clinics to be female-dominated and unfriendly to them, and they worry about confidentiality. When patients present late, the immune system may already be so compromised that it never recovers, even on ARVs, which is why regular testing for everyone, including each of us here in Parliament, is so important and powerful. I used to say to my patients, "Xa uyatesta for intsholongwane kagulayo, wena uba namandla. Kodwa xa ungatesti intsholongwane inamandla." The second most important reason why we still have so many people dying from HIV is that currently nearly 1 million patients who have tested for HIV and who were on ARVs have disengaged from care. This is for a variety of reasons, but the underlying issue appears to be the harsh, uncaring, and inflexible healthcare system. For example, uncomplicated patients who've been completely stable and virally suppressed for years often have to return to the clinic every 2 or 3 months for treatment instead of every 6 months, which places a huge burden on patients and can become untenable. This practice also clogs up clinics with healthy patients and overloads nurses. Patients sometimes miss their follow-up dates or fall out of care for a variety of completely understandable reasons. Unfortunately, they are often treated harshly when they try to re-engage in care and often shouted at or labeled and are labeled defaulters. Understandably, many will therefore only return to care once they are very ill, by which time it is often too late, adding to our high mortality rates.
Order, Honourable Member. Honourable Nhlangwini, what's the point of order?
Thank you very much, Speaker. Speaker, I just want to maybe perhaps point out on a point of privilege that the member that he said oftenly when he pointed out to members to test or community members to test, and he referred to speaking Xhosa, it must not be stated that it's only Xhosa people that are having HIV and AIDS.
Okay.
Why didn't he state it in Afrikaans or English or just continue?
Honourable
It may
Member.
reflect that only black people are at liberty of having or must be tested. So we must never create that perspective or perception that AIDS is made or only affect black communities. For you to even change
Honourable
it into
Member.
your language that we are speaking, it's highly offensive.
Honourable Member, thank you very much. Can you take a seat? Honourable Member, can you proceed?
There is no doubt that the South African ARV program should do all it can to provide 6 months of ARVs at a time to stable, virally suppressed patients, as is done by most of our African counterparts. Furthermore, patients who have disengaged from care should be welcomed back and encouraged to restart treatment rather than being treated with disdain. In conclusion, the DA recognizes the significant progress we have made in managing the HIV epidemic in South Africa, yet we are concerned that 150,000 people continue to be infected with HIV every year, and we are worried about the stubbornly high mortality rates. We urge the Department of Health to adopt a broader approach to prevention and to make the so-called 6-month, multi-month dispensing available to all stable patients. South Africa has achieved much in the field of HIV, but we must not become complacent, and we will need to work very hard to make our healthcare system more flexible and compassionate if we finally want to win the battle against HIV. Thank you.
Thank you. Honourable Member Nhlangwini and honourable members, I've noted the point that you have raised, but I also understand that members or a member may not have been offensive in the way in which he presented his speech, but I understand that it may be perceived as such, and I think we should also be balanced in our understanding that people may use any of the languages of our country that are official, and it shouldn't be treated as though it might be meaning something more than the message that they're articulating. Thank you very much. Honorable Tembekwai.
Point of order.
Thank you. Honourable Member, what's the point of order?
Speaker, thank you so much for your address, but I think I didn't want to interrupt my member while they were still on the floor. The reason why I'm rising, Speaker, is because I think it was made very clear that the doctor worked in rural Eastern Cape, and that's the language he was communicating with the people from there. So it should not be misconstrued to make it mean as if it was to certain people. So I think it's important for us to be sensitive as members so that we don't politicize an issue that is such of importance to South Africans, all South Africans, regardless of color, race, gender, or language. Thank you so much.
Thank you, Honorable Nodada. The point has already been made. I had made an intervention as a speaker and indeed clarified the point and trying to understand sensitivities on all sides. So I think the matter must rest. Honorable Tembekwai. Honorable Ntlangwini, can we not proceed on this point? I've ruled, unless you are coming up with a new point.
I'm coming up with a new one.
Okay, what's the new
Honorable
point?
Speaker. Thank you, Speaker, for your swift intervention, and I do appreciate that. But the Honorable Nodata have just alluded to something. He must also be aware in the rural Eastern Cape, it's not only black communities that stays in those areas. There are also white and colored communities staying there. So as he wants to save his white body,
Honorable
he
Member,
must just know the population as
Honorable Member, Honorable Member Ntlangwini, I've asked if you are not coming back on this point, and I have ruled, and I think this point doesn't arise any longer. I allow Honorable Member Tembekwayo to continue with her speech. Honorable Member, from the back, there is a hand. Okay. Michalakis?
Thank you very much, Madam Speaker. Madam Speaker, in the point of order, the Honourable Member indicated that Honourable Nodada rose and defended his white buddy. Last time I checked, members don't refer to each other in those terms. We actually respect each other, and I would like to request you to ask her to withdraw those words. Thank you.
Honourable members, thank you very much, Honourable Michalakis. As indicated earlier, I tried to ask all members to be sensitive. And I really think the longer we prolong this debate, it does not assist in the decorum of the House. And as a speaker, I have ruled on the matter at hand and how we should have addressed it. And if you'd allow me, Honourable Member, I would really request that let's proceed with the debate. That's why I had to intervene and stop the Honourable Member as she was proceeding with the point. Honourable Tembekwayo.
Thank you, Speaker. Let me first take this opportunity to convey my revolutionary greetings to the leadership of the economic freedom fighters, led by the Commander-in-Chief and President Julius Sello Malema, who also led a successful march to Concord today on matters of Palapala. Speaker, it was 24 years ago in July 2000 when the late 11-year courageous Nkosi Johnson, who lived with HIV, stood in front of the entire world in the full glare of history at the opening of the 13th International AIDS Conference held in Durban and uttered the following words: "Care for us and accept us. We are all human beings. We are normal. We have hands. We have feet. We can walk. We can talk. We have needs just like everyone else. Don't be afraid of us. We are all the same. Johnson echoed these words at the time when it was reported that 3.8 million people were newly infected with HIV in Africa, and that approximately 2.4 million people had died from AIDS, which was an increase from 2.2 million in 1999. Around the same period in South Africa, AIDS-related death had increased throughout the 1990s, negatively affecting the quality and quantity of education, the country's economy, the country's well-being, which led to many broken families, often children who became susceptible to abuse, violence, exploitation, and many other social ills that have for the longest time been eating into the core of our country's social fiber, thus reducing the quality of life. According to World Health Organization globally, this pandemic has claimed an estimated 42.3 million lives to date, and that transmission is ongoing across the world, and that there were an estimated 39.9 million people living with HIV at the end of 2023, and 65% of whom are in the WHO African region. In South Africa alone, our recent statistics reflect that the estimated overall HIV prevalence rate is approximately 13.7% among the South African population. The total number of people living with HIV is estimated at approximately 8.2 million in 2021. For adults aged 15 to 49 years, an estimated 9.5% of the population is HIV positive. These staggering numbers are a clear reflection of a country that is in need of a good quality health care that must not only be accessible to the rich, but also to the poorest of the poor. As legislators, we are bound by our social contracts with our people to safeguard their well-being, thus improve the quality of life. Access to quality health care is a basic human right that is enshrined in Section 27 of the Constitution of the Republic of South Africa. We have a moral and constitutional obligation to uproot corruption in the healthcare sector, where the ruling elite, who are now part of the so-called GNU, line up for state tenders to enrich themselves, thus sacrificing the lives of the poor on the altar of their greed and desire to amass wealth at the expense of the poor. Not long ago, they shamelessly looted and squandered money that was meant to protect our people during the peak of COVID-19, when people were dying like flies. Not only this, but they have also entrenched corruption in the healthcare system to a point that the infrastructure in many of our public hospitals has basically collapsed to a degree that our people are now exposed to a situation where when they go to a public hospital, they basically go there to die because of this systematic corruption, poor health care, and many other anomalies that are bedeviling our healthcare system. On the National Health Insurance Act, we are of the view that in its current form, it will have no material impact on the lives of those who suffer from. And House Speaker, EFF believes that access to quality health care is an investment in our country's human capital, and that there's no country that can grow its economy if it does not invest in maximizing access to quality health care. We are of the view that good quality health care should be one of the strongest assets, because when people are healthy, they are able to work and add value to the development of their communities, the country, and the broader society. Furthermore, it is through this vision that we can win war against scourge of HIV and
Thank you,
AIDS,
Honourable Member. Your
as
time
well
is
as
up.
equal rights and quality care
Honourable
in South
Mhlongo.
Africa. Thank you.
Thank you.
Honorable Speaker. As we approach the World AIDS Day, it is a moment to reflect on the long journey South Africa has undertaken in its fight against HIV and AIDS. It is also an opportunity to honor the progress we have made, the lives saved, and the resilience of our people. South Africa has been relentless in its mission to turn the tide against these epidemics. Over the past 2 decades, we have witnessed incredible advances. The availability of antiretroviral treatment has increased significantly, reducing HIV infection rates and enabling people to live longer, healthier lives. We are proud to say that scientists people to live longer. We are proud to say that advancement has brought us closer to understanding the virus, exploring treatment and prevention, and even progression towards the dream of cure and a vaccine. We have made significant policy strides, including the National Strategic Plan on HIV, sexual transmitted infections, and TB, and the expansion of antiretroviral treatment in line with World Health Organization guidelines. These efforts, including ensuring lifelong treatment for HIV-positive pregnant women, have transformed the landscape of care and prevention. Yet, while we celebrate these achievements, we must also confront the realities that persist. Stigma and discrimination continue to shackle many of those living with HIV and affected by HIV. These social barriers remain as dangerous as the virus itself, deferring people from seeking testing and treatment and support they need. The Inkatha Freedom Party has long been a committed partner in this fight. Under the visionary leadership of the founder, the late Prince Mangosuthu Buthelezi, may his soul so rest in peace, we stood at the forefront when silence reigned. It showed the nation that HIV is not a shameful secret, but a reality we must face together. In KwaZulu-Natal, the IFP took decisive action. We pushed the provincial government to provide antiretroviral treatment in clinics to prevent mother-to-child transmission of HIV. This was not just governance, it was leadership rooted in compassion and accountability. We reminded the national government of its constitutional duty to save life. And through our actions, countless lives were saved. As we move forward, let us commit ourselves to the following priorities: eradicating stigma and discrimination, expanding access to treatment, strengthening community support, advancing research and innovation. World AIDS Day is a reminder that while the fight is far from over, it is one we can and must win. We owe it to the millions of South Africans who have lost their lives, to those living with HIV, and the future generation to ensure that the epidemic becomes a chapter in history, not a reality of their future. Let us as a nation recommit ourselves to fight this fight with unity, compassion, and determination. Sikhumbule ukuthi akuseyona yodwa i-HIV and AIDS esitholela ama-antiretrovirals. Even those aba-HIV negative bayathola uPrEP usukhona to assist them ukuthi whenever they have indulged, ngoba phela ukhisimusi umnandi, beke bathola ukhisimusi babe be-prepared ukuthi abezukuthola ne-HIV. I thank you.
Thank you very much. Very interesting definition of Christmas. Honorable Peterson.
Thank you, Madam Speaker. Honorable members, HIV is a virus that attacks the body's immune system. The virus weakens the immune system, making it harder for the body to fight off infections and diseases. According to the World Health Organization, there are approximately 39.9 million people living with HIV worldwide in 2023. South Africa has the highest number of people with HIV in the world. Nearly 8 million people in South Africa live with HIV. Of the roughly 2 million people living with HIV who are not on treatment, half were previously on treatment. This suggests that helping and supporting people to start and stay on HIV treatment should be a high priority for the Department of Health. Among people aged 15 years and older, the impact of HIV epidemic in South Africa is unequal across geographic regions and populations, particularly affecting Black Africans, women, and young people. Research suggests that social stigma poses a significant barrier to testing behavior among older adults. HIV prevalence varies geographically, ranging from 22% in KwaZulu-Natal to 8% in the Western Cape. We acknowledge that World AIDS Day has good intentions, but it raises a valid question. Does a single day of awareness really make a difference? The HIV and AIDS crisis is a year-round issue, and focusing on just one day of commemoration risks oversimplifying the complexities of this epidemic. New insights are critically important to inform the design of interventions and policies to ensure healthy aging in South African society, and particularly among those who are with or without risk of HIV. While World AIDS Day is undeniably valuable in terms of raising awareness and showing solidarity, it should not be seen as a replacement for ongoing efforts to address HIV and AIDS year-round. The fight against HIV and AIDS requires continuous advocacy, funding, and policy change, and we must ensure that our actions reflect a commitment to tackling the epidemic on all fronts. Thank you.
Thank you, Honourable Member. Honourable P.A. van Staden.
Geachte Speaker, Suid-Afrika het die grootste vigsprobleem tans in die wêreld en hieroor het ons in die tydperk van 1999 tot 2008 in die grootste staat van ontkenning verkeer. Dit was gedurende hierdie tydperk waar ongeveer 900 mense daagliks aan vigs gesterf het. In 2022 het 85 mense in Suid-Afrika weens hierdie siekte gesterf. Gedurende 2023 was daar 149.000 nuwe HIV-infeksies in Suid-Afrika aangemeld. Hierdie jaar het ongeveer 68.000 mense plaaslik weens vigs gesterf. 1 uit elke 4 mense wat HIV positief is, kry tans nie behandeling nie. Equal access and equal rights to quality care for all is a necessity. However, we do have to guard against making false promises to people in terms of free healthcare and treatment like the NHI. Healthcare is never free and someone has to pay for it. Nagenoeg 40 miljoen mense wêreldwyd leef tans met HIV en vigs en ons het tydens die COVID-19 tydperk gesien dat die vorige administrasie nie in staat was om self teenmiddels te vervaardig nie en moes Suid-Afrika in die agterspeen suig en beklei om die krummels van die wêreld in die hande te probeer kry. Net soos wat ons nou die geval is met Mpox, moet ons tans ook sukkel om teenmiddels in die hande te probeer kry. Suid-Afrika versak tans sy landsburgers as dit kom by die doeltreffende voorkoming en behandeling van pandemies. The time has come that South Africa take the lead again in the world of medicine development. We are housing the world's best scientists. We must just empower them effectively.
Order. What's the point of order, Honourable Member?
Honourable Speaker, the interpretation doesn't work here.
We will assist you by finding a gadget that can assist you to be able to follow. Continue, Honourable Member.
Thank you, Speaker. A safe and scalable way must be found to get rid of HIV and AIDS. We have seen over the years that as soon as the treatment is stopped, for whatever reason, the virus rebounds with results in illness and in early death. Die mediese wetenskap is belangrik en ons moet ophou om die wetenskap te sien as 'n luukse. Die Suid-Afrikaanse Mediese Navorsingsraad kry jaarliks net sowat R750 miljoen om sy navorsing te doen, terwyl die harde werklikheid is dat daar tussen 2 en 3 miljard rand benodig word om voldoende wetenskaplike navorsing te kan doen. South Africa needs to invest more in our own medicine research and development to help our own people, to enable them to have access quality care for all. The time has come for us to stop looking the world in the eyes for the little they are willing to give to us, and it is time for South Africa to stand on its own feet again, to take care of ourselves and to be self-sufficient. We can shout from the rooftops of the world, equal rights, equal access to quality care for all, but the reality is that the world is looking after its own first. We can change that. What we ourselves will do to achieve standing on our own feet will determine the fate of multitudes of South Africans who urgently need help and treatment. We cannot let our people down again. I thank you, Speaker.
The next speaker is the Honourable Letlape.
Thank you, Deputy Speaker. One of the key challenges that I've had in this field is the fact that HIV manifests medically, but it's a socially driven disease. And we cannot treat ourselves out of this pandemic. And we need to look at the factors that contribute towards HIV and AIDS. Promote responsibility. And the key to eradicating HIV and AIDS is to empower women. Einstein has the theory of relativity, which has a capital E equals to MC squared. And I use that in talking about prevention of HIV. The big E is for empowerment of women. The small m is for male rehabilitation. And the C squared is for squaring our efforts on prevention to make this thing work. If we don't change the social fabric of our society, we will never see the end of this. This is one area where you can look up to the WHO for the medical side. But if we want to survive as a society, we have to own up to the fact that we are infecting ourselves. We are not infected by a bug coming from somewhere overseas. This is not like COVID. This is something that is personally acquired. And HIV is not highly infective. And if we do not change the fabric of society, where women are not respected, where women are not economically empowered, if we can't get the girl child to want to be with someone else, not because they can't fend for themselves, we will never see the end of the pandemic. We need to talk openly about the culture that denies women their human rights. We can't talk about being a democracy and we fund cultures that don't uphold human rights. If we cannot ensure that in our country there's gender equality, we will not come out of this mess. The key lies in getting rid of the notion that men are superior, men are not accountable, and men cannot behave appropriately. We need to ensure that sexual offenses are treated like murder. What I mean by that, it should be the state versus Mr. X, and the family can't withdraw the case. When you've murdered, even if it's at home, nobody can withdraw the case. The state takes it to its logical conclusion. Women have been poisoned to be the ones that save these perpetrators. And we need to ensure that they are empowered. This has not been this way. When you go into African cultures in particular, prior to the 1800s, they respected their women. Post the Native Land Act, they started disrespecting their women. It is no irony that the only march to the union buildings was women fighting for their men. And if we do not restore dignity to women, we will not stop this pandemic. No matter how many chemicals you get, no matter how advanced research you have, it's respect for women and holding men accountable that is key to dealing with this pandemic.
Thank you, Honourable Letlape. I now call on the Honourable String.
Honourable Deputy Speaker, the theme for this year's AIDS Day is Take the Rights Path, My Health, My Right. And whilst the ACDP applauds the addressing of inequalities that hinder progress in ending HIV and AIDS, we have, however, consistently stated that one's rights must be balanced with responsibilities. The right to health rings hollow when one is overcome by illness or disability and without hope. It rings hollow when, while striving to protect the human rights of the HIV/AIDS infected and ensuring their access to health care, those suffering from the disease have insufficient, little or no access to adequate health care. The ACDP has campaigned from the outset of the HIV/AIDS pandemic for improved standards throughout the healthcare industry to enable more people living with HIV and AIDS to access antiretrovirals, including nevirapine for newborn babies. We are pleased to see several promising developments in the fight against HIV and AIDS, such as the ruxolitinib and the lenacapavir, an injectable HIV medicine which has shown overwhelming efficacy in preventing HIV infections, which is administered only twice a year, representing a significant improvement over daily oral medications. However, mental health issues, including depression, anxiety, and substance abuse, continue to affect many HIV/AIDS patients. These conditions have increased across the population in the aftermath of the excessive lockdowns, resulting in family instability. The ACDP asserts that behavior change communication strategies must be implemented, including media campaigns, peer education, and communicating mobilization, not forgetting the Ugandan ABC model, which means abstain, be faithful, and in the view of the ACDP, the C, Christ, is the answer. The ACDP supports the voluntary medical male circumcision initiative shown to reduce the risk of HIV transmission. However, we are concerned that TB associated with HIV co-infection is complicating HIV treatment and control efforts and presenting a significant challenge in South Africa. We could learn more from countries like India, which draft legislation in order to reduce the cost of essential medications, particularly HIV and AIDS. And in conclusion, by fostering a culture of health and well-being, acknowledging our responsibility in providing grassroots service and valuing the privilege of good health, the ACDP believes that we can advance the opportunity for everyone to lead their best, healthy, and fulfilling lives. I thank you.
The next speaker is the Honourable Nontenja.
Honourable Speaker, World AIDS Day serves as an important reminder that we must remain steadfast in our commitment to prevent new HIV infections and provide essential support to all people living with HIV, and to remember those who have died from AIDS-related illnesses and those who are affected. As a nation, we should be considerate of the fact that there is still a critical need for increased funding for the AIDS response to increase awareness on the impact of HIV on people's lives, to end stigma and discrimination, and to improve the quality of life of the people living with HIV. Awareness campaigns need to be intensified, more especially in rural areas and townships, because people living with HIV are still severely judged and discriminated. The discrimination goes beyond to public clinics, whereby people with chronic diseases are made to stand in separate queues to collect their medication. This makes people default on their medication due to the stigma that is promoted by clinics. Another critical issue is the lack of mobile clinics in rural areas, as there are limited clinics and very far from each rural area.
Many people, especially men, are unwilling to walk miles just to check their HIV status. They only visit clinics when symptoms start to overwhelm them. It is therefore crucial that we have mobile clinics that are constantly stationed in rural areas and other marginalized areas. In considering the fact that there are people across the country who struggle to remain on treatment due to socioeconomic and infrastructural constraints, the Department of Health should ensure that there is a plan to reach out to all communities. Makubuyiswe onompilo. We hear that the Department of Health is about to introduce a new medication to the South African public. There is a belief that this new treatment could significantly slow down new infections because it only has to be taken twice a year, and it can help reduce the risk of forgetting to take a pill daily. This could play a significant role in ensuring that a larger proportion of those who know their HIV status are not only receiving treatment, but also achieving viral suppression. I thank you.
I now call on the Honourable Ghana.
Nakhensa Mtramashitulu. Mtramashitulu, ours is a story of resilience. In debates like this one on World AIDS Day, there is a temptation to focus on what is not working. I want to reflect on the remarkable progress we have made in the fight against HIV/AIDS over the last 3 decades. This battle is intertwined to the story of our democracy. 30 years ago, HIV was a death sentence for many, surrounded by fear, stigma, and misunderstanding. Medical knowledge was limited, treatments were virtually non-existent, and communities were devastated by the relentless spread of the virus. But today, the story has changed significantly. HIV is no longer a death sentence. People are living longer, thanks to the efforts of government, civil society, the business community, and South Africans at large. One of the most groundbreaking achievements has been the development of the antiretroviral therapy. This life-saving treatment has transformed HIV from a fatal disease into a manageable chronic condition. Millions of people living with HIV now lead healthy and productive lives. In the 30 years of this battle, we have also witnessed incredible advancement in prevention methods. Additionally, the prevention of mother-to-child transmission programs has ensured that countless babies are born HIV-free, giving families hope for a healthier future. However, while we celebrate these achievements, we must acknowledge that the fight is far from over. Millions still lack access to treatment. Stigma, in some instances, continues to hinder progress, and vulnerable populations remain disproportionately affected. Mtramashitulu, the progress we have made in the last 30 years is a testament to what humanity can achieve when we unite against a common challenge. Let us not lose momentum. Instead, let us recommit to the fight, ensuring that the strides we have made inspire us to work harder until we achieve a world-free HIV and AIDS. Honorable members, the vision of an AIDS-free generation is within reach, but only if we work together. We must unite to ensure education, prevention, and treatment are prioritized. We can't stop. We must never stop. Let us recommit ourselves to the cause, not just today, but every day, until we eradicate new infections, ensure treatment for all, and create a world where HIV and AIDS is no longer a threat. Nakhensa Mtramashitulu.
Thank you, Honourable Ghana. The next speaker is the Honourable Webster.
Thank you, Madam Speaker.
As we approach World AIDS Day, which is this Sunday, it's very important that we do reflect on the progress that we've made as a nation against HIV/AIDS, but also that we recognize the resilience of the human spirit. There are 8 million South Africans who live with HIV, and their courage and determination is a reminder and should remind us of the strength of the human spirit. We should also recognize the lived realities that communities who support those living with HIV/AIDS face every single day. We also must look and acknowledge at the achievements that we've made as a country. We cannot ignore the fact that, as it is today, we have over 5 million people who access antiretroviral therapy, and this is a monumental achievement. It has increased life expectancy, it's reduced AIDS-related deaths, and it's driven down the mother-to-child transmission rates to less than 2%. These are triumphs, and we must absolutely celebrate them, but we must also recognize that there are then a responsibility to sustain and expand on these achievements. We have to look at the realities that we now face with 4,000 adolescent girls every week who are infected with HIV/AIDS, and 77% of those coming from sub-Saharan Africa. So this is not just a health crisis. When you look at the fact that these are young adolescent girls, it is a crisis of inequality. It's poverty, it's unemployment, it's gender-based violence, and this is what creates conditions that make millions of South Africans vulnerable. Honorable members, we cannot address the challenge of HIV/AIDS without addressing the socioeconomic drivers and the issues that we find in our societies. We must also look at our healthcare system, which should be at the forefront of defense against HIV/AIDS, where we have clinics and hospitals that are under-resourced, healthcare workers that are overburdened, and infrastructure that is in decay as well. In order to be able to continue to fight the issue of HIV/AIDS, we have to look at what the treatment over the years has taught us of HIV. It's taught us that we can achieve much with partnerships between government, civil society, and private sector, and we must take this model and apply it to the rest of our healthcare system in this country. And finally, we must recognize that this isn't just a medical issue. It is a socio-economic challenge. We have got to address poverty. We have got to create jobs. And we have to make sure that there's equality in education, and we eradicate issues in our society like gender-based violence. Only then can we break the chains of the HIV pandemic and many other scourges in our society. Thank you.
Our next speaker is the Honourable Sene.
Honorable Deputy Speaker, our country continues to make remarkable progress in the prevalence of HIV. In 2023, the Human Science Research Council reported that the percentage of all people living with HIV in South Africa decreased from 14% in 2017 to 12.7% in 2022. Translating to about 7.8 million people living with HIV in 2022, compared to 7.9 million in 2017. Madam Deputy Speaker, despite such positive inroads, HIV prevalence in the country remains high, with women and girls being disproportionately affected. Women accounted for nearly 64% of infections in 2021, with Black women aged 25 to 34 years having the highest prevalence at 31.6%, and highest incidence at 4.5%. Such findings are indicative of our society's socio-economic disparities and gender inequalities, which continue to make women inclined to abuse and violence, which compromises their health and lives. We must also continue to move needles on the unique health needs and access challenges faced by key groups in our society, such as members of the LGBTQIA community, sex workers, and drug users. Madam Deputy Speaker, we condemn in the strongest terms the continued victimization and mistreatment these groups continue to face, not only in some health facilities, but also in broader society. Stigma and discrimination play a pivotal role in acting as a barrier to accessing healthcare, and we implore the government for continuing to making strides to address and close these gaps in line with our constitutional obligation, which guarantees everyone the right to life and the right to healthcare quality. In this regard, Madam Chair, we applaud the efforts to decriminalize sex work with an emphasis on expanding access to healthcare and ensuring safer working conditions. Furthermore, we are pleased with the explicit identification of vulnerable groups, such as members of the LGBTQIA community, in the 2023 to 2028 National Strategic Plan for HIV, including targeted programs for at-risk groups such. Madam Deputy Speaker, we also commend the vital role played by youth zones in addressing challenges confronting young people. With over 2,100 primary healthcare facilities with youth zones, we anticipate that young people will be encouraged to access healthcare in safe and tailored spaces to meet their health needs. We live in a fast-growing, digitalized world and must continue to find innovative ways to adapt and leverage these resources to expand access to knowledge in a simplified and accessible manner. The Be Wise Health platform remains relevant as an educational and interactive tool to engage young people with information on HIV prevention, mental health, and also sexual reproductive health. Madam Deputy Speaker, furthermore, we note that the strides being made in the pilots of the injectable PrEP to prevent HIV. Such interventions are critical in ensuring long-term protection, and we encourage further research in these areas. The fight against HIV cannot be won in isolation from the range of socioeconomic and psychosocial factors such as poverty, food insecurity, healthcare, drug abuse, lifestyle, and adherence to ART regime. These factors are detrimental to improved health outcomes by exacerbating people's vulnerabilities, increasing exposure to violence, and limiting sex education and prevention. Poverty denies people access to good nutrition, impairs people's immune system, and also makes it difficult for people to have privacy and adhere to their treatment. To this end, we must continue to strengthen our social security programs such as social grants, which not only cushion people's economic situations, but also have been linked to improved health outcomes. Of course, we enhance social protection. We must be resolute about growing economy and creating jobs. We require intersectional approach to dealing with HIV, grounding it in tailored interventions which address key affected groups, such as resolving our country's socioeconomic barriers, which create a breeding ground for vulnerable and poor management of HIV infections and increase the rise of new infections. The antidote to introduce infections can and must be the UN program on HIV and AIDS, whose premise is that 95% of people living with HIV know their
Honourable
HIV
Member,
status.
your time has unfortunately expired.
I thank you.
I now invite the Honourable Sali.
Thank you, Honourable Speaker. Assalamu alaikum to all. Today we gather to reaffirm our commitment to fighting HIV and AIDS, a challenge that continues to affect millions in our beloved country. First and foremost, let us honour the resilience of those living with HIV. Their courage in facing stigma and adversity inspires us, but we must address the factors that perpetuate the epidemic. Social economic circumstances that we find ourselves in. HIV stemming from rape remains a sickening reality. A critical aspect of our fight against HIV is the promotion of moral responsibility and behavioral change. Risky behaviors such as unprotected sexual relationships and substance abuse contribute to the spread of HIV. While we have made progress, it is clear that we must strengthen our efforts in education and awareness. Responsible actions within homes is vital. We must start by engaging our youth. Schools must serve as hubs for accurate, age-appropriate sexual health education. Schools must engage with parents and religious leaders on the content of sexual education. But it is alarming that some media platforms, movies, social media, content, glamorize behaviors that increase vulnerability to HIV. This is not a call to censor, but to act responsibly. We need media that empowers people to make informed decisions, promoting healthy, respectful relationships. Despite widespread availability of protection, inconsistent condom use remains a significant problem. The South African National AIDS Council reports that 73% of adults know their HIV status. Only a fraction of sexually active individuals use condoms regularly. Distribution campaigns must be coupled with education, ensuring that people understand the importance of protecting themselves and their partners. Communities have to take an active role in fostering environments of accountability and support. Faith leaders, cultural influencers, and local organizations can champion behavioral change while addressing harmful social norms. However, let us be clear. Addressing HIV is not about laying blame. It is about fostering compassion. Those living with HIV need not just treatment, but dignity. Initiatives like the Undetectable, Untransmittable campaign highlight how antiretroviral treatment empowers individuals to live full lives while preventing the widespread virus spread. South Africa this challenge is vast, so too is our potential to overcome it. By promoting responsibility, intensifying awareness campaigns, and fostering support for the affected, we can work toward an HIV-free generation. Together, we will ensure that this epidemic no longer defines us, but rather strengthens our resolve to unite, uplift, and persevere. I thank you.
I do not see a speaker for the NCC or the PAC. Good. I now invite the Honourable Clerk.
Thank you, Deputy Speaker. Once again, it's the time of year that we observe World AIDS Day. We pay tribute to those we've lost, honour the resilience of those living with HIV, and renew our commitment to fight against HIV/AIDS. This day compels us to reflect on our shared struggles and the progress we've made, while urging us to confront the challenges that still stand in the way of a healthier, more equitable South Africa. South Africa's journey with HIV/AIDS has been both painful and transformative. We face stigma, systemic failures, and immense loss. Yet we've also witnessed strength of our communities and the bravery of countless individuals who stood up for truth, dignity, and care. Their courage continues to guide our path forward. The legacy of icons like Nkosi Johnson, Justice Edwin Cameron, and Dr. Glenda Gray reminds us of the human spirit's power to overcome adversity. Nkosi's advocacy as a child shattered stigma. Justice Cameron's openness as a public figure challenged prejudice, and Dr. Gray's groundbreaking research exemplifies the kind of innovation that saves lives. Their work underscores that when people have equal rights and equal access to care, lives change and barriers are broken. But today is not just about celebrating progress. It is a sobering reminder that South Africa remains the epicenter of the global HIV crisis. With over 7.8 million people living with HIV, we account nearly for 19% of the global HIV cases, while representing just 0.7% of the world's population. This disparity highlights not just the scale of the epidemic, but the urgent need for sustained, targeted interventions. The glaring inequalities in access to healthcare continue to hinder our progress. While South Africa has made strides in providing antiretroviral treatment, our public healthcare system is overburdened, underfunded, and plagued by inefficiencies. These issues disproportionately affect those in rural and underserved areas, leaving the most vulnerable without adequate care. It is imperative that we focus our attention on strengthening public health care, and this does not mean vilifying the private health sector, which plays a vital role in our health system. Instead, we must address the inequalities that perpetuate the two-tiered system, where access to quality care depends on one's social economic status. The goal must be public health care systems that provide equal rights and equal access to quality care for all. Achieving this requires bold action. It means prioritizing funding for public health facilities, ensuring that every rand is accounted for and spent efficiently. It means improving the working conditions of health professionals, equipping clinics with the tools they need, and tackling corruption that robs citizens of critical resources. Stigma and discrimination remain among the most insidious barriers to healthcare access, particularly for those living with HIV. Fear, shame, and misinformation still prevent too many from seeking testing, treatment, and support. As leaders, we must champion national campaigns to dismantle these harmful perceptions, promoting a culture of understanding and compassion. The COVID-19 pandemic further exposed the weaknesses in our public health care system, straining resources and disrupting services, including HIV/AIDS programs. We cannot allow these setbacks to define our future. Instead, we must use the lessons learned to rebuild stronger, more resilient systems that put people at the center of care. World AIDS Day also reminds us of our global commitments. The United Nations' ambitious goal to end AIDS as a public health threat by 2030 is within reach, but only if we act decisively. South Africa must align fully with the UN 3 pillars, preventing new infections, ensuring access to treatment, and ending stigma and discrimination. In doing so, we must recognize that health is a human right, which richer or poor, urban or rural, every South African deserves the dignity of quality care. A strengthened public health system will not only serve those living with HIV, but will uplift our entire nation, ensuring that no one is left behind. In closing, let us reaffirm our commitment to equal access to quality healthcare for all. Let us honor the memories of those we've lost and stand with millions living with HIV. Together, let us fight for a South Africa, a world where HIV is no longer a daily reality. For our heroes, our communities, and the future of our children, this is a fight we cannot afford to lose. I thank you.
I now invite the Honourable Tleku.
Honorable Deputy Speaker, members of Parliament, South Africans, good afternoon today. Honorable Deputy Speaker, the commemoration of World AIDS Day by the South African government under the theme Equal Rights, Equal Access to Equal Care for All is to demonstrate that as this government, we believe that healthcare is a human right. I therefore remind all South Africans that the African National Congress manifesto is emphatic on the strengthening of health services to make quality healthcare affordable and accessible. The commitment by political leadership of our government is commendable. The coordination of HIV/AIDS interventions through the South African AIDS Council, as chaired by the Deputy President of the country, through strategic partnerships, meaningful collaborations, and following global efforts to fight HIV/AIDS have yielded good results. As 77% of HIV/AIDS patients have been initiated on the antiretroviral therapy. South Africa is implementing the global strategy of ending HIV/AIDS by 2030. This is in line with our NDP as South Africans. The strategy is fostering accountability on progress towards the fight against HIV/AIDS. The global targets of 95, 95, 95 are focused on strengthening preventive measures and ensuring that everyone knows his or her status. This impresses upon urgency of early treatment, initiation, and universal access to treatment to improve health outcomes and prevent deaths. The strategy by the UNAIDS is towards zero transmission and zero HIV/AIDS related deaths. Honorable Deputy Speaker, the UNAIDS 95, 95, 95 targets change the narrative that if you are HIV positive, you will die tomorrow. All what it suggests is that 95% of people who know their HIV/AIDS status are receiving HIV treatment, and that 95% of people on treatment are virally suppressed up until it is undetectable in your blood system. The benefit for this is that the virus in one's blood may be undetectable, and if undetectable, it is also untransmittable, resulting in protecting your partner and the newborn babies. All what I can say is that we must protect the next. We must leave no one behind. And 95% is possible. And it is possible. Sekela somlomo wendlu somthetho masinome igalelo lalo rhulumente we-African National Congress kwiphulo lakhe lokukhusela abantu ebebefunyenwe sisifo sengculazi. Esi sifo sasikade sisaziwa njengombulalazwe, into eseyiliphupha kule minyaka. Bayakwazi abantu boMzantsi Afrika ukuzikhusela. Bayakwazi abantu boMzantsi Afrika ukukhusela abanye ukuze bangosuleleki. Kwabo bathe bosuleleka bayakhuthazwa ukuba baye kumaziko empilo kujongwe ingculazi egazini, ithi yakufunyanwa baqaliswe ukunyangwa. Sekulula ngoku kuba kwakukade kutyiwa iipilisi ezininzi, ngoku seyinye le pilisi iselwayo. Kungoko ndisithi awunyanzelwa ukuba ujongwe ingculazi, koko uyakhuthazwa ukuba wazi ngempilo yakho khona ukuze ufumane unyango kamsinya. To defaulters, I can suggest that they go back to any health facility kuba kuyo yonke lento sithetha ngayo kuyaqaleleka. Masibacenge abantu abangootata noobhuti, njengoko ebesitsho apha umphathiswa wezempilo esithi ootata ngabo abarhuqa inyawo. Waphinda watsho elinye ilungu apha komnye umbutho lathi makuxhotyiswe amanina kuba ngawo anoyithatha le mfazwe ayise ekupheleni. There is nothing to politicize around this subject. Ours is to join hands and fight the virus. Okwethu is to unite and save the people of South Africa. I thank you, Deputy Speaker, for allowing me the opportunity. Thank you.
Thank you, Honourable Member, and that concludes the debate. The Secretary will read the second order.
Consideration of report of Standing Committee on Appropriations on Division of Revenue Amendment Bill.
I now recognise the Honourable the Chief Whip. The Honourable Chief Whip, I recognise you now. We're on the second order.
Thank you, Deputy Speaker. Good afternoon. And I move that the report be adopted. Thank you.
The motion is that the report be adopted. Are there any objections? Honourable Mhlangwini.
House Chair, can you please note the objection of the EFF?
The objection of the EFF is noted. And with that, the motion is agreed to. The Secretary will now read the third order.
Second reading debate, Division of Revenue Amendment Bill.
I now call on the Honourable Chairperson of the Committee, Honourable Mai Mane.
Honourable members, fellow South Africans, Bachai Tsudumela. Firstly, let me acknowledge the work of the committee and the Standing Committee on Appropriations and the support staff for the work that they've put in being able to put this report before this House. I want to also acknowledge, honourable members, that we find ourselves in a very, very globally difficult position. I begin with the words of Nelson Mandela in saying that may our choices reflect our hopes and not our dreams. President Mandela said these times, in a time where we were uncertain about our own democracy, and now even today, we face difficult choices as this House. We find ourselves that for every R1 that is tabled, 22 cents of it goes to debt, 38 cents of it goes to cost of employees, and the majority of which is either spent on social grants. In the medium term, our expenditure is exceeding revenue. We now arrive at the maturation of what the 7th administration or the 6th administration has brought to us, where we are at the maturity of all ills of the past, whether those are state capture, etc. Our wriggle room is no longer there. If we fail to make choices today, honourable members, later is not going to serve us well. And therefore, I want to challenge this House today that when we look at the division of revenue, we begin to make tough choices. I celebrate the green shoots that have begun. We're starting to see an improvement in our currency, a reduction in interest rates, and more than anything, our interventions on fighting grey listing are well noted, and for that matter, I want to congratulate the Minister of Finance. Along with that, honorable members, I also want to highlight that we face some profound and flashing lights. We face load reduction in certain communities, we face water throttling or water reduction, and we face fiscal slippage. So I want to propose a number of things that I believe we need to do to make the difficult choices that will express our hopes. The first is, I think we need a better strategy around managing debt. If we don't, we already are spending over R1 billion a day on servicing debt. We all fear the fact that whilst the intended objective is at 75%, our debt will peak at 75% of GDP, we fear it could exceed that. So, honorable members, growth is but one strategy, but I want to urge that we invest in SARS for better collection and we ensure that we digitize the state and use blockchain technology to avoid corruption. The second is, I think we need to make some tougher policy adjustments. It is long overdue that the white paper on municipalities can be reviewed. The 90-10 split is no longer holding. The reality is, as Salga have already stated, municipalities cannot meet their bills, and ultimately they will owe ESCOM. ESCOM will come knocking here for more bailouts, and we will end up in this circuitous cycle where we bail out SOEs and fail to meet our objectives. I want to suggest that we review the equitable share formula. Thirdly, honorable members, municipalities must become economic engines, not just places of just registration of spaza shops, but they must become places where we can pay service providers on time, ensure that the roads are working properly, the lights are on, water is provided. For businesses don't operate nationally, they operate from a municipality and a locale. We have to restore our confidence globally. We are making choices every day, honorable members. The truth is, we can fund the ICJ case, we can send troops to the DRC, or we can increase the bloated cabinet, but all of that also means we're taking away doctors from hospitals, we're taking away teachers, and those are the choices we're making. So I urge us to educate our youth, keep our citizens healthy and safe. Minister, I think you will have our commitment when I ask you to truly let's stop bailing out SOEs. We simply don't have the financial revenue to keep going and bailing out state-owned enterprises that are underperforming. Ultimately, if we are to achieve our hopes, may the shared dream that sits to be one where society can see employment and more of our people working. Let's build a better middle class, because we'll ultimately be able to meet more revenue and pay our objectives. May our choices reflect our hopes rather than our fears. Let's make tough choices today, honorable members. Thank you very much.
The next speaker is the Honourable Bartlett.
Good day, honourable members, honourable chairperson, honourable speaker. The 2024 medium-term budget policy statement was tabled at a period when our economy has relatively recovered from the impact of COVID-19 induced global recession. The current pattern of the decline of inflation globally and in South Africa presents an opportunity to accelerate the positive outcomes of the implementation of the economic reconstruction and recovery plan. Quarterly labour force survey outcomes of a reduction of unemployment by 1.4% is a major indicator of the potential advancements which we can record when we strengthen the capability of the state and have increased investments. The 7th administration under the ANC-led government of national unity is at a crucial phase of the last medium-term plan implementation of the National Development Plan. The government of national unity has set 3 priorities for the 7th administration. Priority 1, inclusive economic growth and job creation. Priority 2, maintaining and optimizing the social wage. And priority 3, being a capable, ethical, and developmental state. The 2024 Division of Revenue Amendment responds to emerging challenges due to unforeseen and unavoidable expenditures. The reality of climate change disasters is upon us, and as a country, we are experiencing annual disasters, particularly due to the floods. Major adjustments of the 2024 Division of Revenue respond to the effects of flood disasters. In the Western Cape, an additional 948 million was allocated for the province to restore various economic and social infrastructure. 300 million is allocated to support the agriculture sector through the Comprehensive Agricultural Support Program grants. And 70 million is allocated for education infrastructure. Honorable Speaker, grants which will ensure secure teaching and learning in schools impacted by floods. One of the important lessons from the KZN, Gauteng and Northwest disaster in 2022 is the importance of ensuring local government and provincial departments have the requisite capacity to secure grant funding on time to timely respond to the impact of disasters which disrupt the provision of public and private goods and services. As a country, we need to continue to develop our disaster risk financing capacity to ensure timely funding and preparedness to effectively respond to climate change disasters. The ANC welcomes additional allocation of 685 million rand allocations for a municipal disaster recovery grant, which will contribute to supporting recovery interventions from the flood and from surges in December 2023 and July 2024 for 10 municipalities in the Eastern Cape, worth 319.3 million rand, and for 4 municipalities in the Free State by 48.1 million rand. The adjustment further allocates 152.4 million for 7 municipalities in KZN and 87.6 million rand for 4 municipalities in Limpopo, and by 76.6 million rand for 4 municipalities in Mpumalanga. To have a sustainable financing approach for disasters, a comprehensive approach is required to cover public and private assets. Many developed countries are struggling to provide cover for disaster funding. One of the key tasks of the 7th administration is to ensure the state has sufficient disaster risk financing. The Climate Change Act provides a framework for adaptation and mitigation of climate change disasters, and we need to ensure that all spheres of government have an adequate level of disaster preparedness with the requisite capacity, plans, and budget allocations. The appropriation adjustment responds to the continued need to support public transport and the taxi industry as a critical component of our public transport system. The taxi industry supports school learners, workers, and job seekers and provides mobility for millions of South Africans. The Taxi Relief Fund will contribute to enhancing the financial sustainability of the taxi industry, and this will further advance the formalization of the industry. Infrastructure is a priority expenditure item of the Division of Revenue Adjustments as a priority area of government to catalyze social and economic development. Sanitation is an area of weakness in a number of communities in our country, and public investment in developing and maintaining sanitation infrastructure is crucial and critical. Sanitation is linked to the dignity of humanity. Through the appropriation adjustment, 225 million rand is allocated for the Drakensberg municipality, which is funded through infrastructure BFI. It's a reform to the budget process that supports execution of national priority projects by establishing specialized structures, procedures and criteria for committing fiscal resources to public infrastructure spending. One of the major advances of the medium-term budget policy statement prioritized the attraction of private investment in public infrastructure through public-private partnerships. The review of the public-private partnerships framework should not only create ease for partnership establishment, but enable a cost-neutral approach for the state while preserving ownership and control of public infrastructure. Transparency and ensuring partnerships enable the utmost benefits of ownership and management of the assets. Capital allocation for infrastructure is critical, and institutional investors, such as pension funds and various asset management companies, need to ensure they allocate assets for infrastructure investment. The catalytic impact of infrastructure development and its job creation capacity will contribute to the reduction of unemployment. Maintaining infrastructure is also a critical area, requiring a focus to ensure reliable basic service provision and to support economic development. Our democratic government has, over the past 30 years, expanded access to basic services, and we must maintain reliable service provision. We call on the National Treasury to continue to strike a balance when implementing cost containment measures. This requires supporting grants, which will ensure secure teaching and learning in schools impacted by floods. One of the important lessons from the KZN, Gauteng, and Northwest flood disasters in 2022 is the importance of ensuring local government and provincial departments have the requisite capacity to secure grant funding on time to timely respond to the impact of disasters which disrupt the provision of public and private goods and services. As a country, we need to continue to develop our disaster risk financing capacity to ensure timely funding and preparedness to effectively respond to climate change disasters. The ANC welcomes additional allocation of 685 million rand allocations for a municipal disaster recovery grant, which will contribute to supporting discovery and recovery interventions from the floods and storm urges in December 2023 and July 2024 for 10 municipalities in the Eastern Cape worth 319.3 million rand, and for 4 municipalities in the Free State by 48.1 million rand. The adjustment further allocates 152.4 million rand for 7 municipalities in KZN and 87.6 million for 4 municipalities in Limpopo. 2F, the appropriation adjustment responds to the continued need to support public transport. The departments to also develop innovative and alternative forms of finding priorities to attain justice. We support the revision of revenue amendment bill as it responds to the changing condition in the implementation of the 2024 budget. I thank you very much, Honourable Chairperson.
Thank you, Honourable Bartlett. The table has not received a name for a member of the MK. Honourable Douglas, please take the podium.
Thank you, Honourable Speaker. I greet you all in the language of my ancestors, the language of the Khoi and San First Nation Aboriginal people of Southern Africa, Kaites. I also greet you all in the name of my Father, Heavenly Father Yahweh, and our Lord and Savior Jesus Christ and the Holy Spirit. The Division of Revenue Amendment Bill B13 of 2024 presents yet another missed opportunity to address the deep inequalities and systemic challenges facing our country. It is evident that the DA-led ANC coalition government continues to prioritize the elite at the expense of the poorest and most vulnerable in South Africa. The bill may claim to provide equitable resource allocation, but its content reveals a stark reality. This government is committed to maintaining the status quo rather than transforming the lives of our people on a day-to-day basis. Allow me to unpack the key areas of concern with facts and figures that demonstrate the urgency of the situation and the failure of this government to serve the majority of our people. Honourable members, both MK Party in the Appropriations Committee and the Financial and Fiscal Commission has been clear in relation to the issues raised in this debate. The outdated formulas for allocating resources through the provincial equitable share and local government equitable share are no longer fit for purpose. It doesn't work and we need to change it. Provinces like Eastern Cape, Limpopo, and KwaZulu-Natal, which face higher levels of poverty and unemployment, receive allocations that fail to reflect their needs. For example, unemployment in the Eastern Cape stands at an alarming 56.6%, yet this province is expected to deliver the same level of services as wealthier provinces like Gauteng and the Western Cape, which has far more revenue-generating capacity. Municipalities are expected to generate 90% of their revenue despite widespread unemployment and poverty. This is an impossible task, particularly for rural and peri-urban municipalities, where more than 41% of residents cannot pay for basic services. The result? Persistent service delivery failures, crumbling infrastructure, and communities left without water, sanitation, or electricity on a day-to-day basis. Similarly, the reduction of 225 million rand for bulk infrastructure in Drakenstein municipality comprises critical sanitation projects. This is not just a budgetary adjustment, that is a direct attack on our dignity of our people, particularly women and children who bear the brunt of inadequate sanitation services. The Parliamentary Budget Office has revealed shocking statistics. Only 13% of municipalities achieved clean audits in 2022-2023 financial year. This means that 87% of municipalities are failing to manage public funds responsibly. Ghost employees, irregular spending, and wasteful expenditure have become the norm, while communities are left to suffer. For instance, municipalities owe Eskom over 56 billion rand, yet the Eskom Municipal Debt Relief Program is tied to impractical conditions that force municipalities to forfeit their electricity distribution licenses. This creates additional financial strain and further jeopardizes service delivery. Honourable members, the state of education infrastructure in South Africa is a national disgrace. According to Equal Education, over 6,300 schools still lack access to sustainable water, and 13,655 schools require adequate toilets. Addressing these backlogs would require 35 billion rand, yet this bill offers piecemeal allocations that barely scratch the surface of these serious problems. The overcrowding crisis is equally dire, with 70,043 additional classrooms needed to accommodate our learners across the country. Despite this, provinces like the Eastern Cape have seen budget rollovers instead of urgent action. The promise of free and quality education remains a distant dream for millions of children, but not under MK. Healthcare is another area where the government's failures are evident. According to the University of KwaZulu-Natal, poor healthcare and poor eye care alone affects 1 in 10 South Africans, particularly women and the elderly. Yet healthcare infrastructure remains underfunded and mismanaged. The allocation of just 6.5 million rand to the Health Facility Revitalization Grant is laughable in the face of widespread health system challenges. Patients continue to die in overcrowded and understaffed hospitals, while medical professionals are overworked and under-resourced, primarily because of medical legal claims that have been allowed to balloon and consume billions of rands meant for healthcare services, as the DA-ANC-led coalition government has failed to stop. The local government white paper of 1998 is long overdue for review, as highlighted by both the Financial and Fiscal Commission and SALGA itself. Municipalities are collapsing under the weight of debt and unfunded mandates, with over 339 billion rand in consumer debt owed to them. This government's refusal to update the fiscal framework is condemning municipalities to perpetuate failure. SALGA has also pointed out that current conditional grant structures are inflexible and fail to account for emerging challenges like climate change. This rigidity prevents municipalities from responding effectively to crises, such as the floods that devastated the Western Cape, KZN, and other provinces. The additional 684 million rand allocated to the Municipal Disaster Recovery Grant is welcome, but history tells us that these funds are often mismanaged and siphoned for corruption. Corruption and inefficiencies mean that the intended beneficiaries, vulnerable communities, rarely see the impact of these allocations. The government's slow response to disasters is another major concern. The Western Cape floods occurred between December 2023 and July 2024, yet it was taken nearly a year for meaningful allocations to be made. This lack of urgency exacerbates the suffering of affected communities. Honourable members, the MK party rejects this bill because it is not pro-poor and it does not address the systemic issues facing our country. Our vision is grounded in the people's mandate and the principles of economic justice.
Honourable Douglas, please take your seat. There is a member of the MK who wished to take a point of order. Honourable member.
No, House Chair, the Honourable Taika is drowning our speaker. He's drowning our speaker, Chair. He's out of order.
Could you please refer to which member? Honourable member, are you referring to the Honourable Minister?
I don't know his name, Honourable Taika. Honourable Mantashe.
Honourable members, earlier the Speaker also requested you to please keep the discussions and the comments at a level where the Speaker can be heard. Honourable Mantashe, this was also directed at you, so please keep the discussions down. Honourable Douglas, please proceed.
MK's vision is grounded in the people's mandate and the principles of economic justice articulated by President Jacob Zuma, who reminds us that we cannot claim to be free when the majority of our people still live in poverty. The MK party calls for a complete overhaul of funding formulas to ensure that allocations reflect the realities of poverty and unemployment in provinces and municipalities. We call for increased investment in critical infrastructure, particularly in education, healthcare, water, and sanitation. We call for stricter measures against corruption with real consequences for officials who misuse public funds. We call for flexibility in conditional grant structures to allow municipalities to respond to crises while maintaining accountability. We call for a focus on economic justice with budgets that prioritize job creation, poverty alleviation, and human development over debt stabilization. Honourable members, this DA-led ANC coalition government continues to betray the people of South Africa. The Division of Revenue Amendment Bill is not a step forward, it is a step backwards. It fails to address the urgent needs of our people and perpetuates a system that benefits the few at the expense of the many. As we approach the first anniversary of the MK party to be celebrated at Moses Madiba Stadium in KwaZulu-Natal on the 15th of December 2024, I want to wish President Jacob Zuma and all MK members continued strength as we fight for South Africa that prioritizes its people and prioritizes getting our people out of poverty. And we need to take the land back. We must stop talking about business as usual and just appropriating from just the current tax bases. We need to grow our tax base, and the way we grow our tax base is by taking the land back and redistributing it to the people who own the land so that we can take the minerals and we can take it and beneficiate it and not ship it out raw like you are for your own pockets. We are going to make sure that we manufacture our goods. We're going to take those manufactured goods, export it, build new cities, and create wealth for our people. Take them out of poverty, eradicate the townships, eradicate the shacks that you guys have left us in for over 30 years. The blood of our people is on your hands. The GNU's blood has got the blood of our people on your hands every day. We need to stop this, and as MK, we are refusing to accept that the GNU will continue the way it is. We're stopping this by letting MK take back the land, take back the resources, and expropriate without compensation so our people can come out of poverty. I thank you.
The next speaker is the Honourable Burke.
Flames.
Madam Speaker, this bill is asking us to pour water into a bucket riddled with bullet holes, quite literally. Moshe Lefuma was murdered this weekend. He was a DA councillor working at the Maluti Apofong local municipality. He was shot in the head, killed together with his mother. Last week, our friend and patriot, and Tate Lefuma was doing his job, which is also our job. He was holding the government accountable at a press conference where he pointed out how the municipality failed to investigate over 8 billion rand in unauthorized, irregular, fruitless and wasteful expenditure. We have seen councillors and civil servants inside provincial departments killed. And so I ask, how long before the assassins come for us parliamentarians? Madam Deputy Speaker, we urge the Honourable Minister of Police to bring to book those that would treat my home province of the Free State as the Wild West. We trust that this case will be investigated with all the resources that the murder of a anti-corruption councillor demands. That this will not be yet another unsolved murder, all too common in rural South Africa. So today, Madam Deputy Speaker, we're being asked to vote for a bill that will send more money to municipalities suffering from cadre deployment. Maluti Apofong has had an outstanding audit for the last 3 years. This means they refuse to even send financial statements.
Honourable Burke, please just take your seat. Honourable members, I have asked a few minutes ago that you please keep your conversations toned down and not shout across the floor. It is disrespectful. When other speakers are speaking, you expect them to listen. Could we please show the same kind of respect to all the speakers addressing this House and the voters and public outside? Please proceed, Honourable Burke.
Thank you, Madam Deputy Speaker. It's not lost on me that those that have already interrupted the growth path of this country is now trying to interrupt my speech. As I was saying, Madam Deputy Speaker, Maluti Apofong refused to even send financial statements to the Auditor General. And when a councillor then commits the cardinal sin of calling a press conference, that same week they're found dead in a pool of blood. And I wish this was an exception. But everywhere you look, except where the DA governs, local and provincial institutions are falling apart. And yet, we will vote for this bill and send them more revenue because the money that somehow doesn't get siphoned off is desperately needed by the majority of South Africans who still live in poverty. Madam Deputy Speaker, the second problem I have with the Division of Revenue Amendment Act is that the pot of revenue we will divide is far too small. When we asked for public submissions, the feedback we received from many stakeholders boiled down to the same thing. Equal Education, for instance, pointed out that we need to spend more money on schools to achieve the kind of access to learning that our Constitution demands. And Kusatu argued that we need to employ more skilled people to help manage the huge infrastructure investments that our country demands. And I agree with Kusatu. Not something you'd expect to hear coming from the Democratic Alliance. But hey, it's a brave canoe world. But honourable members, we must understand why the pot is simply too small. And the reason is sitting to my left. Why don't we have more tax revenue to spend on schools? Well, perhaps the Honourable Tom Muniane could answer that question. After all, did his restructuring of SARS not facilitate industrial-scale looting by the Guptas and cost us billions that took us years to fix? How much more revenue would we have to divide had the Honourable Muniane never been the SARS Commissioner in the first place? Perhaps we should ask the Honourable Brian Molefe why Eskom fell apart under his watch, why projects ran over schedule and over budget. Perhaps he can consult with his colleague, the Honorable Siyabonga Gama, or with his new national organizer, convicted fraudster, Joe Ndlela.
Honourable Burke, please take your seat. Honourable Marquee.
Chairperson, I'd like you to rule this member in terms of the point of order, rule number 85, that the member is imputing improper motives of our members. He has named them as well. He has done two things. One, imputing improper motives, and he has cast aspersions on our members, and has even named them. Ask you to rule on that, Chair. Thank you.
No, those are facts.
Thank you, Honourable Marquee. In terms of the rules, when aspersions are cast on a member, it is required that a substantive motion be brought to the House if any allegations are made. So, Honourable Burke, I am putting it to you that please bring a substantive motion to the House if you want to make statements such as that. Thank you. You can proceed. Honourable Marquee, I have already ruled. You cannot take another point on a ruling I have already made.
No, member, your ruling is incomplete. He must withdraw up until he brings that motion. He must withdraw.
Honourable Marquee, I am going to ask the member to withdraw, but also advise him that he brings a substantive motion. Honourable Burke.
Point of order, Madam Speaker.
Please proceed, Honourable Michalakis. Honourable Burke, please take your seat.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, I refer you to Rule 85, which firstly says that a member cannot cast personal reflections upon a member's integrity or dignity or verbally abuse a member in any way. The member at the podium from the DA did not cast personal aspersions against the member. He referred to their track record when they were in those positions, and therefore I submit that those aren't personal aspersions. In the case of Honourable Joe Ndlela, I would submit that those aren't aspersions and that those are actually facts. Thank you.
Honourable Marquee, before I give you the opportunity, I am going to rule, which I have already ruled. Honourable Burke, please take your seat. I've not finished yet. Honourable Chief Whip of the DA. Although it was not personal aspersions being cast, it did have a reflection on the integrity, and therefore I ruled that a substantive motion must be submitted to the House, and that is my ruling. I will not entertain any further matters on that. Honourable Burke, please proceed. Correct. I have asked the Honourable Burke to withdraw.
Madam Speaker, Madam Deputy Speaker, to prevent another July riot, I will withdraw my comment.
Please proceed.
Order, Chair.
Honourable Marquee. Honourable Burke, please take your seat. Honourable Marquee.
Thank you, Chair. The member must withdraw without making any preamble. He must withdraw, Chair, without making any preamble. That's your ruling. You must respect that.
Honourable Burke, please withdraw without qualifying it.
An unqualified withdrawal, Madam Deputy Speaker.
Thank you. Please proceed.
As I was saying, both Eskom and Transnet.
Honourable Burke, my apologies, but the Honourable Chief Whip of the DA has a point of order. Honourable Chief Whip.
Thank you, Madam Deputy Speaker. My apologies for interrupting our member. Just for clarity, I just want to ask you, is it now unparliamentary to speak the truth in this House?
Honourable Michalakis. That is not the point. The point is, in terms of Rule 85, as you have referred to, if you do cast aspersions on the integrity...
Order.
Honourable members, I am busy giving a ruling. Honourable Reddy, that is not in terms of the rules. Please allow me to complete my point. Honourable Michalakis, the fact of the matter is that I have made this ruling and I have said to the Honourable Member that he can bring a substantive motion in this regard. It was not a ruling whether it is true or not. Honourable Reddy, I'm not going to entertain any further points on this point of order on which I have ruled. If it is not something new, I'm not going to entertain it.
Madam Deputy Speaker, I draw your attention to Rule of Order 92, 4 and 5 and 6, where it says when the presiding officer has made a ruling, no further points of order will be taken on that ruling. So I would like the Chief Whip of the DA
You are doing the same thing.
take note of that ruling. Thank you.
Honourable Reddy, it was well within my rights to decide whether that is an additional point or not. But what you are now doing is exactly what you say shouldn't be done. So we are going to proceed now with Honourable Burke. Thank you. Please proceed, Member.
Thank you, Madam Deputy Speaker. Both Eskom and Transnet have needed too much of our revenue to fix. Money we should have spent helping our people with roads, with hospitals, with ports, and with bridges. And over the last few months, we've seen daily in our committees how this party attempts to rewrite history, to promote the great lie of 9 glorious years. And I suppose if your surname is Zuma, they were glorious. But for the 60 millions of Africans who lived through them, they were a villainous hell that we are yet to escape from.
Honourable Burke,
Well, we are out of order.
Honourable Member, please take your seat. Honourable Member. Honourable Marquee. Please proceed. What is your point?
Chairperson, clearly this member has no respect for this House and for you as the chair. Despite all your decorum attempts to try and make sure that this House is maintained, he continues to stare. Please rule on this unruly behavior of this one.
Honourable
Please
Marquee,
check.
and I'm now going to rule. I will not entertain other points of order. I am now going to rule. Honourable Burke, please take your seat. Honourable Marquee, that was not a point of order. And we will now proceed. I do not entertain your point
Chair.
of order any further. You made no
He
point
mentioned
of order.
Rule 92, 4, 5 and 6.
He mentioned, he mentioned the Zuma surname. The Zuma surname is the surname of this party. He's a member. There's a member in this party with that surname. Therefore, Rule 85 is invoked here.
Please take
He
your
has
seat.
cast aspersions.
Please take your seat. That is not a point of order. Honourable
You must
Burke, please
withdraw.
proceed. No, there is no point of order.
No one will speak here.
Honourable Member, I did not recognise you. Honourable Burke, please proceed and complete your speech.
He must withdraw, Chair. He has to withdraw. We can't allow him to speak. He must withdraw.
Madam Deputy
That
Speaker,
was not my ruling.
it's not surprising that a party that does not believe in the Constitution would try and impede on my freedom of speech in this House. As I was saying, while we've lost those 9 years...
He must withdraw, Chair. We are very serious about this. He must withdraw.
Honourable Member, whoever is speaking, that is not my ruling, and if you are unhappy with my rulings, please take it to the Rules Committee, as you should well know is the process within the rules. Please proceed, Honourable Burke. Honourable Reddy, I will not entertain your point. Honourable Burke, please proceed.
Order, Deputy Speaker.
Honourable Reddy, I did not recognise you, and I'm not taking your point of order because you are taking points of order on points of order that I have given. Honourable Reddy, please take my decisions to the Rules Committee. Please do that. Honourable Burke, please proceed.
Thank you, Madam Deputy Speaker. The consequences of those 9 years are still felt. It's felt in the limited revenue.
My hand is up, Chair.
It's felt in the limited revenue that we're able to divide in this bill, and it's felt in the pit toilets of schools.
My hand is up, Chair.
It's felt in the wait while you die
Chair,
in hospitals.
my hand is up.
It's
Honourable
felt in the
Member, I have not recognised any of you now. Who
But
is
you can't
speaking?
ignore my hand. You don't know the color of my hand. You can't ignore my hand. My hand is up.
Well, your hand is up. It doesn't mean that I have to recognise it immediately. What is your point?
No, thank you very much, Chair. Please, Chair, do not ignore my hand because I raised my hand and I did not open the mic. You deliberately ignored my hand. That's one. I wanted to find out if the member is willing to take a question.
Honourable Burke, would you like to take a question?
Madam Deputy Speaker, much like they did at Transnet, the MK is trying their best to derail my speech, so
Chair.
no, I will not take a question.
He will not take a question.
Because I
please.
wanted to know who is he referring to his people.
Honourable Member, he
As
did
I was
not
saying-
take a question. Honourable Burke, please proceed. I'm not entertaining any more questions. Honourable Reddy, the Honourable Member
Madam
there at the
Deputy
back.
Speaker, it is not a new question, it's a point of order.
Honourable Reddy, if it is not a new point of order,
It is not, it's a
I
new
am
point
ruling
of
you out
order.
of order.
It's a new point of order.
What is your point of order?
Madam Deputy Speaker, I rise in terms of Rule 82, a reference to a member in respectful terms. Now, the Speaker there mentioned the surname Zuma. We have a Zuma in the House who is an honourable
Honourable Reddy,
member. He
I
has
have
not
already
referred
ruled on
to the
that
member-
point.
No, that was
If you
raised,
do
that
not
the point
want
raised,
that
the,
point-
No, the rule was a different rule.
No, it was
a different
exactly
rule.
the same one.
No, it was not the same rule. The rule was not mentioned, and I am mentioning the rule. It's Rule 82, and you need to rule on that.
I will
Also,
rule
in
on it,
terms of the
Honourable
rules,
Reddy, if you take your
We are
seat.
entitled to raise a point of order at any time, in any debate.
Honourable
You are aware
Reddy,
of that.
Honourable Reddy,
No, this
in terms
member
of
is
that
deliberately
particular rule that you are
interfering with
raising
the
right
decorum
now,
of this House.
you are...
Honourable Speaker, don't shout.
Because I cannot hear myself because the Honourable Reddy is shouting. Honourable Reddy,
Don't be emotional, please. Don't be emotional.
Honourable Reddy, I am ruling and I have ruled on this point. And I said to the Honourable Marquee, it is not a point of order. And Honourable Burke will now proceed. I've also said, please write to the Rules Committee if you have any issues regarding a ruling I have given.
Speaker, he'll have to withdraw that statement. He has to withdraw.
Madam Deputy Speaker, we cannot allow the blatant hypocrisy of the official opposition critiquing this government's financial decisions. You broke it. You cannot fix it. Worry instead about preparing for all those criminal court cases. And get out of the way of those of us capable of trying to fix this country. Honourable Deputy Speaker, a man was murdered because he was trying to stop corruption. Other men and women sit in this House implicated in corruption. And all of this has become normal. State capture is not over.
Honourable
Looters
members,
continue to haunt our government. And unfortunately...
Honourable Burke,
Hey, withdraw, Anna.
Withdraw.
Withdraw.
Honourable members,
You settler.
You missed the
Withdraw.
apartheid one.
Speaker.
You missed the apartheid.
You missed the apartheid one.
I will now mention the Honourable Marquee.
Allow Honorable Berg to.
I will get to you now, Honourable Marquee.
I can't hear you, Chair.
I will get to you. Just give me a second. I will get to you.
Okay.
Right. Let's start. I am now naming the Honourable Marquee. I am naming the Honourable Reddy. I am naming. Please sit down, Honourable Marquee, so that I can see who is next there. I am trying to see all the names, and we do know that in terms of the rules, honourable members, that if I do name you, I can refer you to the Powers and Privileges Committee for being totally disruptive in this here sitting. I am naming you, Mr. Mkutam. And you will now be referred to the Powers and Privileges Committee. And Honourable Burke will now proceed with his speech. And please wrap up, Honourable Burke. We have spent enough time.
I will conclude, Madam Deputy Speaker, by saying that looters continue to haunt government departments. And not only are they making a killing, they seem to be doing an awful lot of killing. And this must stop. We must arrest the decline of the state and arrest those who loot and shoot. We don't need to look far to find them.
We will now proceed to the Honourable Paulson.
Chair, just before the Honourable Paulson.
Honourable Paulson, unfortunately, the Honourable Mklangwini wants to raise a point. Honourable Mklangwini.
It's not an
order, honourable members.
It's not, unfortunately, Deputy Speaker. My hand have been long up and you have not recognized it.
My apologies,
so
Honourable Mklangwini. Please proceed. Honourable members, I'm trying to listen to what the Honourable Mklangwini is saying. Honourable McPherson, I will get to you.
Thank you very much, Deputy Speaker. Deputy Speaker, one must note that every time that you are presiding over this House, the House always falls into utter chaos because you are biased towards your members. Had you let that member withdraw from the first instinct and not allow a follow-up point of order, the House would have not decayed in the manner that you had to even actually name members. So one must note, every time that you take that seat, you are utterly biased towards your party and you are not presiding this House equally and fairly. And it's an utter shame and it's very unfortunate that you have taken up a role as the Deputy Speaker and you are not presiding to this House pertaining to the rules that we have adopted. But we will take it further on the platforms that we are having as whips. We'll take it further on that platform. But one must note, on this appropriation bill that is vitally so important for many communities that are looking towards it, that you are portraying such bias, presiding efforts on that chair. And that is utter irresponsibleness. Thank you.
Thank you so much, Honourable Mklangwini, but I would really want your speaker now to proceed with his speech. Honourable Marquee, except if you don't want the Honourable Paulson to proceed at this point. Please proceed.
Speaker, I just want to put on record that indeed you are very emotional sitting there. Number one. Number two, I want to put on record that you did not make a ruling that these mics must be switched off. The reason we had to stand up is because some of the people that are controlling these gadgets, they made their own decision without your ruling to switch things off. And now you are busy saying we're unruly by standing up here, and yet you say nothing about your own staff here that is busy switching the mics off. Thirdly, the point that you ruled me on, I rose on Rule 85. I talked about improper, imputing improper motives. Honorable Reddy raises on a different point on a different point on Rule 82, and you conflate the two, and you punish him for something that is fresh, is Rule 82, and you had ruled on me on Rule 85. So indeed, we'll take your rulings to the Rules Committee, and we'll deal with you at that level. Thank you.
Thank you so much, Honourable Mani. I will also take Rule 69C to the Rules Committee and the other structures in Parliament. Honourable Paulson, please proceed.
Thank you very much, Speaker. Thank you very much, Deputy Speaker. Deputy Speaker, today the Economic Freedom
My apologies. Please take your seat. The Honourable McPherson, please proceed.
Thank you, Speaker. Deputy Speaker, I'd like to address you on a point of privilege, specifically to the points that you had ruled on, because I think that the House needs to consider the issue that the Honourable Burke was raising, and which a number of members had risen in terms of 82.3 and 85.2. Now, if the Honourable Burke or any other member refers to the known conduct that has been adjudicated in a commission of inquiry that no member in this House has taken on review, that is not an issue of public debate. That is an issue and an outcome of a judicial commission of inquiry and stands as fact. And therefore, it cannot be an impugning of a member when people have come and testified before a commission of inquiry, and then those matters are related back into this House. And I think, Honourable Deputy Speaker, that needs to be reflected on. Thank you.
Honourable Minister, I have already ruled on that matter. I also allowed the Honourable Ntlangwini to speak quite extensively. Honourable McPherson, I had already ruled on the matter. Honourable Paulson, please proceed.
Thank you very much, Deputy Speaker. Deputy Speaker, today the Economic Freedom Fighters, under the leadership of the Commander-in-Chief and President of the EFF, along with the officials, the leadership of the Gauteng province and Johannesburg region, have led a successful march to the Constitutional Court, where the EFF and ATM are seeking a ruling against Parliament's irrational and unlawful decision not to adopt the findings of the independent panel report on Palapala, which stated that the President has a case to answer. Thank you very much. Deputy Speaker, the EFF rejects the proposed Division of Revenue Bill introduced by the Minister of Finance, and we do this for the same reason that we have raised in the 5th and the 6th Parliament. The Division of Revenue is a piece of legislation that we use to allocate funds raised nationally, mainly through the South African Revenue Service, from corporate taxes, personal income tax, VAT, and some royalties from mining and other revenues. However, together with the equitable share formula, the division of revenue is not the most efficient and practical way to allocate the 2.1 trillion, of which 1.4 trillion is allocated to national government, which includes some conditional grants. 600.4 billion is allocated to provinces, and lastly, 101 billion is allocated to local government. While this particular bill deals with in-year amendments, these amendments on top of the Division of Revenue Bill, which has no capacity to resolve service delivery issues. We say this for 3 reasons, and we have raised this many times before. These reasons, unless addressed, will render the Division of Revenue and all in-year amendments merely desktop assessments with no tangible impact on service delivery. Deputy Speaker, we did not eradicate the colonial and apartheid economy in 1994. Instead, it has continued. The current Division of Revenue, particularly in the era of budget cuts, has no capacity to play a transformative role. What makes this worse is the majority of economic activities take place in 3 provinces, Gauteng, KZN, and the Western Cape. Except for agriculture and mining, which have some activities in Mpumalanga, Limpopo, Northwest, all other sectors, manufacturing, utilities, construction, trade, transport, finance, personal services, and government mainly occur in Gauteng, KZN, and the Western Cape. There is no solution for this problem in the current Division of Revenue framework. There are more indigent households who qualify for free basic services than the number registered. The intention was not to cover all indigent households in the first place because of austerity measures. However, even those that qualify for such services and are on the database of municipalities do not receive enough, as the provision is kept at a bare minimum, like we are doing them a favor and they must just accept whatever we give them. There is no solution to this problem in the current Division of Revenue framework. Thirdly, and lastly, the current Division of Revenue framework is based on an incorrect and baseless operating model, which assumes that municipalities must sell water, sanitation, and electricity to residents, treating them as customers and recovering the cost of delivering these services. However, the reality is that the majority of these municipalities are not viable. Our people do not have money because of high levels of poverty, joblessness, and the continuation of the colonial and apartheid economy that favors a few white minorities. 4 metropolitan municipalities, Johannesburg, eThekwini, Ekurhuleni, and the city of Cape Town, account for 75% of all revenue raised by municipalities. All metros combined collect nearly 70% of all municipal revenue. These are just 8 municipalities out of 257. The majority of these municipalities depend on equitable shares more than their own revenue. More than 65% of their income is from equitable shares, compared to 70% of their own revenue in metros. If anything, in the next 10 years or so, majority of these municipalities will completely collapse with 0 operations, and this is the level of discussion you don't find in this debate. This is the reality, and there's no solution in the current Division of Revenue framework. We don't need cosmetic changes. We need complete overhaul of the Division of Revenue, and we are shocked that the Financial and Fiscal Commission, the Parliamentary Budget Office, and even trade unions are not making this recommendation. In conclusion, Chairperson, we reject the racist allocation of 948 million for flood-related damages only to the Western Cape, based on some idea that only those who spend will get more allocation, while failing to resolve the structural challenges perpetuating the racist apartheid economy. Thank you very much, Chairperson.
The Honourable Hadebe.
Thank you, Honourable Deputy Speaker. The IFP emphasizes the importance of provincial autonomy, as local governments know their people's needs best. Yet this bill maintains a heavy bias towards central government funding, leaving provinces and municipalities under-resourced. We urge that the equitable share be increased for provinces as they manage essential services like healthcare and education, both of which remain under strain in underserved areas. Our communities face deteriorating infrastructure, especially in rural areas. Although this bill contains allocation for infrastructure, we note insufficient provisions for rural roads, schools, and healthcare facilities. For South Africa to succeed, we need substantial targeted investment in rural areas which align with commitment to uplift rural communities and bridge the development gap between urban and rural areas. While the bill allocates funds to health education, we remain deeply concerned with the slow pace of addressing these sectors' crisis. Specifically, rural hospitals and schools are underfunded, understaffed, and in many cases unsafe. We call for an urgent increase in funding to address these deficiencies comprehensively beyond the minimal adjustments presented in this bill. We stand for strong accountability in government spending. The proposed conditional allocations lack clarity on monitoring mechanisms. Without oversight, these funds may be misused and communities could be deprived of essential services. We advocate for greater transparency and accountability measures to ensure funds reach intended beneficiaries and empower citizens to participate in monitoring how their resources are used. In our vision, municipalities should be financially empowered to respond directly to the needs of their communities. Local governments remain dependent on conditional grants that limit their ability to make independent, community-driven decisions. This bill does not sufficiently support decentralization, which would foster local government, local growth, and create job opportunities. Honorable Deputy Speaker, notwithstanding the recommendations and the inputs we've made above, the IFP supports the Division of Revenue Amendment Bill B13 2024. I thank you.
The next speaker is the Honourable Souls.
Thank you, Honourable Deputy Speaker. We supported the Minister of Finance when he tabled the Division of Revenue Amendment Bill in Parliament on the 30th of October 2024 during the medium-term budget policy statement and the revised fiscal framework. At the time, the amount of 251 million to be added to the education infrastructure grant for the Western Cape Rapid School Build program was a proposal pending the fulfillment of certain conditions. We note in the report that those conditions has been met and thus the addition approved. This material development drives us to continue our support of the report, but we must highlight our concern that the Western Cape government places high priority on an increase in money for infrastructure, but does not balance that priority with the loss of educators due to budget constraints. We can't overlook the fact that the Western Cape government returned 829 million to the national fiscus due to underspending over the past 4 years. Furthermore, the racial disparities in the budget allocation policies for infrastructure development by the Western Cape Education Department, when we consider the fact that even with an 8% increase in the budget, communities like Menenberg still only have 2 high schools, whilst there are 11 primary schools that feeds it with learners. The solution can't be an increase in investment in infrastructure only. There must also be an increased investment in employing more teachers instead. The Western Cape gets more money for infrastructure whilst losing more teachers. The Western Cape faces the loss of 2,400 teacher posts. What is the use we have bigger classrooms with a ratio of 1 teacher to 50 learners per class in communities where predominantly black and colored Africans in particular lives? Whereas in the more affluent areas, the ratio is 1 teacher to 18 students on average. Let us take serious the concerns raised by the Financial and Fiscal Commission, the Equal Education and Equal Education Law Center respectively, especially the concern that there is not a budgetary commitment to the requirement of the Bella Act that an amount of 5.26 billion should be used for teachers, for the teachers' wage bill. I am a product of teachers. I cannot celebrate my progress to this point without thinking about Mrs. O'Hill and Mr. Marlon Lowe and all my teachers in primary and secondary school. Goedes moet balance vir ons teasers. We support this report. I thank you, Honourable Speaker.
Thank you, Honourable Souls. The next speaker is the Honourable Wessels.
Thank you, Honourable Deputy Speaker. Deputy Speaker, the money bills process which introduced the Division of Revenue Amendment Bill was for the first time done in this fashion 14 years ago. At that stage, there was also a shift where more money was given to lower spheres of government. But these additional allocations, in the majority of cases, was especially on local government level, not spent for the purposes it was appropriated for. Conditional grants for infrastructure are misspent or underspent in a lot of cases. Equitable share, which is supposed to enable municipalities to deliver free basic services to poor households, are not spent for that purpose. More than 10 million poor households should receive free electricity if you look at the allocation in terms of the equitable share. But in reality, only 2 million households receive such. 58% of municipalities are currently in arrears when it comes to the contributions of pension funds of their employees. Municipalities utilize these funds to pay salaries or to fund other goods. The majority of municipalities are in real terms financially or unsustainable and are not functional. The plan to address this in the last 14 years have been to amalgamate distressed and inviable municipalities into larger, mega-sized municipalities. We should be honest, Deputy Speaker, that this did not yield the desired results. Municipal areas are now too large, and this leads to further collapse of service delivery and infrastructure. One of the problems, thus, is the local government model, where structural reforms and a rethink is desperately needed. Maar die ander probleem, agbare adjunkspeaker, is ook 'n kultuur van selfverryking en van selfsug, wat die afgelope 14 jaar veral gevestig is in veral plaaslike regering. Munisipaliteite, agbare Douglas, is veral in die tyd van u president wanbestuur en leeg geplunder. Dit tesame met die totale wanbestuur en staatskaping onder sy presidentskap is wat verantwoordelik is vir die huidige leiding van die meerderheid Suid-Afrikaners in hierdie stadium. Want die totale verkeerde en wanbesteding het daartoe gelei dat ons ekonomie al hoe swakker doen. Without economic growth, there's no revenue. Without real economic growth, especially in these rural municipalities, you can't have service delivery and development. And it's because of this culture of corruption and rather breaking than building that we are where we are today. Dit is tyd, agbare adjunkspeaker, dat die van ons wat wil bou, wat Suid-Afrika die toekoms in wil vat, moet saam staan en dat ons werklik moet begin bou en dat ons nie korrupsie, wanbesteding en wanbestuur en totale nonsens meer moet duld nie. Ek dankie.
The next speaker is the Honourable Beasley.
Speaker, with regards to the Division of Revenue Amendment Bill, there are two areas of concern that Action SA would like to raise. Firstly, with 170 billion being allocated to municipalities, Action SA is deeply concerned that a vast portion of this money is being wasted through corruption and incompetence. There is no doubt that there is a lack of governance and accountability in municipalities. In the latest Auditor General's report into municipalities, the AG's finding included 3.4 billion of infrastructure grants had gone unspent, 7.4 billion had been lost to fruitless and wasteful expenditure, 24.1 billion in unauthorized expenditure, and only of the 257 local and district municipalities, only 34 achieved a clean audit report, a mere 13%. Municipalities across the country are failing with devastating consequences for service delivery and economic growth. I take the municipality where I come from, eThekwini, where the sewage and water infrastructure is collapsing with devastating impacts. Continuous beach closures due to the sewage crisis have caused tourism to plummet. The latest private testing for Durban beaches revealed that all but one should remain closed. No wonder the Deputy President declined my invitation to swim in Durban's waters. Non-revenue water stands at almost 55% in the city. This inefficiency costs over 2 billion annually, while many residents and businesses endure limited or no access to water as a result of these significant losses. In a time when our country is facing huge fiscal constraints, it is imperative that there is value for every expenditure item. With nearly 10% of government's non-interest in expenditure being allocated to municipalities, it can't be that this money continues to go down the drain. Something needs to change. In this regard, Action SA calls on National Treasury to implement urgent steps to ensure there is greater accountability for money directed to municipalities. The residents and businesses of failing municipalities deserve better. National government, and particularly National Treasury, as a custodian of efficient and effective financial management, must play its part. And secondly, Speaker, Action SA raises concern that the National School Nutritional Program is seriously underfunded. The importance of the National School Nutritional Program cannot be overstated. Nearly 9.7 million learners in over 21,000 schools depend on this program. The funding of this program has not kept up with food inflation or the increased number of learners depending on this program. Children are eating less, with many being vulnerable to malnutrition. Action SA calls on the National School Nutritional Program to be properly costed from a zero base and any shortfalls urgently to be made good. Hunger has been described as a slow violence. In our country, no child should go to bed hungry. No child should be subject to slow violence. The School Nutritional Program must be properly funded. Speaker, I thank you.
The next speaker is the Honourable Swart.
Thank you, Madam Deputy Speaker. The ACDP has taken note of the committee report on the Division of Revenue Bill, and as we know, National Treasury transfers more than half of the nationally raised revenue to 9 provinces and 257 municipalities. And in order for these two spheres of government to execute their mandates, these financial resources are given through equitable shares and conditional grants. Now we know the crises that are facing many of our municipalities. Many are unable to pay for electricity and water services. This causes a knock-on effect to Eskom and water boards, and it results in a collapse of services. Potholes are rarely fixed, water and electricity cuts are regular, municipal salaries are not paid in certain cases, and ratepayers can rightfully feel that they are not getting value for their money. Service delivery protests are rife, often accompanied by violence. And this perhaps explains why increasing numbers of households are not paying municipal bills. And this then becomes a vicious circle, because if revenue is not collected, municipalities cannot pay for services rendered. Now, when one has regard to Eskom, and despite the efforts of National Treasury to assist municipalities with debt relief to Eskom, there has only been limited success with this program. And maybe we need to mention, for example, the Rand West City has benefited from a 1/3 debt write-off. They have complied with the conditions for the Eskom write-off, and well done to them. However, the financial situation of the top 14 Eskom defaulters remains critical. Additionally, there's a danger with write-offs, and that is what is known as the moral hazard. Municipalities knowing that these debts will be written off. Now, the ACDP believes that, as other speakers have referred, there is a desperate need for a review of the local government equitable share formula, as well as the provincial share formula, but particularly when it comes to local government share. These still make use of data from the 2010-2011 Income and Expenditure Survey, and it cannot be correct because it must be outdated, and it is outdated. In addition, the phased release of the 2022 census data and questions about its reliability have also delayed the update of the equitable share formulas, and we believe that this must be done as a matter of urgency. Lastly, the ACDP also takes note that the committee refers and is concerned about the funding requirement for the Bella Act. How can it be that 5.2 billion is needed for educators and 12 billion for infrastructure, yet no provision is made for the medium-term budget policy? We've got other problems with the Bella Bill, but this is a significant problem. And the ACDP believes that these aspects need to be looked into. I thank you.
Thank you, Honourable Member. The next speaker is the Honourable Zibi. To be followed by the Honourable Webster.
Thank you, House Chair. Firstly, let me state that Rise Mzansi supports the passing of this Division of Revenue Bill. The overriding conversation since the Minister of Finance tabled the medium-term budget policy statement in October has been about fiscal and budget constraints and the impact these will have on the South African people. But I also want to say that as people entrusted to make important choices on these matters, we should ground ourselves in the reality facing us, not the one that we wish we had. This debate takes place a few hours after the Auditor General officially released a consolidated report on the Public Finance Management Act audit outcomes for the 2023-2024 fiscal year. The report is a useful guide on areas of executive and parliamentary oversight that need to be the focus of our attention so that the funds allocated in this vote and in future votes deliver the best value for money we can secure for the South African people. We are not swimming in money, but there is enough money here to lessen the pain for millions of South Africans. We need to spend it wisely. Madiba, I am asking you to remind your cabinet colleagues of their special responsibility in this regard at every cabinet meeting. And I'd like to make a few points. First, we cannot continue overpaying for goods and services in a time of need. You yourself, in a previous budget speech, mentioned this very problem. Financial and cost inefficiency robs us of billions of rand that could better be used to serve the South African people and the South African economy. Second, infrastructure project delays are a waste of money by another name. The project management ability of the public sector must improve, and where municipalities and provinces have a track record of poor project delivery, the national government must step in sooner and more assertively to prevent further waste. Third, the state must know where its assets are. Each year, the Auditor General knows with increasing strain that state entity asset registers are shambolic. We cannot extract maximum value from assets whose existence we cannot confirm. Lastly, we must invest in stronger financial and governance management controls, because the money that is entrusted to various agencies and government departments must go exactly where it is supposed to go. We must pay good value for money, and we must ensure that the objectives that we set to achieve out of every budget vote are met. We are in a time where we must count our pennies so we have enough money for more rainy days to come, and so we can cushion South Africans from the pain of a tight fiscal environment. I thank you.
Thank you, Honourable Member. The next speaker is the Honourable Webster.
Thank you, House Chair. Let me start, first of all, by underscoring the importance of this piece of legislation. This piece of legislation ensures that the government delivers on its promises to the people of South Africa, and without the proper allocation of funds, the government can't operate. As Build One South Africa, we support this bill, particularly in its updated and reallocated funds across the 3 spheres of government. I want to underscore the fact that this bill is a response to the realities on the ground and keeps up with the pace and the challenges that are faced by South Africans. It's always critical that even in our engagements on such bills, we place the people of South Africa at the center of everything that we're saying and that we're debating on. We want to particularly welcome increases in 3 key grants because they represent meaningful investments into the young people in this country from cradle to career. So first, we'll start with the Early Childhood Development Grant. It's an essential step towards increasing the number of ECD centers in this country, and that democratizes the access to education in our country. Secondly, the National School Nutrition Program grants. This program really is a lifeline for many young South Africans, but also it is a way in which we keep young people in school and make sure that they have the best opportunity to be able to, in future, contribute to the economy in our country. And last, the Math, Science, and Technology grant. This is an initiative that focuses on developing core skills that our economy is in desperate need of, and making sure that we prioritize these areas in order to be able to build a competitive workforce for our country. So, House Chair, while we celebrate these investments, we do have to say we are equally firm in demanding accountability. South Africa's resources are highly strained, and every rand must be stretched and not squandered through inefficiency or stolen through corruption. This is why, as BOSA, while we support the bill, we're calling for a war on wasteful spending. Our public finances are strained, and it's inexcusable that funds that are actually intended for the most vulnerable, funds that are actually intended for the development of this country, and the 61 million, which I've mentioned, has got to be at the center of all our deliberations and decisions, are squandered. We have to ensure that every cent allocated under this bill is spent wisely, prudently, and responsibly. Financial prudence is not just fiscal policy. It's actually ultimately, especially in a developing economy like ours, a moral obligation to the people that we serve in this country. Thank you.
Thank you, Honourable Member. The next speaker is the Honourable Galeka Mazibuko.
Honourable Deputy President, honourable members, fellow South Africans, honourable House Chair, the appropriation of funds for the 3 spheres of government is distributed through an equitable share for the local, provincial, and national governments through the Division of Revenue Bill. The Division of Revenue, House Chair, allocates a relatively lower percentage for local government, which is currently 9.8% of the revenue. Despite this, the national and provincial governments allocate funds for local municipalities to provide various basic services through conditional and non-conditional grant allocations. These grants ensure local government municipalities with different financial capacities have supplemented resources to meet their constitutional mandate. A major contributor to the capability of local government to spend allocated funds is having the required technical capacity to plan, implement, and manage the whole project life cycle and the life cycle of the assets. Planning the life cycle of assets is critical, House Chair, to ensure adequate operations and maintenance are undertaken on time and the required funds are allocated. This will ensure that the government's provision of basic services is efficient and reliable. Honorable Minister, the committee is concerned about the reported misuse of grant allocations for their intended usage, which undermines the intended objective of the grant. This has a significant impact on developmental objectives, undermining policy implementation. In the review of the grants, consideration should be made to have emergency grant responding to emerging challenges to ensure conditional and non-conditional grants are used for their intended purpose. We welcome the merging of the Comprehensive Agricultural Support Program grant with the Litsima grant and the Education Infrastructure grant with the School Infrastructure Backlog grant. This will optimize the prioritization and management of grants. The committee is concerned with the Community Library Services grant being incorporated into the provincial equitable share, as this can result in a lack of prioritization for community libraries. Honorable members, to develop and harness literacy and innovation, a culture of reading and knowledge sharing is critical for the nation. We call on the Minister to enhance its measures to ensure the National Treasury implements robust monitoring and evaluation systems which will enable a detection of misuse of grant allocations on time. Another area of concern is the rate of underspending, which defers much-needed development by communities. We believe that responding to the skills audit study of the technical capacity of critical infrastructure units undertaken by the National School of Government and the Human Sciences Research Council is fundamental in diagnosing and developing an appropriate support intervention to build internal technical capacities and reduce outsourcing of services which our state institutions should have. We must remember, honorable members, that the consequential effect of outsourcing key technical services results in the state's inability to develop and the required capacity. A critical area that the Auditor General has highlighted as an area that needs attention is the quality of a number of infrastructure projects which display poor workmanship, undermining the quality of expenditure. With a higher risk of climate change, the quality of infrastructure should be disaster resilient to ensure durability, which we will continue to reconstruct, impacting our ability to finance and develop new infrastructure. The third priority of the Government of National Unity under the leadership of President Cyril Ramaphosa is to build an ethical and capable developmental state which meets the developmental needs of the people and upholds the human rights of all South Africans. Accountability over the use of public funds, House Chair, is an imperative which should be continually advanced to improve the quality of expenditure. A major area which requires the attention of the National Treasury is ensuring we enhance the accountability of transfers made by national departments to different spheres of government and public entities. Accountability of appropriated funds appropriated to votes begins with the national executive, and therefore the robustness of the mechanism is important to ensure the quality of expenditure and to achieve the objectives of the National Development Plan. There are matters in the public which require clarification to have a contextual understanding of the linkage of policy priorities and budget allocations. Horizontal budget allocations in provinces are determined by provinces based on their policy priorities. In the Western Cape, the province prioritized alternative energy solar projects worth 700 million, while the teacher post requirements are 400 million for the year. Other provinces also allocate funds in a manner that impacts critical social services. The reduction of the wage bill should be balanced with protecting critical positions such as teacher provisioning, nurses, technical functions, and frontline workers. The ANC House Chair welcomes the implementation of public-private partnership projects which focus on critical social facilities, such as efforts to increase the pool of funders to diversify public infrastructure financing through new mechanisms and instruments. These include build, operate, transfer, the BOT structures, and other concessions, like the 2 hospital projects, including a district hospital in Limpopo, landside capacity expansion at the Cape Town Container Terminal, capacity upgrades on the rail network from Walto to Gqeberha, rehabilitation of water infrastructure at eThekwini. This is not privatization, but a way of harnessing our domestic capital markets to support the provision of public goods and services through financing mechanisms. These projects, House Chair, reflect the commitment of the government to increase public investment and attract private investment in infrastructure development, which has the highest multiplier effect for job creation. We must also ensure the transformation of the construction sector value chains in order to maximize redistributive benefits for local producers of construction inputs and constructors. What is critical, honorable members, is ensuring that the financing structure do not result in risky development, which result in failed projects, increasing the state liability. As I take my seat, Honorable House Chair, please allow me to borrow from the words of Mike Ewing and Willis DeVol in saying, I quote, "Exhibiting accountability over the time is a gateway to trust. When we see someone acting with accountability, we gain the evidence we need to trust them." Close quote.
Honourable Member, your
The
time is
ANC
now
supports
expired.
the division of revenue, zikhonkotha ehambayo.
The next speaker is the Honourable Wakeland.
Honourable House Chair and members, the Division of Revenue Adjustment Bill established a forward-looking focus. The amendment budget strongly reflects our commitment to fiscal discipline, to create an environment that ensures economic growth, and to address unemployment. On the matter of the adjustments, I would like to highlight 4 critical areas where adjustments were made: the Education Infrastructure Grant, the Road Infrastructure Grant, the Agricultural Support Grant, and a Disaster Management Rehabilitation Grant. The allocation of 321 million for school upgrades, 521 million for road infrastructure, and 300 million for agricultural support to subsistence and emerging farmers in the Western Cape is commendable. This shows a caring Western Cape government that has complied with every aspect of the condition to get approval for these grants. And to the honourable member of the PA, it's because the Western Cape has done their work that I have got additional grants. The allocation of 684 million to municipal infrastructure that was affected by disasters comes as much needed relief to those people affected by man-made and climate-related disasters. We as a country need to be proactive, identifying risk associated with this phenomenon. However, Speaker, we must address the delays in approving and releasing these disaster recovery funds, with some cases that is dating back as far as July 2023. This is unacceptable. We cannot, and could good conscience, rest comfortably when our fellow citizens are suffering. Our government needs to be proactively prepared for these disasters. We need to assist provinces and municipalities that do not have the capacity to deal with these disasters. We need to do it better, faster and smarter. Although these budget adjustments are necessitated by the impact of migration and growth in the Western Cape, this brings me to my main point. The formulation we use for the division of revenue needs to have a complete redesign, as the current formulation does not give a true reflection of our people's movement in settlement in this country. More and more people are moving to the Western Cape for better opportunities. This reflects a well-run government. On a matter of budget planning and budget execution, departments and provinces and local governments are failing to execute their mandates and spend their grants and allocations. Capital and infrastructure budgets grants are badly executed. This requires the GNU to seriously intervene, and we will execute our mandate as a GNU partner. Effective execution is essential to ensure that funds allocated for capital and infrastructure development translate into meaningful economic and employment outcomes. This challenge signifies endemic poor project execution by the departments, by the SDGs and project managers. This raises a serious question about appointing unqualified personnel that do not have the ability or don't care for their country and their fellow citizens. On a matter of weak intervention regarding the audit outcomes, the GNU must confront the ongoing decline in audit outcomes and the weak implementation of audit action plans at departmental, provincial, and municipal levels. For too long, accounting officers has got away with bad audit outcomes. We cannot continue to allocate budgets to departments that are not good stewards of our taxpayers' money. Another matter to be addressed is the overpayments for goods and services to suppliers. This gravy train must be stopped in its tracks. But it's also true that long and overdue payment cycles and sometimes no payment to suppliers by government must also be stopped. The late payments also kill small businesses. If businesses have delivered, they must be paid on time, 30 days after invoice. This erodes public trust. We must hold accounting officers accountable and demand compliance and transparency of our financial resources. On a matter of bad project implementation and rollovers, Speaker, House Chair, while we excel in project planning, we fall short in effective execution. This is particularly concerning when we look at the implementation of grants by municipalities. Poor project execution leads to massive project overruns, delays, and increase in cost. This also leads to the ongoing culture and expectation to increase and roll over our budgets. This cannot be normal business practice. We need to keep these officials accountable for their actions. In conclusion, the Division of Revenue Adjustment Budget represents a crucial steps in addressing the urgent needs of our society. Let us work together to ensure that these adjustments translate into tangible benefits for our people. Together we can build a brighter future for all. Chairperson, as a DA, we support this bill. Thank you.
Thank you, Honourable Member. The next speaker is the Honourable Lekganyane.
Thank you so much, Honorable House Chair. Greetings to the Deputy President. Greetings to the Chief Whip. Honorable House Chairperson, in all measures of honesty, the undeniable reality that confronts us is that the 2024 medium-term budget policy statement is presented against the backdrop of negative macroeconomic policy indicators, which include the exponential rise in unemployment, particularly among the youth, deepening inequality and widening poverty, the escalating cost of living, the debilitating circumstances of rural women, and the general conditions in historically peripheral segments of our population militate for courageous and extraordinary measures to swing the obstinate socioeconomic pendulum to weigh favorably on our collective pursuit for social justice and the broader transformation agenda. Honorable Chair, notwithstanding the difficulties, we have witnessed a noticeable and significant improvement in electricity availability. This has happened just over a year since the appointment of the Minister of Electricity, and congratulations to Honorable Ramhope. History has once again refused to induct armchair critics, gibberish pocket handkerchief activists, and grandstanding gimmicks who poo-pooed the appointment of the Minister of Electricity, expectorating at the logic and dismissing it as ridiculous and ludicrous. Lokono Rabona Mutla Shiaki Kudu. Honorable House Chair, the introduction of the first phase of reforms under the aegis of Operation Vulindlela is gradually bringing stability in our logistics sector. And in this regard, Honorable Chair, we also want to congratulate Sanral, for Sanral has distinguished itself as the mainstay in public infrastructure investment in this country, creating opportunities for our people. The 2024 MTBBS provides an insightful reflection and determination by government to ensure policy certainty, consistency and predictability, whilst building on the strides made since the historic democratic transition. Thus, the pillars of the MTBPS are aligned to the priorities outlined by the President during the opening address of Parliament. Both the opening address and the MTBPS echo the perspective of the Economic Recovery Plan, which aims to rebuild and redevelop the South African economy from the ravages of the pandemic and the period of avaricious plunder. The pillars of the MTBPS are an injunction to government to align its national planning along the set priorities and ensure that fiscal and monetary policies support these objectives. Central to the success of our objectives is the pursuit of a capable, ethical, efficient, and effective developmental state. The deteriorating state of local government, compounded by persistent financial difficulties and inability to deliver basic services, is posing the greatest risk to the quest for a developmental local government as envisaged in the 1998 White Paper on Local Government. The President alluded in the opening of Parliament address that, open quote, to achieve rapid inclusive growth, we need to fix our struggling municipalities. Growth happens at a local level where people live and work. Our municipalities must become both providers of social services and facilitators of inclusive economic growth, close quote. Without an effective local government, macroeconomic stability is threatened due to socioeconomic constraints that emerge out of its ineffectiveness. Local government should be the pivot or the pivot in the implementation of growth-enhancing reforms. The opportunities presented by Operation Vulindlela should find expression in municipal programs and be properly coordinated through the district development model. Honorable House Chair, we must review the local government white paper and take the different economic contexts which impact on the viability of municipalities of different categories. White paper assumptions must be based on existing economic social data. Our national support and financing approach has to be differentiated if we are to tackle the obstinate legacy of apartheid special development. This will require a strategy that enables the allocation of sufficient human and financial resources at a local level which is close to the people. Over the last 25 years of local government, we have transitioned municipalities from institutions that began in small offices with no resources or local revenue base, with the establishment of transitional local councils in 1995 to the local municipalities we have since 2000. We have major local government institutions which we should build upon, and the Constitution of the Republic assets a single public service with different concurrent functions. We support the focus on local government in the second phase of Operation Vulindlela, which is critical to enhancing the capability of the sphere of government or effectively provide services. We need to strengthen the district development model implementation to enhance intergovernmental relations and to mobilize public-private resources for local economic development. One of the risks impacting on the local sphere of government is the debt problem, which impacts municipalities and also impacts institutions which owe ESCOM. Water boards and other debtors. A comprehensive approach is required to deal with the debts among state institutions and also debt owed by businesses and households. And in this regard, we will also want to welcome the progress made between March and August 2024 of compliance with ESCOM. Municipal debt relief conditions by municipalities improved from 55% to 76%, aided by the National Treasury, provincial treasuries, and the Municipal Finance Improvement Program. The Rand West City Municipality in Gauteng, under the stewardship of William Majeke, is a beacon of hope and a shining star in this regard, and we want to congratulate him. We recognize that the majority of the adjustments to the division of revenue are to respond to climate change disasters and welcome efforts to enhance their capacity to manage a multi-layer disaster risk finance approach. Honorable House Chair, the African National Congress has enduringly, in inspirational and admirable ways, eloquently articulated its vision about the South Africa we want. We are unrelenting. We are in hot pursuit of a better life for all. We will never dishonor the cause of freedom. The ANC supports the bill.
Thank you, Honourable Member. The next speaker is the Honourable Minister of Finance.
Honorable House Chair, honorable members, let me start by thanking all members who have contributed to this debate. They were constructive, and the majority of the contributions were constructive. And therefore, we thank them for that. I also agree with the chair of the committee that in constructing a budget, we face difficult choices, and difficult choices have got to be made. We make the point that our challenge is a growth one. I repeatedly make this point, that our challenge is a growth one. Whether we talk about debt or anything debt, it's a function of growth. That's why in the budget we've presented key pillars. Among those are focus on growth. And therefore also the changing composition of expenditure to focus on that growth. Some issues have been raised, one of which is disaster funding, and an allegation that the manner in which it was done is racist. I want to make the point that we have appointed the DBSA to appoint consulting engineers to go through all other provinces whose disaster have not yet been funded. And once that exercise is concluded, we'll be able to fund those provinces accordingly. Key among those provinces is the Eastern Cape and KZN. We're looking into that. Another point I think we should be careful about is the the equitable share, the Constitution enjoins us to divide the national revenue and share it equitably, first and foremost, vertical, between the different spheres of government. Now, how this is done in most cases is the functions. If you look at the functions that are performed by national government and the number of employees in national government presupposes that national government will take a bulk of that. If you look at the provinces, the province take a better share of education, health, and other functions. And those functions are labor intensive. And it's quite important for members to take that into account. We must also not fetishize local government. I must make this point. Otherwise, if we fetishize local government, we're not going to help these local government, some of the local government, to change and deal with things effectively. Let me just give an example. One night, Honorable Hlabisa is invited us into a meeting at night for one municipality, which shall remain nameless for now. The municipality's account has been taken over by ESCOM in order to sort this problem. And indeed, together, Dr. Ramhopa, myself, Minister Hlabisa, and others, we sorted this problem of this municipality. The MEC for Finance of that province tells me the following week, the same municipality employed 100 more people. That's misconduct as misbehavior. And therefore, that cannot be attributed to an equitable share. I think honorable members here have gotten an important task of oversight over those institutions. And it's quite important that as we do so, and some of these municipalities, one member has made this point, deduct pension funds and not pay over to the pension funds. The Financial Service Conduct has given me a list of those. So it's quite important that we don't fetishize municipalities if we're going to do oversight. Honorable Zibi makes an important point, value for money. Value for money. And it is quite important that these committees exercise oversight over us as departments. And some people I can see, most of them, they say Treasury must do this, Treasury must do this. Treasury's function is not to conduct oversight over departments. It is this House's function to do that. What Treasury can do is to provide the information and table reports. An example, in every 3 months, we table Section 32 reports. Section 32 reports are public information which committees must utilize to do oversight. They tell you how much expenditure, which departments are underspending, and which ones are overspending. The same applies to municipalities. Section 71 requires us to do that. We publish that information. And that information is for this House to use it to do oversight. The Auditor General, for instance, has just released a report on infrastructure spending. That information is for departments, is for this House to look at how that infrastructure underspending is taking place in the different spheres of government. Let me conclude by saying, coming back to fundamental structure of what we said. We said our challenge is a growth one. And therefore, we presented 4 pillars of that growth strategy in this House. And that's what the debate must be about, is how do we grow this economy? If we grow this economy, we're not going to have poverty, we're not going to have unemployment. All of those issues are a function of growth. And therefore, we urge honorable members to debate this growth strategy. We have done what we can. The Standard & Poor has changed its outlook for South Africa from stable to positive. That the IMF has also changed its outlook for South Africa in terms of growth. All of those suggest that there's an appreciation and a successful implementation of structural reforms which are giving this growth outlook. Some have made reference to the debt issues. As I've indicated, the debt is a function of growth. We have got to manage that debt in such a manner that it does not grow in such a manner that it crowds out fundamental issues of frontline departments. That's how we have got to manage that growth. Otherwise, thank you, colleagues, for your contributions. We'll take note of every contribution that is made, particularly the positive ones, in moving forward, particularly as we go to the final budget on the 19th of February, 2025. I thank you, Chairperson.
Thank you, Honourable Minister. Honourable members, that concludes the debate. Are there any objections to the bill being read a second time? The EFF?
House Chair, please note the objection of the EFF.
Objection is noted.
House Chair, please note the objection of the Umkhonto weSizwe Party.
Objection is noted. Are there any further objections? With those objections being noted, the Secretary will read the bill a second time.
Division of Revenue Amendment Bill.
The bill will be sent to the National Council of Provinces for concurrence. The Secretary will read the fourth order.
Consideration of Budgetary Review and Recommendation Report of Portfolio Committee on Social Development.
I now recognize the Honourable, the Chief Whip of the largest party. We are attending to the problem, Honourable Chief Whip. There should be a roving mic. You may, Chief Whip, approach the podium.
Thank you very much, Honourable Chair. Good afternoon to you. I am standing up to move that the report be adopted.
Thank you, Honourable Chief Whip. The Chief Whip has moved that the report be adopted. However, we have received requests for declaration of votes. I will now allow political party representatives to make the declarations for 2 minutes, maximum of 2 minutes. The Democratic Alliance.
Thank you, House Chair. The budget assigned to the Department of Social Development and its entities, SASSA and the National Development Agency, is meant to bring dignity to the marginal and vulnerable members of our society. When these funds are squandered and misused, human beings suffer. In the midst of 16 days of activism of no violence against women and children, the once proud Gender-Based Violence Command Center remains closed. It has been closed for over a year after the department's decision to appoint a new service provider which could not deliver on its contractual obligations, a situation reminiscent of the scandalous CPF SASSA contract, 390 million rand still unrecoverable from the liquidated company Net1, which still reflects on the balance sheet prime for condonement. hundreds of millions of rand condoned by National Treasury doesn't change the fact that taxpayers' money is being flushed down the drain while millions of children go to bed hungry and victims of GBV have nowhere to turn. Social grants are still paid to ineligible beneficiaries, and fraudsters have easy access to siphon off millions meant for the poor. Fraud and corruption within SASSA will continue without an independent, adequately funded, and capacitated Inspectorate for Social Assistance. The National Development Agency is a shadow of its former self, a 220 million rand per annum black hole, of which 60% pay salaries of officials with inadequate monitoring of civil society organizations to ensure that funds are spent as per the terms of the agreement. From the Director General position throughout senior management, vacant positions are plenty and long-standing, creating an environment of instability as officials rotate constantly in acting capacity. The ripple effect of this inability, instability, and vacuum of leadership is reflected in the mediocre performance of the department.
Honourable Member, your time is now expired. MK. May I also request the honourable members to move to the front. There's waiting benches to the right and to the left of the podium. That will save time, because it can be quite difficult to get right from the back to the front when your name is called.
Wena sasiqalwe. Siwumkhonto wesizwe siyaphikisana nale budget. Ngisukuma nokuhlonipha ke ubaba wethu indoda emadodeni ubaba wethu uJacob Zuma. Ngibingelele wonke ama MK commanders nabahlali base South Africa. Wena sasihlalweni ngithanda ukuveza ukuthi lokho esibhekene nako singabantu abamnyama eSouth Africa akuyona inkinga yayizolo, kepha inkinga eyaqala before even 1994, lapho kubonakala khona abamhlophe becindezela abantu abamnyama. Lokho esiyiko namhlanje kungenxa yabelungu abade besicindezele sonke lesikhathi. Umnyango ke uyahluleka ukuthi ukhiphe abantu kulolu sibonelelo sesikhashana. Umnyango awunazo izinhlelo ezimile ezibhekise kubantu bakithi ukuthi bakwazi ukuphuma kulesi sibonelelo lesi. Lokhu sithanda ukusho ukuthi kungenxa yokuthi ngalesi sikhathi lesi vele sekuhlangenwe nabelungu, vele ubumba nensimbi ayihlangani, futhi lokhu sikulindele ukuthi yinto ezowa khona manje. Lokhu siyakuveza ke njenganomkhonto wesizwe ukuthi kuyinto ephelayo lokho. Abantu bakithi ke balindile, balambile kumanje. Abantu bakithi abanamali kumanje. Imali abayithola abantu bakithi ayikwazi ukuyothenga ikudla kufanele bakudlile. Kungakho sithi njengomkhonto wesizwe le budget lena asihambisani nayo. Ngiyanimema ukuthi nibe khona ngomhla ka-15 sizobe sigcwele iMoses Mabhida. Amen.
Imali yaphelele enkandla.
Order, honourable members, the EFF. Order, honourable members. Order, honourable members.
Thank you, Vice Chair.
Please continue, honourable member.
Thank you, Vice Chair. As economic freedom fighters, we are deeply concerned about the dismal failure of the Department of Social Development to meet its set target. This department is one of the biggest departments with a mandate to manage and play oversight over society's security, encompassing social assistance and social insurance policies to aim to prevent and alleviate poverty in the event of life cycle risks such as loss of income due to unemployment, disability, old age, or death occurring, and yet it fails to do what is right. Minister, they are beneficiaries of the 370 social relief of distress SRD grants, where applicants were approved but never received their money until today. We also have a situation of young people who never applied for SRD grants but are confirmed to be receiving these grants without their knowledge. We must commend the two first-year students, Joel Sendras and Via Kusai from the University of Stellenbosch, for detecting the massive fraud within SASSA, which has now cost the public purse millions of South African rand. It is clear to us that there is a huge corruption and fraud in the system, because as a young person who would not be seeing yourself on a SASSA system as a recipient of a SRD grant, when you have never applied for that SRD grant, this can only mean one thing, that somewhere, somehow, someone is deliberately defrauding the system, thus putting millions of South Africans who rely on SRD grants at risk. In the financial year of 2022-2023, the Auditor General found out that this department underspent by approximately 4 billion, made irregular expenditure, including 3.16 million in overpayment for cash payment service, payment master service, lack of progress to report and track grant inquiries received from the public. SRD grant payments were made to illegitimate applicants. 74 million was paid
Honourable
for
Member,
service
your time is
not
now
rendered.
expired.
We as the EFF cannot support this PRRR. We reject it. Thank you.
Thank you. The IFP.
Honorable Chairperson, the IFP acknowledges the department's report with grave concern. We are deeply troubled by the department's continued failure to address critical vacancies in executive positions, including that of the Director General, Deputy Director Generals, and the Chief Financial Officer, despite clear recommendations in the 2022-2023 Budgetary Review and Recommendation Report that these roles be filled within 3 months. The department has failed to act, undermining its ability to deliver on its mandate effectively. We are also concerned by the lack of transparency and accountability in the expenditure of social grants, particularly the child support grant top-up. The slow intake of vital grants is alarming, especially when applicants report approval of applications but no actual disbursement of funds. We demand clear and actionable responses from the SASSA and the department of how they will address this issue urgently. The regression in the audit outcomes of the department and the National Development Agency from the clean audit 2022-2023 to unqualified audit with findings this year is unacceptable. We insist to robust corrective measures to restore accountability and public confidence. The IFP remains committed in ensuring that the department and its entities prioritize the well-being of vulnerable South Africans by addressing inefficiency, implementing recommendations, and upholding the highest standard of governance. In consideration of the matter we have raised, the IFP accepts the report. I thank you.
Thank you, Honourable Member. The Patriotic Alliance.
Speaker, baie dankie vir die geleentheid. Daar is 'n paar dinge wat my opgeval het in die verslag. Speaker, geen organisasie of besigheid kan optimaal funksioneer as dit nie genoegsame mannekrag het nie. In die verslag is dit kommerwekkend om te lees dat belangrike uitvoerende poste so lank vat om gevul te word. Om die produktiewe tyd van die portfolio te verhoog, wil ek voorstel dat die direkteur-generaal spoedig aksie neem en 'n werwingsproses begin om die vakante poste te vul. Die vermoedens van beweerde bedrog in die departement moet in terme dissipline stappe geneem word en alle beweerde bedrog moet by SAPD aangemeld word en nie net beweerde bedrog oor R100,000 nie. In ag geneem die voorstelle, stel ek voor dat verslag met my voorstelle aanvaar word. Dankie.
Thank you, Honourable Member. FF Plus.
Thank you, Chairperson. Chairperson, it must be noted with great concern that the child support grant, old age grant and social relief and of distress grant had a slow uptake. Complaints were received from applicants that were approved but never received the grants. The Freedom Front Plus condemns the fact that SASSA employees and company directors were receiving social grants when South Africa has high levels of poverty and child malnutrition. These perpetrators must be charged, arrested and prosecuted for these misconducts. But time must also be over for implicated government employees who resign to avoid consequence management and later join another government department. Action needs to be taken against such officials. Material differences were identified between the actual and reported achievement, and payments were also made to ineligible beneficiaries that were deceased or untraceable. Irregular expenditure of a total amount of 67 billion at SASSA and a total amount of 51 million at the NDA is a matter of big concern, and measures need to be implemented on an urgent basis to stop this sort of practice. The lack of consequence management is inexcusable. The deregistering of non-profit organizations is still a matter of concern, since people who receive services from these NPOs are affected in KwaZulu-Natal and in Gauteng. We are concerned about the Gauteng Department's decision to cut this funding, and this matter needs to be resolved urgently. I thank you, Chairperson.
Thank you, Honourable Member. Action SA.
Honourable Speaker, legislation is clear. Failing to provide services to children and families is a transgression, prosecutable in a criminal court. Citizens, you too have the right to approach the courts when DSD fails to fulfill its constitutional obligations. Section 27 of the Constitution guarantees the right to access to social assistance for those unable to support themselves and their dependents. It doesn't say in the next financial year or when resources are available or in 2030. This department failures leaves millions in despair, which is shameful. SASSA, tasked with providing essential grants, has become a cesspool of corruption. It's an embarrassment and indictment on the department that officials scam the system of their own gain, for their own gain, literally taking the food out of the mouths of the most vulnerable. Again, shameful. Section 38 enshrines children's rights to nutrition, to shelter, to healthcare and social services. This, as it stands today, over 79 NGOs are not being funded, or funding has been delayed with all sorts of excuses. Social workers are stretched beyond capacity, unable to meet the needs of struggling communities, some leaving at 12 o'clock, 2:30, and maybe on payday, an hour at work suffices. Child protection measures are inadequate, leaving many at risk because of neglect. At this very moment, 8 children in Goodwood, on the corner of Frans Conradi and Jakes Gerwel, are begging for food and money. In fact, the entire Cape Flats is one big begging corner. Let's see how this department acts now that I've brought it to your attention. Again, shameful. So kan dit nie aangaan nie. Action SA stands firm in its commitment to social justice. We advocate for increased access to social workers, passionate social workers in vulnerable communities, strengthening partnerships with NGOs to restore community-based care. I thank you.
Thank you. The ACDP.
Thank you, House Chair. House Chair, the ACDP would like to commend all those social workers in the country for the assistance they provide to the elderly, vulnerable women and children, and victims of GBV and persons with disabilities, often under extremely challenging conditions. They are there also to assist many families that are struggling with financial hardships. However, there are far too few social workers, and grants to those private sector NPOs that have been offering much needed services have been reduced, delayed, or even withdrawn, placing further burdens on departmental social workers. Now, the country needs 55,000 social service professionals by 2030 to meet the growing demand for social services. However, government currently only employs 23,560, less than half what is expected to be required. Now, social grants are a means of helping the poorest of the poor, and the ACDP supports that. However, given the large numbers, it is expected the number of recipients is expected to increase to 19.5 million by the end of this financial year. This is clearly unsustainable in the long term. And of course, high levels of fraud and corruption, with millions of rands being paid to persons that do not qualify, does not help the situation. In this regard, the ACDP supports the committee's recommendation that social grant payment controls must be improved and welcomes the upgrade of the biometric identification system. In addition, the ACDP believes that grants should be linked to NDA programs. The ACDP lastly supports the committee's view that it is unacceptable that the target to build Kusuleka one-stop centers has not been met. This is a serious impact and impacts the fight against gender-based violence. I thank you.
Thank you, Honourable Member. The UDM.
Honorable House Chair, the United Democratic Movement believes that the department's annual budget allocation of 263 billion for the financial year 2023-2024 is adequate to achieve the objectives of the department. The department just needs to address the challenges of poor financial management and leadership, corruption, fraud, and irregular expenditure within the department. The department entities such as SASSA have been faced with poor services and financial mismanagement, causing chaos within the department whilst affecting poor South Africans. SASSA should play a crucial role to ensure the provision of comprehensive social security services against vulnerability and poverty. The entity serves over 26 million beneficiaries of social grant. However, the ongoing corruption and mismanagement at SASSA are a national disgrace that can no longer be ignored. The recovery of over 148 million in SRD grants paid to ineligible beneficiaries, as reported by the Auditor General, is a scratch on the surface into the scale of systemic failure which lies deep within the agency. HSA also found that payments were made to ghost beneficiaries who were either deceased or untraceable. Payments were also made to ineligible beneficiaries who were on PESOL and GEPF, including SASSA and Postbank employees. Yet there are no convictions or anyone held accountable in the entity or as SASSA.
Honourable Member, your time is now expired.
Thank you, Chair.
Thank you. Rise.
Nakhensa mtshamaxitulu ndirhandza na ku xeweta murhangeri wa vandla ra Rise Mzansi. Mtshamaxitulu and Honourable Minister, during your budget debate, I raised a particular issue, and I decided today to come here so that I can be closer to you. There's an issue that I raised during the budget debate, which you somehow denied that it's a big issue. It's a social issue. The mistake we make as a country is to treat social development only as a grant-paying department, not a department that deals with social ills. We have a new crisis in this country, affecting young people, affecting grant recipients, and it's online gambling. I raised this particular issue. And when I raised this particular issue, you said it's a matter of DTI. And I say to you, it's not a matter of DTI. You are supposed to protect the vulnerable. And on this particular instance, you are not speaking up to the people that are now addicted. Actually, online gambling is more addictive than Nieuwmeester. And the Department of Social Development is sitting back and saying, no, the gambling board must deal with it. It's a social ill. It's a social ill, Minister. And again, I come here to plead with you. When you go back to Cabinet, please speak to your colleagues. We need to deal with the matter of online gambling. online gambling companies are actually targeting young people who are also receiving the grants. They are targeting grant recipients, and yourself as a minister, you are not speaking on this particular matter. I'm asking you again today, please deal with this particular matter of online gambling.
Thank you, Honourable Member. Al-Jamaa.
Thank you, Honourable Chair. Al-Jamaa is concerned about the delay in service delivery and the corruption that has caused harm to thousands of vulnerable people. It is concerned that several vacancies in critical executive positions in the department further cripples efforts to deliver effective service to the people. Al-Jamaa calls on the department to prioritise the filling of these vacancies. It is unacceptable that during the 6th Parliament, crucial bills have been delayed. All of these bills are the SA Social Security Agency Amendment Bill, Victim Support Services Bill, both critical in the fight against gender-based violence and femicide. It is disheartening that between 2022 to 2023, there was an underspending of more than 7 billion, thus denying thousands of vulnerable people from receiving grants for child support, social relief distress, and the top-up for the child support. We cannot allow the ongoing slow uptake in applications for grants, including the old age grant. Efforts to rectify these challenges must be dealt with urgently and have noteworthy outcomes. Al-Jamaa appeals to government to address the challenges of budgetary constraints, infrastructure, resource deficiencies, inadequate facilities, and limited access to service, particularly in the remote regions. I thank you.
Thank you, Honourable Member. The ANC.
Thank you, House Chair. To compare gambling and Nyaupe is misplaced. House Chair, as the ANC, we rise to support the recommendation of the BRRR report on Social Development Portfolio Committee as a critical instrument and intervention aimed at expanding the work of the gender-based violence and femicide programs, thus improving access to social development services as a component of supporting the poor, the vulnerable, and eradicating the social ills in society. Honourable House Chair, the struggle against the gender-based violence and femicide is not dialectically isolated from the struggle for women emancipation. In this context, allow me to quote from the late President of Mozambique, Samora Machel, when he said the following, open quote, "The emancipation of women is not an act of charity, the result of humanitarian or compassionate attitude. The liberation of women is fundamental necessity for the revolution, the guarantee of its continuity and precondition for its victory," close quote. We appeal to the Honourable Minister to expedite the introduction of the Universal Basic Income Grant, the BIG, as a game changer and strategic policy shift that will positively impact in the life of the vulnerable South Africans, especially those that are trapped in poverty, unemployment, hunger, and despair. Over the past 30 years, the ANC-led government provided social protection relief for more than 33 million South Africans. Going forward, the DSD department will triple their efforts in taking out of some of this beneficiary from the grant beneficiary to employment opportunity through training opportunities to improve
Honourable Member, your time has expired. Thank you.
We thank the Minister for...
Honourable Members, I put the motion again. Are there any objections? EFF?
House Chair, note the objection of the EFF.
It's noted. Are there any further objections?
House Chair, note the objection of the Mkhonto Wesizwe Party.
Noted.
Thank you.
Are there any further objections? There's no further objections. The report is agreed to. The Secretary will read the fifth order.
Consideration of budgetary review and recommendation report of Portfolio Committee on Health.
I now recognize the Honourable the Chief Whip of the largest party.
Thank you very much, House Chair. And I move that the report be adopted. Thank you.
Honourable Chief Whip has moved for the report to be adopted. I will now allow the declarations of vote. Maximum of 2 minutes. Please take note. Don't prepare a speech for 5 minutes. You only have 2 minutes. The DA.
Thank you, House Chair. The DA would like to recognize that the National Department of Health has in 2023-24 improved its financial reporting and has received an unqualified audit. However, the Auditor General's report indicates ongoing challenges in measuring and achieving performance targets and some significant shortcomings that need to be addressed to improve healthcare delivery. Key observations include that, 1, the department achieved only 60% of its targets this year, despite having 7 fewer targets than in the year before, and despite spending its entire budget, reflecting high spending and yet poor performance. It is particularly concerning that the Auditor General questions the validity and reliability of many of the data sources for the Department of Health performance indicators, which may indicate that the department's performance is even worse than has been reported. There is a 24% vacancy rate in the Department of Health, including at senior management level, which is extremely high. And this is likely to have impacted performance of the National Department of Health, resulting in an inability to plan and execute crucial functions. There has been a lack of progress in implementing the National Digital Health Strategy, which is critical for improving health service delivery and managing medico-legal claims. And finally, the department has again, according to the AG, failed to implement consequence management for irregular expenditure incurred in previous years. The apparent lack of capacity in the Department of Health is extremely concerning, especially in the light of the planned rollout of the NHI, which will put further strain on an already stretched department. We urge the department to appoint capable senior managers on merit, set realistic, measurable, and achievable targets, and to foster greater accountability within its ranks. We approve the report. Thank you.
Thank you, Honourable Member. The MK Party.
Wena osesihlalweni. Ubudedengu benzakalayo ezibhedlela ngenxa yodokotela nangenxa yonesi kukhosta imali eningi i-department. I-department ayinalo-ke uhlelo lokuthi lobu budedengu lobu buzoqedwa kanjani. Kuphinde futhi uhlelo ayinawo umnyango uhlelo ebhedlela zethu sibona abantu bokuhamba bewu-50%. Labantu laba abadokumentiwe kodwa baseyibhedlela zethu. Ibhedlela lezi azina umnyango awunawo uhlelo lokuthi le mali lesizoyibuyisa kanjani nalolu hlelo ukuthi uzoyilungisa kanjani lesimo. Kungakho ke thina siwumkhonto wesizwe singavumelani nale budget. Ziningi izimali ezilahlwa umnyango wa health noma umnyango wezempilo ekufanele ngabe lezi mali siyakwazi ukuzibuyisa. Lezi mali lezi zikwazi ukuthi zenze ezinye izinto ezifana nezikena ezikwazi ukuthi abantu bakithi baphile. Kunamhlanje ogogo basamolayini ezibhedlela bevuka ngo-5 ekseni nanamhlanje kusanjalo na before 1994 kwakunjalo. Amabhunu esicindezele nani kagogo futhi nani nesicindezela futhi sekubuyileke futhi manje sesicindezelwe kakhulu ke manje ngoba senibuyeli nabo nazohlala nabetafuleni nathi abasicindezele futhi. Ngiyabonga wena sesihlalweni.
Thank you, Honourable Member. The EFF.
Thank you. The South Africa's healthcare system is collapsing, leaving the most vulnerable in society, workers and the poor, without access to health medical care. Despite the constitutional guarantee of healthcare services for all, the current state of public healthcare is a betrayal of this fundamental right, which is enshrined in Section 27 of the Constitution. South Africa's public healthcare infrastructure consists of 505 facilities, of which 57% are clinics, yet only 1,507 out of 3,152 clinics meet the standards of the ideal clinic, leaving nearly half of these vital facilities unable to deliver essential services due to poor infrastructure, inadequate staffing, and lack of support services as supported by the findings of the Auditor General. Public healthcare facilities are crumbling also. Inadequate ventilation, non-functional bathrooms, and poorly maintained hospital grounds are commonplace. Public hospitals are no better. Of the 996 facilities inspected in 2017, only 5 met the required norms and standards. The result is a healthcare system that fails to provide even basic services to the majority of the South Africans. Under human resources, there were findings by the AG under limited human resources to provide healthcare services with specific reference to basic vacancies, which has an impact on the department managerial failures, slow response to management to address the recommendations as made by the Auditor General.
Thank you, Honourable Member. Your time has expired.
We reject the BRR. Thank you.
The IFP. I've received a request from the Honourable Member to address us from a seat.
Honourable Speaker, as the IFP, we note the report and remain adamant that the department and entities will have to work to improve financial and non-financial APPs, particularly the delay in the health infrastructure, critical projects, and the delay of the draft on medico-legal claims. The IFP is deeply concerned about the amount of money spent on training doctors in foreign countries, only to find that these doctors cannot practice here after completing their studies. We urge that this matter receive priority attention. The IFP continues to call for the review of the funding model in the NHI. Having said that, Speaker, we welcome the strides made in achieving universal health coverage. On digitizing health records, we urge the department to move speedily to electronic health records as budget has been set aside for this transition. We note with gratitude the work of the entities. However, the absence of a report on NHLS is concerning, given the current challenges NHLS is facing in the critical role plays in our health services. Honourable Speaker, with all this considered, the IFP supports the report. I thank you.
Thank you. The PI.
Thank you, House Chair. The AG's office has mentioned that the Eastern Cape, Northern Cape, and Free State provincial departments continue to receive unqualified audits despite the provinces being given improved guidelines. We urge the ministers to step in and make sure that corrective action is given to guarantee better performance and better audit outcomes. The AG notes in section 4.4 of the report that the hospital infrastructure design failed to provide hand hygiene facilities, inadequate supply chain management procedures, vacant positions are not promptly filled, the district office and hospital do not coordinate or communicate on repairs and maintenance. Maintenance and repairs are not carried out because of the budgetary limitations. These results have a detrimental effect on service delivery, which makes them unacceptable and worrisome. I suggest that the senior executive staff step in at the designated hospitals to put better policies in place to guarantee better service delivery. The National Health Department's performance does not correspond with the department's spending trends. With these suggestions, we as the Patriotic Alliance approve of the report and urge the Department of Health to respond to the issues raised as a matter of urgency. Thank you.
The FF Plus.
Thank you, House Chairperson. House Chairperson, I just wonder why the Minister of Health made a statement in the NCOP last week but only a handful of people complain about public hospitals. And I wonder why, when was the last time the Minister of Health visited any public hospital in South Africa? And with respect, Honourable Minister, I think you are out of touch of reality at this stage. Irregular expenditure incurred an increase from 7.1 billion in 22-23 to 9.9 billion in the year under review. The Portfolio Committee still have concerns about the report findings of the Auditor General on financial statements that have not been fully prepared in accordance with the prescribed financial reporting framework. Concerns were also expressed over the 350 million irregular expenditure incurred by the department, which includes 150 million relating to the digital vibes matter. The final report on the digital vibes must be made available to the Portfolio Committee. We must stop pumping billions of rands into NHI projects and rather use this money to repair our public health system and appoint more doctors and nurses, pay medical suppliers and procure medical equipment. There is a major concern about the lack of infrastructure improvements in the public health facilities. 6 of the provincial departments have received financial unqualified opinions. Concerns remains for the Eastern Cape, Northern Cape and the Free State over controls on their financial records as they remain qualified. These 3 provinces have already appeared before the Portfolio Committee during the past week. The FF Plus remains concerns about the plus minus 10,000 medical legal cases in total against the 9 provincial departments with a claim amount of plus minus 107 billion rand. This report also highlighted that neither the case management system nor the policy and legal framework to manage medical legal claims were fully achieved. Thank you, Chairperson.
Thank you. Action SA.
Thank you, House Chair. To live up to Section 27 of the Constitution, we need to be more specific, that the promises we make in the Constitution are for citizens and residents. We cannot afford to fund health care for anybody that comes to our country. Those should be provided with services in terms of the international laws and international norms. If we're going to fix health, health must be a national competence, and we need to do the political reforms so that we can avoid wastage. For health to work, you don't need 9 MECs and a health minister. You need a health minister and sites for provision of services, civil servants to deliver health services, not other politicians with other staff that bloats the funds that we have. We need to ensure that in healthcare, we speak to original equipment manufacturers. We avoid the wasteful, harmful tendering system that we use today. We need to commit to fix what we have, to act so that we can create better health for all. Fix the public sector, fix the private sector. We need to ensure that we professionalize health services. We need to do away with remunerative work outside public service. When you have unemployed doctors, there's really no room for double dipping. And lastly, Chair, we need to commit ourselves as public officials that we will use public healthcare services. That is the only way we fix healthcare. When we can still be on PARMED and go to private hospitals, nothing will ever come right. We should lead by example. Mr. Deputy President, see you at the next local clinic in Alexander.
Thank you, Honourable Member. The ICDP.
Honourable House Chairperson, the ACDP thanks this committee for its report and for prioritising water security, which significantly impacts public health. We express concerns about the accelerated rollout of NHI, in particular, its financial viability and a decline in quality healthcare due to centralisation. The ACDP disagrees with the government's continued promotion of the COVID-19 vaccination campaign. We argued for safe, voluntary vaccines with content disclosure. After our government was forced by a court of law to release the COVID-19 vaccine procurement contracts, it was revealed that they were bullied into contracts by the global pharmaceutical industry with terms described as unfavorable and unethical. Shockingly, our government signed contracts in which the manufacturers of this experimental drug acknowledged, and I quote, "The long-term effects and efficacy of the vaccine are not currently known, and that there may be adverse effects of the vaccine that are not currently known." Pfizer later admitted that their jab was never tested to prevent transmissions, and is further accused of violating the state's Consumer Protection Act in the United States by misrepresenting their jab. As early as February 2021, in their trial with 458 pregnant women, Pfizer knew that 10% of these women miscarried after receiving the jab. It is now proven beyond doubt that the jab causes heart inflammation or myocarditis, amongst other things. Double-jabbed expert cardiologist Dr. Molhatra calls the rollout of the COVID jabs as one of the poorest efficacious pharmacological interventions with the worst safety profile, yet the most financially profitable in the history of medicine. The ACDP says the health of South Africans must be prioritized, not the profits of pharmaceutical companies. Thank you.
The UDM.
Thank you very much, House Chair. For 30 years since we attained freedom, South Africans have been struggling to access quality basic health care and the equitable health care they deserve. In fact, one of the issues in our view that the department has to address in order to deal with this problem, deal with the challenges of rooted problems plaguing hospitals and clinics across the country, from shortages of essential medical supplies, infrastructure decay, shortage of medical personnel, to mismanagement and corruption that is plaguing the department. In fact, on infrastructure decay, for example, the South African Medical Research Council report on the state of health in South Africa reveals that out of 696 facilities evaluated in the Office of the Health Standards Compliance latest report, only 5 met 80% of the required performance standard, which shows the problem that we have with our healthcare facilities around the country. To make matters worse, the report of the Financial and Fiscal Commission outlined that South Africa's healthcare expenditure is about around 8.5% of GDP, which is higher than those of low and middle income countries, which are at below or at about 5%. High-income countries spend about 12 to 13%, but despite that expenditure, our people aren't getting value for money at all. Compounding this problem is the issue of severe shortage of medical personnel, with a doctor-patient ratio of 0.9 to 1,000 people, while, for example, the South African Medical Association Trade Union confirmed that 694 doctors were unemployed in January this year, meaning we do not necessarily have a shortage of medical personnel per se, other than us being able to allocate and make sure that we use the human resources properly, especially for medical facilities around the country which are in dire need of these services. Thank you so much.
Thank you, Honorable Kwankwa. Royce.
Just one thing, just to expand on what Honorable Kwankwa is raising in terms of the state of our public health care facilities, which leads, Honorable Minister, I'm not so sure if you are still here, but it leads to the good medical and healthcare professionals to leave the public service. They leave the public service because the working environments in those clinics and hospitals are unbearable, the infrastructure is not working. So if there's one thing that we must get it right so that we don't continue to lose the medical and healthcare personnel, is to fix the healthcare facilities. But as Rise Mzansi, I seketela report le.
Bosa.
No declaration from Bosa, House Chair.
Thank you. The ATM.
No declaration from ATM. Thanks.
Thank you. Al-Jamar.
Thank you, Chair. About 83 of every 100 people in our country depend on the public sector for health care. Budget cuts on the public health sector will not work in the country's favour to provide its citizens the right to health care, but only further cripple the service delivery in the sector. This has a negative effect that already challenging 24-hour services at many hospital beds has been limited, causing patients to spend more time on trolleys or floors. Furthermore, elective surgeries are being reduced and people are forced to wait much longer for assistance. The slight increase of 2.5% budget for 2024-25 financial year is being overshadowed by the 6.5% medical sector inflation. A further 807 million shortfall is predicted for 2024-25, and this trend is expected to continue for the next 3 to 5 years. Years of working under very challenging circumstances has psychological impacts on healthcare workers. We have many doctors who've completed their community service who are unemployed. These doctors are forced to turn to private sectors or to immigrate. Why is employment for them not being prioritized? We welcome the National Department of Health 2021 to 2025 strategic plan that aims to eliminate avoidable and preventable deaths, promoting wellness and preventing managing illness and transforming health systems, and the mitigating of social factors undermining ill health. All these are in line with the United Nations objectives of the Sustainable Development Goals for Health. These goals are welcoming, but how can they be achieved if the country has budget cuts every year? These budget cuts itself are delaying the rollout of the national health insurance and therefore denying vulnerable citizens the right to equal quality health care. The National Development Plan Vision 2030 is noble, but 2030 is not a decade away. And the current situation in treatment of providing quality and safe care all seems like a pipe dream unless there is an end to budget cuts. I thank you.
Thank you. The NCC, the PIC, the UIT, good, the ANC.
Honorable House Chair, Molweni Ntente. The ANC supports the Portfolio Committee on Health Budget Review and Recommendations report as a commitment to build on our country's democratic gains and forging a future towards universal health coverage. We are encouraged by the achievement of 2,706 primary health care facilities obtaining ideal clinic status. The construction of and revitalization of 45 primary health care facilities and 30 hospitals, reaching 839 facilities offering HIV self-screening and training, and certifying 886 clinicians in sexual and reproductive health modules. Among others, we also support the crucial recommendation of the report intended to expand access, improve health outcomes, and strengthen capacity in the sector through improving financial controls and reduce irregular, fruitless, and wasteful expenditure, improving TB treatment, access rates, and addressing budgetary constraints. As the ANC, we recognize health as a fundamental human right and thus remain resolved to dismantle all barriers which perpetuate inequality towards establishing an equitable, accessible healthcare system, and leaving no one behind. The ANC is committed to the successful phased implementation of the NHI, which will not address
Your time has
the
now
healthcare
expired.
disparities, but also supporting socio-economic growth. Thank you very much, Chairperson.
Thank you. I put the motion again. Are there any objections? The EFF?
House Chair, please note the objection of the EFF.
Thank you.
House Chairperson, in the interest of the black majority in this country, we do not want to betray them. We will meet on the 15th of December at Moses Mabhida, and there too, we will once again commit ourselves to the emancipation of the black child in this country.
Honourable Reddy.
We will vote
You
against.
know better.
Thank you.
Yeah, Honourable Reddy. Honourable Reddy, I'm addressing you. For the rest of the sitting, we only inquire whether you object. We don't need reasons. You have an opportunity to declare. Thank you.
Sorry, House Chair, I was not aware of that, but thank you for educating me. Thank you.
Thank you. With those objections noted, the report is adopted. The Secretary will read the 6th order.
Consideration of budgetary review and recommendation report of Portfolio Committee on Employment and Labour.
I now recognize the Chief Whip of the largest party.
Thank you. Good afternoon, Chair. I move that the report be adopted. Thank you.
Thank you. Requests for declaration of vote have been received. I will now allow for up to 2 minutes. One member of each political party wishing to make a declaration an opportunity to do so. The DA.
Mr. Chair, unemployment in South Africa is one of the worst in the world and the highest rate in the G20. On the expanded definition, we are close to 42% unemployment. These figures get worse in previously disadvantaged areas and also for women and youth. The President previously called for every ministry to report on legislation and regulations that stand in the way of job creation. We've not had these reports despite the urgency of the call and despite the disastrous situation we find ourselves in. It is widely acknowledged that small businesses are the engine room of job creation both in South Africa and worldwide. We still have archaic structures in place in our labour legislation that need to be tackled immediately. For instance, the coupling of small businesses to large businesses through bargaining councils is disastrous. They can be uncoupled via regulation, and this can be done immediately. This could, by the stroke of a pen, create up to 1 million jobs. Furthermore, small businesses can be exempt from employment equity legislation and from many of the disputes surrounding dismissal, if we have the will. We need only look at our neighbours for examples of how small businesses have revitalised their economies. The Democratic Alliance strongly supports the presidential commitment to deregulate the small business sector. Thank you.
Thank you. The MK. Yeah, this is now your opportunity to declare, Honourable Reddy.
Speaker, our President, President Jacob Zuma, commanders from MK, the Progressive Forces, and members. MK Party will not support this budget for the simple reason that when you look at the unemployment figures in this country, for one, among the youth, it's about the highest in the world. We cannot be celebrating such unemployment figures. In fact, we cannot have a minister of employment. The person should be called Minister of Unemployment. So by standing here today and supporting this budget, we're sending a message out to the people of South Africa, the majority of whom do not have a job today, that we support the status quo, that we actually approve of a country where unemployment is becoming worse every day. So it is for that reason that MK Party, ably led by our President, who will be at the Moses Mabhida Stadium on the 15th of December this year, where we will once again reconfirm our support for the black majority and the black child in this country whose future has been deprived by the so-called GNU. I thank you.
Thank you. The EFF.
Ngiyabonga mqhubi tinkulumo. Inkinga lenkulu lesinayo sihlalo ukuthi bantu labaningi bacabanga ukuthi leli tiko linemsebenzi wekudala amathuba emsebenzi. Bayakhohlwa ukuthi this department has no say or input in fiscal and monetary policy, the only instruments that the state can use to create jobs. Honorable Chair, leltiko le-Employment and Labour linabo sekela mphathiswa lababili kusukela ngoJune 2024. Kunginyalo asathi ukuthi yini umsebenzi wabo ngamunye, khatha lokhu behla benyuka eSouth Africa asathi ukuthi kahlehle bendani. A sum of 15 billion was allocated from the Public Investment Corporation for job activation programs. There is no progress report, and the report tabled here is silent because the money was possibly looted. It won't be for the first time. The department has a high rate of vacancies in critical positions. Individuals in acting capacities are left to make long-term serious decisions, and there is no consequence management. Bashayeli bemaloli sihlalo nanamuhla basamele timphendvulo ngetinkinga lebatiphakamisa kumphathiswa waleli tiko ngo-2022. Employers refuse to implement CCMA awards, and there is nothing this department is doing to intervene. The UIF and the compensation fund are marred by corruption. With all these challenges facing the department, our colleagues saw it fit to simply take recommendations from previous reports, polish them lightly, and present them as new recommendations. As the EFF, considering the above, we reject this report. Thank you.
Thank you. The IFP.
Thank you, Honorable Chairperson. Honorable Chair, in the current challenging economic climate, the Department of Employment and Labor plays a vital role. The IFP's consideration of this report is guided by our recognition of the department's mandate to regulate the labor market through policies and programs developed in consultation with social partners. These initiatives aim to create decent employment, eliminate workplace inequality and discrimination, and promote labor standards and fundamental rights, among other priorities. The IFP notes that the department spent 99.5% of its allocated budget. Furthermore, we welcome the Auditor General's report that found the financial statements of the department fair in all material respects. However, the IFP is concerned that the effective steps were not taken to prevent fruitless and wasteful expenditure in the sum of millions. That cannot be right. Moreover, the IFP is concerned that the Auditor General was unable to obtain sufficient appropriate audit evidence that disciplinary steps were taken against officials who had incurred irregular expenditure and that management did not ensure that there were effective controls over information technology systems. Consequently, significant weaknesses were identified. We acknowledge that the department achieved 81% overall performance. In consideration of the issues we have raised, the IFP accepts the report. Thank you very much, Chairperson.
Thank you. The PI.
Honorable Chair, as the Patriotic Alliance, we call for an urgent and decisive action from the department in response to the findings raised by the Auditor General. It is imperative that the department immediately develop and implement a comprehensive action plan to address these issues. The progress report quarterly to the Portfolio Committee. Specifically, the department must align its ICT procurement processes with the CETA Act to resolve material findings. In addition, the department must prioritize the creation of an ICT strategic plan that aligns all IT projects with this framework, while also establishing a robust system manage consequences of poor performance and irregularities, while addressing transport needs for workers with disabilities. The restructuring of the public employment service branches must also be prioritized to enhance job creation efforts. We support.
The FF Plus.
Thank you, House Chair. I think everything has been said that can be said about the report. I would just like to help the Honourable Reddy. I don't think that the rest of the House and Honourable Reddy reads the same newspapers, because under the GNU, inflation has gone down, interest rates has gone down, the unemployment rate has gone down. However, the black child and every other child in South Africa has been deprived of their futures
Honourable Member,
during the 9 missing
Honourable
years.
Benner, just hold on for a moment, please. Honourable Reddy, why do you want to be recognised?
On a point of order, Acting Speaker, the Speaker is misleading the House, because the reality is that while there may be a reduction in
Honourable Reddy,
unemployment,
thank you.
it's still the highest
Honourable
it's
Reddy.
been since 1994.
Thank you. You
So
are
let's not
trying to
mislead the
insert
House.
yourself in the debate. You had your opportunity to declare. Honourable Denner, please continue.
Thank you, House Chair. You see, I don't think he reads the same newspapers as the rest of us. However, all of our children's futures were stolen through the 9 missing years under a Zuma government. Thank you, House Chair.
Action SA.
Speaker, a cornerstone of Action SA's policy agenda is establishing a professional public service rooted in integrity, competence, and free from corruption. In this regard, Action SA finds that it is unacceptable that the Department of Employment and Labour has consistently failed to achieve a clean audit report. The Auditor General has highlighted serious issues, including inadequate consequence management, poor expenditure oversight, weak internal controls, and multiple material irregularities. Furthermore, Action SA notes with concern that the Compensation Fund had a disclaimed audit outcome with findings. Everything starts with good governance. The department has failed in this regard. Speaker, on the topic of failing, it is a primary mandate of the Department of Employment and Labour is to create decent jobs. Then it has failed so spectacularly that its very existence should be reconsidered. With a staggering expanded unemployment rate of 42.6%, it is clear that this department is not fit for purpose. Why are we still funding a structure that consistently fails to lift millions of South Africans out of poverty and hardship? It is time to stop making excuses and start demanding accountability. We can't keep blaming COVID and other global factors. Over the next 3 years, we're looking at an average GDP growth rate of just 1.8%, not even enough to absorb the annual influx of matriculants into the labour market, let alone reduce the catastrophic unemployment levels. One must ask the question, is the department facilitating or a hindrance to job creations? The numbers do not lie. Speaker, Action SA rejects the report.
The ACDP.
House Chair, the ACDP shares the deep concerns that everyone in this House should have about the very high levels of unemployment in the country. Unemployment deprives a person of the dignity to provide for his or her family. This can cause that person to also experience pressures and also to experience psychological impacts. Unemployment causes reliance on social grants. Up to 19 million persons are expected to be on social grants, and that is necessary in the short term, but surely every person would like to be able to work and to provide for their families. It is heartbreaking to see so many people standing at the side of the roads looking for employment, looking to provide for their families. The private sector is the main avenue for the creation of jobs, with government to create an enabling environment. And we know that small businesses are the main catalyst for job creation. Yet they are themselves struggling with high interest rates, until very recently power outages and now water shortages, high fuel costs, and other extreme challenges that small businesses are facing and have to close. We saw with the COVID-19 lockdown, tens of thousands of businesses having to close, and many have not regained or not been restored. Far more needs to be done to stimulate economic growth, to create jobs. What we require is faster economic growth. And yes, we are seeing green shoots of that with the new political dispensation, with the government of national unity, as much as people might dislike that. We are seeing a positive element in that regard. The audit findings are, of course, a concern and must be addressed. However, there is always hope that we can create more employment.
Thank you, Honourable Member. The UDM.
This report highlights a distressing trend of inefficiency, mismanagement, and institutional failure that has hindered our nation's ability to address the crisis of unemployment, particularly youth unemployment rate, with a staggering, for example, expanded definition of unemployment at more than 40%. We have to understand and appreciate that these findings and these reports are not mere statistics. They are a reflection of the broader governance failures that are crippling our economy and deepening inequality. The department's inability to meet fundamental employment targets for youth and persons with disability, failing to achieve youth and employment goals and targets for people with disabilities, undermines the very principles of equality and social justice enshrined in our Constitution. The reported over-expenditure, for example, by the Public Employment Services raises significant questions about the department's commitment to responsible fiscal management. The department is tasked with leading efforts to create jobs, yet it squanders public funds meant to alleviate the suffering of the unemployed. The disastrous management of the funds in the unemployment insurance fund that was widely reported are one of the issues and challenges facing the department. We are, in our view, of the view as the UDM that there needs to be a comprehensive and sustainable national youth employment strategy that focuses on industries that are capable of generating long-term and meaningful jobs for our people. The people of South Africa cannot afford to wait any longer for change. We must hold the department accountable not just for its past failures, but for the potential it still holds to transform our nation's future. I thank you.
Thank you. Raj.
Nakensan Tramastul, Taukerile Namuntli. Honorable members, I'll start by stating the fact that South Africans are not working. Young South Africans are not working. And they are looking at this department to speak up for them. They are looking at this department to speak up for them so that it is easier for businesses to hire South Africans. They are looking at this department to continue doing the raids, going to employers, and focusing on those that are hiring illegal foreign nationals. Because that's one of the matters that South Africans are crying about. They are also saying to this department that even those South Africans that are lucky to get a job, they get exploited. And from this department, they are looking for someone to speak up for them. They are looking for this department to clamp down on people that are not even paying and adhering to the minimum wage legislation. That's what South Africans are asking for. But most importantly, this department must work to make it easier for businesses to hire South Africans. And those ones that are found to be hiring illegal foreign nationals, they need to be punished.
Thank you. Bosa.
Thank you, House Chair. Bill 1SA supports the BRRR for employment and labor, but I do wish to say that while we support this report, we do so very sober about the unemployment realities in this country, particularly for young people. We're very clear that young people are unemployed, almost 70% of them by the expanded definition. And so we support this report, particularly because of some of the interventions for employment programs for young people, But we also want to note that in the most recent QLFS report, there have been incremental improvements in employment, but we note that those improvements have been in sectors such as community services. And so there's a very clear lack of sustainable job creation in industry. And we're not seeing a matching of skills for young people for industry. And so we note that, and we wish for the department to note that. We also wish to highlight the need for a more focused and targeted intervention towards collaboration between the Department of Employment and Labor, Department of Basic Education, and collaboration with other economic cluster portfolios in order to ensure that youth are prepared for and have access to viable employment opportunities, but also to viable entrepreneurial opportunities, because that's what we need in our country. So while we support the report, we do wish to say that there's a lot of work that needs to be done, and the realities of young people in this country need the attention of this department. Thank you.
The ATM. Al-Jamar.
Thank you, Honourable Chair. Honourable Chair, as Al-Jamar, we reiterate and concur with the constructive concerns raised by previous speakers. However, I just want to raise a concern. We speak about the youth.
Honourable Saleh, won't you just be a bit closer to the microphone, please?
Sure. Thank you. So, Honourable Chair, there's just one concern that we tend to forget. We talk about the youth, but it is shocking when people are told at the age of 35 that they're no longer employable despite the qualifications that they have. And that is a critical age, because these individuals, 35 and up, are too young for pension, but they still have young children that they are looking and catering for, and families. So this is also needing to be considered when we're talking about employment. I thank you.
Thank you. The NCC, the PIC, the UIT, Good, the ANC.
Ke a leboha modulasetulo. Re le mokgatlo wa ANC re hlokometse bohlokwa ba matshwenyeho a hlahisitsweng ke mohlahlobi ka karabetso mabapi le diphetoho tsa tlhahlobo tsa mekgatlo ya bohlokwa jwalo ka compensation fund, UIF, le support employment enterprises. Honourable Chair, the ANC remains dedicated in improving the audit outcomes for these entities with the aim of achieving unqualified opinions in areas that are central to their operations. We are optimistic about the progress being made, and we are confident in our ability to address these challenges effectively. We commend the CCMA and NETLEC for their unqualified opinions without findings. We further acknowledge the enormous responsibility that the department is tasked to carry out, which includes, amongst other things, the meaningful incorporation of the expanded mandate of employment and to stimulate the economy through industrial financing and assisting small enterprises, township supplier development programs, and the promotion of youth entrepreneurship and the continuous monitoring of the national minimum wage across every sector to sanction the few. The adoption of this report will provide a crucial foundation for enhancing the department's mandate, which focuses on regulating the labor market to foster a sustainable economy and job creation, aligning with the ANC first priority commitment in its manifesto. Honourable Chair, the ANC supports this report and recommends the approval of this House. Thank you.
Thank you. I put the motion again. Are there any objections? Action SA? Honourable Beasley, please just read your objection into the record.
Sorry, Speaker. Action SA rejects the report.
Thank you. The EFF?
Thank you, Chairperson. Please note the objection of the EFF.
The MK.
MK Party objects the report.
Thank you. With those objections noted, the report is accordingly agreed to. The Secretary will read the 7th order.
Consideration of budgetary review and recommendation report of Portfolio Committee on Transport.
I now recognize the Chief Whip of the largest party.
Thanks, Chair. I move that the report be adopted. Thank you.
Honourable members, requests for declaration of vote have been received. I will now allow again for up to 2 minutes, one member of each of a political party wishing to make a declaration an opportunity to do so. The DA.
The DA welcomes private sector participation in the delivery of much needed and scaled up transport infrastructure expansion, which emerged as the primary emphasis of the GNU's first medium-term budget policy statement. Unfortunately, major general inefficiencies amongst the 14 transport entities caused by a weakening in operations, years of underspending on maintenance, mismanagement and corruption deriving from state capture were permitted to dictate our course and produced a variety of serious gaps. Many transport projects presented suboptimal quality infrastructure spending and in quantity assessment being inadequate. Public and private fixed investments currently account for around half of 30% defined GDP target in the NDP. Future collaboration in infrastructure development will, however, create more chances, new possibilities, and value opportunities. The true test going ahead will be filling in all the gaps and making all of these ideas reality. Rapid implementation, intentional collaboration, and immediate intervention should be the 3 main priorities. I'm confident that our transport oversight duties will be sufficiently strengthened by the newly introduced additional reporting framework, which consists of 16 distinct plans, progress briefings, and monthly reports. Despite conditions of insubstantial funding, our combined focus will remain on the needs of our people to maintain fiscal stability, create jobs, and advance economic growth. Ndiyabulela ngexesha enindiphe lona. Ek dank u.
The MK.
The budget review process is fatally flawed, and for this reason, the MK party will not support it. Notwithstanding its noble intentions, the PRRR process fails to give Parliament meaningful say in shaping budgets. Unless this is changed, the PRRR process will simply be about Parliament endorsing policy priorities set by a government which has run out of ideas. During the oversight visits to the Department of Transport and public entities, a careful reading to the targets which were fully and partially met had nothing to do with the real outcomes and impacts which would bring about improvements, innovation, and change in the lives of citizens. In many instances, this is a tick box exercise. We are convinced that the various initiatives undertaken by the Department of Transport and its entities have no impact to society. One of the biggest failures of the department is in its national rail policy, which deviates from promoting the role rail should play in the social and economic development. The government has used the rail policy simply as a mechanism to facilitate the entry of private sector in the rail space rather than an instrument to facilitate long-term development of South Africa. Public transport features amongst the many failures of the department, with the taxi recapitalization program remaining an empty promise, as well as the permits issuing becoming a frustration. As we speak, over 80 taxis in the Durban Taxi Association long distance have been impounded by the same government, which fails to produce the same permits. The failures of this government are a logical outcome of a short-sighted and myopic policy direction and posture adopted by the DA-ANC coalition. The MK party believes that the country should move with speed to develop an integrated and efficient transport system where there is effective coordination between the different transport authorities, deployment of the right capacity to effectively meet the demand, effective regulation, and functioning licensing. For these reasons stated above, the MK party will not support this review process. Thank you.
Thank you. The EFF.
House Chair, the EFF is on the streets today, marching to the Constitutional Court to highlight the corrupt activities of Ramadola at the Palapala farm. This march is a direct message to the ANC that abuse of power will never be tolerated under the EFF's watch. So if they had thought that the corruption of the buffalo would be buried under the mattress, just like the illegal dollars, well, they are mistaken. You must know that Palapala will never die for as long as the EFF is in this parliament. Now, back to this PRRR on transport. The EFF rejects this report. Our rejection is primarily grounded in a series of alarming findings that illustrates a fundamental failure of the department and its entities failing to meet its constitutional mandates and objectives. The department continues to be unable to fill in critical vacancies. The high vacancy rates then hinders the department's capacity to perform functions. Such neglect is not only irresponsible, but it's detrimental to the effective functioning of the transport sector. The report further outlines significant financial mismanagement. There is irregular expenditure amounting to over 65 million rand, fruitless and wasteful expenditure over 108 million. There's just financial irresponsibility and lack of accountability within the department. As if things will not get worse, there is an absence of an effective management system for school learner support system. This then leaves school children vulnerable and without reliable, safe, and secure transports. Then this opens up a gap for pedophiles who prey on young children. They come with their Polo Vivos, offer alternative transport to 14 and 15-year-old young girls in exchange for sex. This is a direct failure of the department to protect our young children. With all that said, Honorable House Chair, the EFF firmly rejects this report. I thank you.
Thank you. The IFP.
Thank you very much, House Chair. The IFP acknowledged the exclusion of Transnet, South African Airways, under the Department of Transport. We stress the importance of these entities being held accountable for financial and operational efficiency. We commend the Cabinet approval of the high-speed rail framework and prioritization of Johannesburg to Durban corridor feasibility study. However, we call for assurance that this initiative will drive exclusive economic growth and job creations. We also commend the Department of advancing critical institutionally policies such as the taxi recapitalization policy being reviewed. These initiatives are long overdue and vital for addressing persistent challenge in one of the largest black-owned industry in South Africa. We acknowledge the original objective of the recapitalization program promoting road safety by removing unroad vehicles and enhancing compliance with industry and ensuring vehicle affordability. Subsequently, the learner transport policy aimed at improving safety and reliability. This policy aligned with the IFP commitment to a people-centered approach to service delivery, prioritizing the safety and well-being of our citizens. The IFP will continue to monitor the department's effort in addressing these challenges, ensuring that fiscal responsibility and efficient service delivery remain top priorities. Transport is vital to all economy, and resources must be used efficiently and efficiently. In considering of these matters we have raised, the IFP accepted the report. I thank you.
Thank you. The PA.
No declaration from the PA, Chair. Thank you.
Thank you. The FF Plus.
No declaration, House Chair.
Action SA.
Thank you, Honourable House Chair. Transport is the lifeblood of our economy, yet the fragmented and broken transport system in South Africa continues to drain this vital lifeblood. In September, I visited Davidton train station, witnessing firsthand its devastating collapse and the utter failure of PRASA. As one of the 7 supercore stations in the Eastern Corridor, once generating 24 million annually, transporting millions of passengers daily, it is now a hollowed-out shell. Hard-working South Africans from Davidton, Springs, Katlehong to Boksburg, already struggling to make ends meet, now spend up to 4 times as much on transport. This betrays their right to affordable and reliable public transport. Honourable Minister, Action SA believes we must prioritize the recovery and reopening of the Eastern Corridor. When people move quickly, affordably, and safely, our economy thrives. As Action SA, we acknowledge the strides that this department has made with reducing road crash fatalities, reducing 266 in deaths this year. But the safety of women on e-hailing platforms remains gravely concerning. At the start of the 7th administration, I pleaded and implored with the Honourable Minister to prioritize the safety of women. Yet, just 6 days ago, 27-year-old Cheryl Lee Leroux endured a horrifying experience in the city of Cape Town while her Uber driver stood by, watched, and did nothing. As we commence the 16 days of activism against gender-based violence, this department's inaction on enforcing safety measures for women in transport systems is glaring. Minister, if you fail to enforce the laws designed to protect us, your department, like that Uber driver, becomes complicit in these crimes against women. Enforce the law and ensure that our women are safe. South Africans deserve better. They deserve a government that delivers safe, affordable, and efficient transport systems. Thank you, Chair.
Thank you. The ACDP.
Thank you, House Chair. House Chair, the ACDP notes the committee report, and Transnet's poor performance over the past 5 years has been characterized by decline in freight volumes, underutilage and under-maintenance, inadequate support, and the shortage of rolling stock. This has resulted in a crisis in the logistics sector, with the country losing tens of billions of rands towards its GDP. In December last year, Transnet was granted a 47 billion rand guarantee facility for the roadmap for freight logistics. And the ACDP commends the work done by the National Logistics Crisis Committee, who has brought in a number of independent private sector experts for a turnaround of our rails and ports. And key areas of improvement have been the purchase of operational equipment, capital for the rehabilitation of the rail infrastructure, and the returning of locomotives to service. The improvement of ports will also assist in exports, in particularly where we've got perishable goods that rely on those exports. As far as the air traffic navigation system is concerned, the ACDP welcomes the 422 million rand additional funding that will go a long way to ensure flight safety at all the airports. Lastly, the Road Accident Fund continues to present a significant fiscal risk. Provisions for liabilities amount to a staggering 352 billion rand, and National Treasury has indicated that the fund's financial period and financial outlook is set to deteriorate further. The number of claims is also set to grow, and as we see, that many of these claims are only settled when a court date has been allocated, in many cases in years hence. This must be addressed, as well as the RAF's board refusal to accept the Auditor General's
Thank you,
auditing.
Honourable Member.
I thank you.
The UDM.
Voorzitter, geen verklaring.
Ek is u dankbaar, agbare Kwankwa. Rise.
Nkensile Mtramashitolo. Mtramashitolo, loko hi langutise endzawulo leyi ya vutleketli, ku na swilo swinharhu leswi hi lavaka ku swi andlala eka madyambu ya namuntlha. So the first of the three issues is the one that Honorable Swart just spoke about. We need to really look at RAF. There are many issues at RAF. The standoff that the Road Accident Fund has with the AG is unsustainable. The Minister of Finance has already spoken about the the fiscal risk that RAF presents, and that's something that we need to look at. The second issue that it's a crisis that's staring us is a driving license printing machine. We only have one printing machine that's printing all the license cards in this country. And there's actually one man that's over the age of 60 that can operate that machine. And now we have a situation where for the new, the buying of the new machine, the AG has halted that process. And the performance of the machine at the moment is slowing down. And before we know it, we'll have a lot of South Africans that are driving with expired driving licenses. That's the second issue. The last issue, we are going to festive season. We know what happens. So earlier on, I raised during the committee meeting that the department needs to deal with the issues of cold drinks, where traffic officers are asking for bribes. But as members, as leaders in society, we need to discourage drink and driving and also drink and walking. So these are the three issues that I wanted to table, Chairperson Kensosne.
Bosa?
No declaration from Bosa, Chair.
Thank you. The ATM? Al-Jamar? The NCC? The PAC? The UAT? Good. The ANC?
Thank you, Honorable Chair. The ANC supports the BRRR of the PC on transport. In reviewing the budget programs and entities of the department, the committee recognized both the progress and challenges which were faced by the department and its entities. The department has reflected on the implementation of its programs. Transport sector, Chair, is a major economic input for inclusive development and driver of the economy. It is a major creator of direct and indirect jobs. We must highlight to the House that there has been progress in the restoration and modernization of commuter rail with recovery in many corridors. While work is still ongoing, positive progress must be recognized. This will also assist Transnet Rail and Rail as the country has a single integrated rail network. Honorable Chair, SAA, through the restructuring, has shown a profit for the first time in many years. Road infrastructure projects have commenced and will contribute to macroeconomic development. The Welisizo program has also commenced to assist the rural areas. The report makes a number of recommendations which the department must consider to implement. The Portfolio Committee will keenly await reports from the department on these recommendations. The ANC hopes the House will consider the report for approval. Thank you, Chair.
Thank you. I put the motion again. Are there any objections? The EFF?
Thank you, Chairperson. Please note the objection of the EFF against this GNU
Thank
anti-black
you, Honourable
PRRR.
Once again, you had your opportunity to declare. Just record your objection. The MK?
On behalf of the majority of South Africans, we reject this report. I thank you.
Thank you. Action SA?
On behalf of Action SA, kindly note our rejection.
Thank you. With those objections noted, the report is accordingly agreed to. The Secretary will read the 8th to 11th orders together.
Consideration of budgetary review and recommendation report of Portfolio Committee on Police on Private Security Industry Regulatory Authority. Consideration of budgetary review and recommendation report of Portfolio Committee on Police on Civilian Secretariat for Police Service, Office of Directorate for Priority Crime Investigation, Judge and National Forensic Oversight and Ethics Board. Consideration of budgetary review and recommendation report of Portfolio Committee on Police on Independent Police Investigative Directorate. Consideration of budgetary review and recommendation report of Portfolio Committee on Police on South African Police Service.
I now recognize the Honorable the Chief Whip of the largest party.
Thank you very much, Chair, and I move that all the reports be adopted. Thank you.
Thank you. Requests for declaration of vote have been received. Honourable members, I will again allow for up to 2 minutes, one member of each political party wishing to make a declaration an opportunity to do so. The DA.
Good afternoon, Honourable House Chair, Honourable members. I rise in support of the adoption of the BRR reports of the Portfolio Committee on Police, focusing on the following key institutions as highlighted. The efforts of all of these institutions are crucial to ensuring the effective and accountable operations of our national security framework. While CIRA's 2024-25 budget and annual performance had both its welcome developments and its concerning failures, CIRA plays a critical role in regulating the private security sector, ensuring that it operates within the bounds of the law and enhancing the safety of all citizens. The Civilian Secretariat for Police has noted that there's been a regression in station compliance levels in relation to the Domestic Violence Act. While some provinces had fully compliant stations in the previous DVA census, none achieved full compliance with the DVA in the current one. It is commendable that the SAPS has initiated disciplinary action against members who failed to comply this period, with signals of seriousness within the SAPS management addressing non-compliance and wanting to address domestic violence. It is vital for the Independent Police Investigative Directorate to continue collaborating with the agencies like the SIU and the Hawks to improve service delivery and strengthen internal controls through effective consequence management and maintain their clean audit outcome. The SAPS itself remains the backbone of our national security framework, and recommendations outlined in the reports provide important insights into how we can strengthen capacity to serve and protect our communities. In conclusion, the adoption of these reports is essential to ensuring that these institutions continue to function effectively and are adequately resourced and remain accountable to the South African public. We urge all of these institutions to remain committed to eradicating crime and corruption, as they all contribute to the overall goal of building a safer and more just South Africa for all. Thank you.
The MK.
Honorable House Chair, I rise on behalf of the beautiful MK Party and President Jacob Zuma. CIRA plays an important role in overseeing and ensuring compliance within the private security sector. As a regulatory body, it has the responsibility to promote professionalism, protect the rights of security guards, and maintain standards. However, CIRA needs to strengthen its oversight on financial security for private security guards. Many guards face delayed or insufficient wages despite their critical role in ensuring public and private safety. The MKP calls on CIRA to implement stricter financial compliance measures for private security companies and the issuance of penalties for non-compliance. In so doing, CIRA can ensure that security guards receive fair compensation and financial security. The MKP strongly condemns the Civilian Secretariat for Police Service on its reported underspending on goods and services and capital assets in the year 2023-2024. Failure to allocate and utilize resources due to cost containment undermines CSP's objective to provide efficient oversight and support to the police service. The MKP calls for immediate accountability and the prioritization of resources to strengthen the police service's operational capacity. Cost containment cannot and should not come at the expense of public safety and the Secretariat's role in ensuring a police force that is accountable to civilians. Let's go to IPIT. I'm so sorry, yeah. We as the MK Party hereby reject the IPOD annual report due to its failure to accurately reflect the reality of police corruption, brutality and misconduct in South Africa. Gwaza MK,
Thank
Gwaza.
you, Honourable Member. The EFF.
Thank you, House Chair. Chair, the Directorate for Priority Crime Investigation Judge Annual Report indicates that the DPCI had no judge appointed for the entire 2 years since the departure of Justice Khomu on the 6th of October 2022. 2 years later, Judge Lekhodi was appointed on the 15th of May 2024. Delaying the appointment of the judge for 2 years is a clear disregard for justice and crime prevention. In the midst of the scourge of gender-based violence in the country, we still have thousands of cases that are postponed and rolled out of courts due to DNA samples not completed, with excuses relating to water, power interruptions, and equipment failures, contributing to the failures of the FSL in reaching their targets. In the financial year 2023-2024, a baseline of 2,824 DNA profiles possibly linking perpetrators to crimes was issued, and 1,625 out of 2,824 person-to-person crime leads were finalized. This is 57% of what was expected to be finalized. The slow pace with which IPID is moving in holding subs accountable is extremely concerning. For the period under review, there has been 174 rape cases committed by police officers, with the highest number of these cases coming from Gauteng with 55 and KZN with 50. 1,425 deaths as a result of police action, 380 deaths in police custody, and a whopping 2,381 cases of complaints relating to the discharging of official firearms, and 188 cases of corruption. Civilian Secretariat provided a report to the Portfolio Committee on members as offenders of domestic violence according to the SAPS records, and 232 members who were reported to be domestic violence offenders, 118 firearms were seized from them, and 109 of these firearms
Thank you, Honourable
were,
Member.
were
Your time
official
has now
firearms.
expired.
The EFF rejects this report.
The IFP.
Thank you, House Chairperson. In line with the IFP's manifesto, we prioritize safety, security, transparency, and accountability to serve South Africans effectively. We recognize the vital role of the private security sector, SIRA, in supporting the South African police services amidst officer shortages, but emphasizes the need for enhanced oversight to prevent exploitation and ensure standards for workers and citizens alike. We appreciate the contribution of the Civil Secretariat, DPCI, Judge, and National Forensic Oversight and Ethics Board in promoting police accountability. However, existing gaps, particularly in forensic investigations, hinder justice. We urge increased funding and better resources management to tackle forensic backlogs in improving case resolution reports for enhanced public trust. IPID's role in investigating police misconduct is essential. We advocate for its structural independence and increase operational funding to ensure unbiased investigation and better accessibility for citizens. While acknowledging SEP's commendable service, we express concern over resource mismanagement and rising crime rates, stressing the needs to redistribute resources to underserved areas and enhance rural safety. Addressing inefficiency within SEPs is crucial for improving responses, times, and overall performance. The IFE remains committed to supporting efforts that improve law enforcement, public safety, and police accountability. However,
Thank you, Honourable Member. Your time has now expired.
Anyway, we support
the PA.
No declaration from the Patriotic Alliance. Thank you,
Thank
Chair.
you. The FF Plus.
No declaration.
Thank you. Action SA.
Just speak from there.
Don't worry, Honourable Member, the sitting is a marathon, not a sprint.
Speaker, Action SA firmly believes that no country can flourish and no economy can grow in a state of chaos. Greed and corruption in the state, specifically SAPS, are the greatest obstacles to overcoming the legacy of our past. We must act against corruption and incompetence and declare it as public enemy number one. Based on legacy reports and previous recommendations, it's clear that at the beginning of every administration, South Africa gives birth to a newborn SAPS infant. The many excuses as to why we don't have functional stations is evident that we are again at crawling stage. In line with 16 days of activism, SAPS's key role as an entry point to the criminal justice process, as well as an entry point for victims of GBVF. Sadly, as per the report of the Civilian Secretariat, not a single station in South Africa is compliant and equipped to serve victims of GBV. The women and children in Ekurhuleni, KwaThemba police station to date have no access to an entry point. The same goes for the women and children and the families on the Cape Flats. No justice in sight for the current and ongoing genocide on the Cape Flats. Action SA dedicates today's remarks to 14-year-old Jamil van Rienen, who was brutally gunned down last week Tuesday, as well as the 79 other children killed between September 1st and November 20th in South Africa's notorious Cape Flats, the Western Cape's gang and drug crime hotspot, which this government continues to display no interest or will to change the current narrative. Action SA notes all these reports with great concern. I thank you.
Thank you. The ACDP.
Thank you, Honourable House Chairperson. The ACDP notes the Department's final appropriation of some 105 billion for the 23-24 financial year, of which 100% was spent, but concerningly, only 64 of its 95 performance targets were reached. We welcome the announcement by the Minister on the quarterly crime statistics in South Africa, which showed an overall decline in serious crimes of 5.1%, and applaud the honest policemen and women committed to their mandate of promoting effective, efficient, and professional policing in South Africa. It is concerning that some performance indicators do not measure up to the lived experience of citizens. The ACDP bemoans the dysfunctional functionality found at SAPS's call centres, the first line of communication between the police and the public. The national average rate of abandoned calls was calculated to be nearly 26.5%, with some centres recording an average response time ranging from 8 to 35 minutes. This is completely unacceptable. The ACDP continues to call for an upgrade to the police database system to offer robust research capabilities and data analytic features applicable also to the National Forensic Oversight and Ethics Board, the DNA Board, where the DNA evidence is said to be the most powerful tool in solving crimes, but its integrity depends on meticulous collection, storage, and preservation of data. We support the committee's call for a comprehensive investigation when firearms issued to SAPS personnel are lost or stolen. Unlike civilian losses, there is a lack of rigor and enforcement when it comes to records for SAPS members, with firearms making their way back to the streets. The ACDP commits to fighting crime and prioritizing the safety of all South Africans. I thank you.
Thank you. The UDM.
Yasebenza namhlanje andlala. House Chair, the Chapter 12 of the National Development Plan states that in 2030, people living in South Africa should feel safe at home, at school, and at work, and enjoy a community life free of fear. However, the failure to achieve this or to make sure this happened is succinctly captured or painfully captured in a poem. I want to approach the debate differently instead of citing the challenges. A poem which is contained in the report itself, which was written, composed, and read by Natalian Davids, a grade 12 learner, student at Moderdam High School in Bonteville. The poem reads as follows. If I look at the violence in our community, our people standing in unity, not standing in unity, stray bullets flying, our young people dying, mothers at their children's funerals crying. But I pray for peace to put our citizens at ease. We cannot walk outside our gate. It feels like I'm tied to a leash. Lord, I don't mean to question you, I just need clarity. Is this our fate? Is it our reality? Nobody cares for another. What happened to a time when we loved our friends like a brother? I shudder to think how our future will end, when our people's hearts are hardening like cement. I pray for a better tomorrow, and this may be, and maybe, this will release us from our sorrow. Such is the state of our communities, especially those that are previously disadvantaged. They live in fear of criminals. Most of them, children, aren't able to experience the life because of violent crime. As we look at all the performance indicators, SAPs, consideration that we have an important role to make sure that we achieve the stated objective, SCA 2030 NDP. Thank you.
Rise.
Okay, before I start my declaration, Chair, and the Deputy Minister of Transport did say that no, actually the people that stopped the acquiring of the driving license machine is not the AG, it's the Minister. So when you don't get your driver's license, don't blame the AG. We'll blame the Minister and the Deputy Minister, for they are the ones who requested that the tender be investigated. So yesterday, the crime statistics were released, and what they confirmed is that many of us live in fear. We can't enjoy our freedoms. But from the interactions that one is having with my fellow South Africans, what South Africans expect is that the police needs to be tough on crime, and the police needs to be tough on criminals. They want to feel protected from criminals. They want to see the policemen and women protecting law-abiding citizens. It is for this reason that as Rise Mzansi, we commend the work of the police in Stilfontein. Because there are times that we must stand on the side of the police. Many a times we come here and lament the work that the police does, and they don't get to feel our support. So this evening, I want to say to the police that are executing the work in Stilfontein, as Rise Mzansi, we are with you, and we'll continue to support the work of the police, because we believe if we support the work of the police will also work very hard to protect all of us. We also want to say that from our side, we are not in support of the criminals that shoot at the police. And the police, we don't want to see policemen and women dying with their guns in their holsters. When they are shot at, they should be able to respond in protecting all law-abiding South Africans.
Bosa.
No declaration from Bosa.
Thank you. The ATM, Al-Jamaa, the NCC, the PIC, the UIT, Good, the ANC.
Thank you, House Chair. The Portfolio Committee on Police have considered the budget and the annual performance of the SAPS, IPIT, CSP, and CIRA for the financial year 2023-2024. And as the ANC, we stand in support of the budget review recommendations report on the Portfolio Committee on Police. The fight against crime is one of the apex priorities as outlined in our manifesto as the ANC. That was, we commit to build a safer communities We are concerned about the high levels of crime in our country, and we urge the police and other law enforcement agencies to intensify the fight against crime. As citizens, we also have a responsibility to assist the police in their fight against crime. The point is that the police alone cannot win the fight against crime. We have noted the emergency of crimes of extortion, construction mafias, and undermine service delivery programs, and we create a hostile environment for business activities. We note the interventions that the police to deal with the kinds of crimes, including the illegal mining. The report covers the triple PRs of SAPS, CSPS, IPIT, CIRA. We are in full support of this report. On police, we are concerned about the material findings on performance, contract management, and compliance with legislation. In addition, we are concerned about the issue of repeat audit findings, which appears to be addressed urgently. We urge the SAPS to establish clear accountability structures within the department to ensure that leadership takes responsibility for audit findings and compliance issues. On IPIT, we know that IPIT has achieved unqualified audit opinion without any material findings. We urge the IPIT to maintain urgent financial systems and internal control that led to the unqualified audit performance. We reiterate the recommendation of the PC on IPIT should conduct thorough investigation into all deaths in custody and establish accountability measures for police officers who are involved. On the CSPS...
Thank you, Honourable Member. Your time has now expired.
The ANC support the report. Thank you.
I put the motion again. Are there any objections? The EFF.
Thank you, House Chair. On behalf of the victims of poor policing
No,
on the
Honourable
Cape Flats,
Paulson, don't do that.
I reject this BRRR.
Thank you. The MK.
MK Party will reject this report. Thank you.
Thank you. With those objections noted, the report is accordingly agreed to. The Secretary will read the 12th order.
Consideration of budgetary review and recommendations report of Portfolio Committee on Agriculture and Portfolio Committee on Land Reform and Rural Development on vote 29.
The Honourable the Chief Whip of the largest party.
Thanks, Chair. I move that the report be adopted. Thank you.
Thank you. Honourable members, requests for declaration of vote have been received. We will again allow for up to 2 minutes, one member of each political party wishing to do so, an opportunity to make a declaration. The DA.
Thank you, Honourable Chairperson. The farmers of South Africa are the backbone of our country. We all depend on them because without them we will not have food on our tables. Our farmers, black, brown and white, form an integral part of our country's economy, and therefore we must protect our farmers by implementing the proposals made in this budgetary review process. Unfortunately, due to the failure of the Agricultural Research Council to manufacture foot and mouth disease vaccines, we still have to import these vaccines from Botswana. And unfortunately, due to the failure of Onderstepoort Biological Products to complete its vaccine manufacturing facility, we have frequent shortages of African horse sickness and other much-needed vaccines. This, despite the fact that OBP has received 492 million rands to complete its good manufacturing process facility in 2013 already. We therefore welcome Minister John Steenhuisen's announcement that he wants the SIU to launch an investigation into this matter, especially after the SIU confirmed that they have not been requested to do so in the past. In light of the past failures of various entities to maintain its equipment, we also welcome a recommendation made in this BRRR regarding equipment maintenance and asset recording. The DA also wants to congratulate Minister Steenhuisen for the agreement regarding red meat exports that he signed with his Chinese counterpart. We therefore welcome the recommendation that the Minister must engage with the Minister of Finance to fast-track the processing of funding applications for the foot and mouth disease vaccine facility. Honourable House Chairperson, getting the Department of Agriculture back on track is a mammoth task that lies ahead for Minister Steenhuisen. It is, however, comforting to see the seriousness and dedication with which Minister Steenhuisen is approaching this. We have full confidence that under his leadership, the
Thank you,
Department of
Honourable
Agriculture
Member.
will
Your
excel
time has now
so that we can
expired.
rescue South Africa. We support.
The MK.
Let me add my voice to the call for our people to come out to Moses Mabhida on the 15th of December to come and celebrate the first anniversary of our revolutionary movement. That gathering will be addressed by the revolutionary president, Jacob Zuma, and it will give hope to our people. Now, let's deal with this report. First, the MK rejects it. You know, it is shocking that this department is supposed to address land reform, is supposed to address rural development, and also agriculture. It has failed to achieve any of those. What this department actually does is to benefit land thieves. Let's take the restitution program. Do you know that we pay for a land and then the farmers keep the land and our people are told to go away? We're basically making sure that restitution benefits the beneficiaries of land dispossession. We are buying land of our people and the farmers keep the land and our people are told to go away. It is shocking that restitution is about legitimizing land dispossession. So this department does not serve the interests of our people. As we see also, where there's post-settlement support, we go and hire white farmers and they take the profits and our people get nothing from their land. They end up with conflicts as the white farmers fleece off the biggest chunk of those profits. Farm workers are slaves in South Africa. Farm workers are the most underpaid in South Africa, and their human rights are abused by these white farmers. We as Mkhonto Wesizwe are going to liberate our people. We are going to expropriate land without
Thank you,
compensation.
Honourable Member. Your
to
time
make
has
sure
now
that freedom is
expired.
real.
The EFF.
Thank you very much, House Chair. We must state it categorically clear that land ownership patterns in South Africa remains a serious concern as the department has failed to effectively deal with land ownership pattern. We argue that land ownership pattern should reflect the demographics of the Republic of South Africa and that it is an indictment on this department and the so-called GNU that we still have millions of our people languishing on the margins of society as pariahs in the land of their forefathers and forebears. House Chair, there's no nation that can be proud of its nationhood when its people are stripped of their human dignity and their right to land, thus subjected to perpetual state of landlessness by the land thieves who took our land through the barrel of a gun. Without a land, there's no life, no dignity. Whilst amongst many failed programs, the department launched FPSU model, and just under 2 weeks ago, as the Portfolio Committee, we received a report that more than 70% of the FPSU are dysfunctional. What a waste of taxpayers' money under the ANC. Whilst we thought we've seen it all, the GNU minister makes it even worse and brings a racist lane bus in his office with no qualifications, undermining many qualified graduates who are currently sitting at home because people like Bas John of the GNU value patronage more than meritocracy.
Honourable Member.
This is the department.
Honourable Member, just take your seat for a moment. The Honourable Chief Whip of the DA.
Thank you, Honourable House Chairperson. Honourable House Chairperson, I refer to the plenary of the 14th of November and the ruling that was made, as well as Rule 69. This very same member was ruled out of order on various occasions by 2 presiding officers, and he is now again referring to the Honourable Minister in a derogatory way. Can I please get your ruling, firstly, on that he must withdraw, and secondly, that his misconduct again is gross misconduct in terms of Rule 69. Thank you.
Yeah, thank you, Honourable Member. As I was not necessarily the presiding officer when those rulings were made, I'm not in a position to determine that there's gross misorderly conduct. Honourable Member, however, it is not respectful to refer to another member and as boss John, so please withdraw that statement and refer to the Minister in respectful terms.
I withdraw. The department whose Land Claims Commission has been on the road to autonomy for the past 10 years. This is a department that has presided over the destruction of the irrigation scheme, putting at risk about 1.4 million hectares of land. Modula Stilo, Kilonele Fapalele Lampil Hubuama, le reketse balemi ba ko taung PSU, di Khomo, le gore ba pataletse balemi ba di koporasi potlana tsa ko Bosele, Tshedisho ipelegeng le re a itlhoma sekoloto sa motlakase le metsi. With all these challenges and many others of this, the department still underspent by 471 million in the last 2 financial years. The EFF vehemently and profusely rejects this BRR with the contempt it deserves. Thank you, House Chair.
Thank you. The IFP.
Thank you, House Chair. Proper handling of land and agriculture is critical to addressing poverty, unemployment, and ensuring food security and development, especially in rural areas. The IFP recognizes that land holds profound social and economic significance. It is this reason that we, as the IFP, call for significant state support for emerging smallholder farmers as well as the subsistence farmers. Speaker, the slow pace of settling long-standing land claims is a serious concern. Added to this challenge is the continuous allegation of involvement of officials in corruption activities in land claims. We urge the department to look into this. Agriculture plays a key role in creating jobs, ensuring food security, and reducing poverty in rural areas. However, rural underdevelopment pushes people to cities. Mechanization support land preservation policies and monitoring subsidies are essential in ensuring the viability of agricultural land. Speaker, or Chairperson, I'm sorry, on financial accountability, we recommend the Department for Recovering Irregular Spent Funds. Regarding the Office of the VG, we support the call for prioritized securing a special dispensation for appointing the permanent Value General and Chief Operations Officer. The IFP supports the report. Thank you.
Thank you. The PI.
No declaration from the PI. Thank you, Chair.
Thank you. The FF Plus.
No declaration, House Chair.
Thank you. Action SA.
House Chairperson, I was hoping to address Action SA's position on this debate to the Minister of Agriculture and the Minister of Finance, but I see the Minister of Finance is not here. Slow land reform due to...
Point of order. The Minister of Agriculture is here.
Point of order, I said the Minister of Finance is
Order,
not here.
honourable members. The Minister of Agriculture, please don't unmute your mic and speak without being recognised. And similarly, Honourable Trolle, please do not react to statements made from the floor, but you're quite correct. The Minister of Agriculture was not declared absent by yourself, so please continue.
Thank you. Slow land reform due to underfunding is compounded by ineffective post-settlement support, which directly exacerbates rural poverty. I say this to allay the temptation to allocate more money to a clearly deficient process. The solution is to fix what has failed, to ensure improved agricultural production and food security. The state of affairs at Onderstepoort Biological Products and the Agricultural Research Council are such that the efficacy of current budgetary allocations is compromised by poor management, inadequate infrastructure maintenance, and outmoded technological applications. Having said this, I want to reinforce the importance of having such a national key point being fully functional and at the cutting edge of technological advancement. Foot and mouth disease should be an archaic disease, but its persistent recurrence is having disastrous economic consequences for the livestock industry. More importantly, The ministers should both note that black South African farmers are categorized as having, and I quote, lower than sector productivity levels and yields. This determination is measured as a ratio of agricultural outputs in relation to inputs. This negative productivity factor in developing agriculture is the most damning indictment of this department's performance. This failure is endemic, and it's not for a lack of funding and interventions such as producer development support, farmer production support. The failure prevails because these initiatives are not adequately implemented or staffed by competent, capable, and committed government officials. Action SA conditionally supports this report's recommendations as long as Treasury's demands improve performance and that entity boards are held to account for the performance of their entities. Thank you.
Thank you. The ACDP.
No declaration. Thank you, Chair.
Thank you. The UDM.
Next on this Chair.
Kialabuan Tate. UDM. Rise.
No declaration from Rise.
Thank you. Bosa.
No declaration from Bosa.
Thank you. The ATM. Al Jamar. The NCC. The PIC. The UIT. Good. The ANC.
House Chairperson, Deputy President, the Chief Whip and honorable members. The department uses 6 programs to measure its strategic outcomes. These programs are strategic to the development of agricultural sector. As the African National Congress, we are in full support of the Budgetary Review and Recommendation Report of the Portfolio Committee on Agriculture and Portfolio Committee on Land Reform and Rural Development, vote 29-23 of October 2024. The support is motivated by the fact that for the 2023-24 fiscal year, the department received a total appropriation of 16.76 billion, of which it spent roughly 16.7 billion or 99.7, compared to the previous year when 427.9 million was not spent and had to be returned over to the Revenue Fund of the National Treasury. For the fiscal year 2023-24, the department did not show any incurred irregular expenditure. The Agricultural Research Council actually reported total revenue of 1.79 billion in 2023-24, an increase from 1.53 billion in the previous fiscal year, indicating a growth of approximately 17%. The work of the department is starting to bear fruit as the sector is growing faster than the economy, as growth was measured at 4.2%. Moreover, the growth in the sector has ensured growth in employment of 6%, which means that 941,000 people are now employed in the sector. The department will need to implement the recommendations and report to the Portfolio Committee on progress. We will report to Parliament on quarterly basis on progress in relation to the implementation of the audit improvement action plans. The ANC calls for the House to adopt the report. The ANC support the report. The Council.
Honourable members, I put the motion again. Are there any objections? The EFF.
Until the land is returned to its rightful owners,
Honourable
we
Paul, sir.
reject this BRRR.
Thank you. The MK.
Acting Speaker, the MK will reject this report.
Thank you. With those objections noted, the report is accordingly agreed to. The Secretary will read the 13th order.
Consideration of budgetary review and recommendation report of Portfolio Committee on Water and Sanitation.
The Honourable the Chief Whip of the largest party.
Thanks, Chair. I move that the report to be adopted. Thank you.
Thank you. Honourable Chief Whip, you have some backbenchers there, one with yellow lapels there, which seems to be very unruly. I call on you as the Chief Whip to intervene. Honourable members, requests for declaration of vote have been received. I will now allow for up to 2 minutes, one member of each political party wishing to do so, to make a declaration. The DA.
Thank you, Chairperson. This report reflects the work of the Department of Water and Sanitation and the committee's commitment in holding government accountable and addressing South Africa's water and sanitation challenges. The DA commends the department for achieving 99.8% budget expenditure. Yet we echo concerns about the alignment of this expenditure with actual service delivery. Many South Africans still lack access to clean water and sanitation, highlighting a pressing need for efficient project execution and improved infrastructure maintenance. The DA supports the committee's recommendations for better timeline of critical programs such as the eradication of the bucket system, which continue to deny dignity to many. Furthermore, we urge prioritizing consequence management to address irregular expenditure and prevent further wasteful spending. This report is a call to action for sustainable water and sanitation services that meet our constitutional obligation. We, the DA, pledge our ongoing commitment to oversight and keeping government accountable to ensure all South Africans have access to safe, reliable water and sanitation services. The DA supports this report.
Thank you. The MK.
Sihlalo wendlu ngaphambi bangene la kukhona nje into encane kufanele siyilungise. Lento yokuthi kuthiwe u9 wasted years imbudane nje into engekho. Abantu base South Africa bayazi ukuthi u9 wasted years into engekho. Umzali onengane ebisisokhukhwini lokufa isinuka imbali uthema ethola amaphilisi lawa ama ARVs ayilethwe umsholozi yavuka ukhukhwini lokufa manje vela mangalo ukuthi kukhulunywa ngani uma kukhulunywa ngo9 wasted years. Honorable members, I rise on behalf of the MK party to declare our non-support for the budgetary review and recommendation report on water and sanitation for the 2023 to 2024 financial year. While we recognize the mandate and the importance of this report, we cannot endorse it due to critical shortcomings that undermine the realization of the constitutional rights and effective service delivery for our people. The reasons are as follows. There is persistent failure to meet targets. Despite the expenditure rate of 99.8%, the report highlights alarming gaps in service delivery. Only 474 out of 1,224 planned maintenance projects were completed, representing a 39% success rate. This neglect exacerbates the deterioration of essential infrastructure. The bucket eradication program remains a glaring failure, with zero budget sanitation backlog system replaced in the 2023-2024 year, despite repeated promises. Such inaction leaves thousands of families in dehumanizing conditions. Kuningi kakhulu, but asiyivumi. Siyabonga.
Thank you. The EFF.
Thank you, House Chair. Chair, the EFF rejects this BRRR report as this budget review fails to address the critical issues affecting the lives of our people and perpetuates a state of neglect and mismanagement. The ANC has failed to provide basic services, leaving people's lives in dire strains. The water shortage is a visible example of the dysfunction and unfulfilled processes by the Department of Water and Sanitation. People's rights to clean water are violated on a daily basis. Deteriorating infrastructures are evident that unfunded water service authorities crumble, leaving communities vulnerable to health risks and environmental degradation. This is unacceptable, Minister of Amapiano. The fact that 45% of projects are delayed, costing us 2.9 billion, reflects not just fiscal irresponsibility, but a betrayal of public trust. The people's money is being squandered while they suffer. We must confront the 363 million wasted on irregular and fruitless expenditure, which reflects an entrenched culture of impunity within DWS. We will not allow this to continue. The lack of accountability in failing to implement consequence management for procurement irregularities has fostered insufficiency and wastefulness. As highlighted in the DPME report, the government's persistent failure to address water infrastructure amidst rising urbanization signifies a profound disregard for the lived realities of ordinary South Africans. House Chairperson, the EFF continues and will continue to fight for the rights of the people until every South African has access to clean water, sanitation, and dignity. We reject this report.
Thank you, the IFP.
Thank you, Chairperson. Chairperson, may I start by saying, ama-ARVs awokuvikela ubhubhane. Umsholozike akakholelwa ekuvikeleni. The IFP's consideration of this report is guided by our recognition of the department's mandate to ensure that the country's water resources...
Honourable Member, please just take your seat for a moment. I have a hand here to my left. Honourable Member, order! Honourable Member, why are you rising?
Tulani Namasela. No, this one is out of order and you must withdraw what he has said.
No.
You must withdraw.
Honourable Member, on what basis do you say that is out of order?
No, it's out of order. He must withdraw what he has said about President Zuma.
No.
He must withdraw.
Honourable Member.
He must withdraw. He's out of order. In terms of
Honourable Member, thank you.
Out of order. He must
Please
withdraw.
take your seat.
He must withdraw.
Thank you. Please take your seat.
No, he's in order. He's in order. Continue.
Thank you. Honourable members, please hold on. Honourable members, a reference to a non-member of this House cannot lead to an intervention in terms of the rules. Honourable member, please continue.
The IFP's consideration of this report is guided by our recognition of the department's mandate to ensure that the country's water
Honourable
resources...
member, just take your seat, please. Honourable member, if you are rising on the same point, the rules make it very clear that once the presiding officer have ruled, the ruling is final. The rules do not make provision for that ruling then to be revisited. Are you rising on another matter?
No, he made the
No, thank you very much, Chairperson. No, I'm not rising on that order. But I'm
No, Honourable Deputy Minister, I've not recognized you. I'm still with this member, but I will come to you. Honourable Member, I'm not going to entertain a revisitation of my ruling. If you are unhappy with the rules, engage with your whippery so that the matter be escalated in terms of the rules.
No, House Chair, I'm saying the remarks that he has made against President Zuma, that President Zuma does not like protection.
Honourable Member.
Are unparliamentary. They are not parliamentary. To say that a person does not believe in protection, is it parliamentary?
Honourable Member, I've made my ruling. Thank you.
Is it parliamentary to say a person does not like protection?
I'm going to now instruct you to leave the platform. Honourable Deputy Minister, did you want to be recognized? Is there really a need?
Chairperson, yes, there is a need for the decorum of the House that the member who had raised a point of order referred to the Honourable Hadebe as this one. And I would like you to make a ruling on that. That it's not respectful and it's unparliamentary.
Okay. Thank you. Honourable Member, in future, please refer in respectful terms to another member. Don't refer to another member as that one or this one. At least use Mr. in the present circumstances. Thank you. Honourable Hadebe, please continue.
The IFP notes the 92% achieved for the overall strategic-oriented outcomes, especially
Honourable
because...
Hadebe, just hold on. Honourable Reddy, is this a new matter?
Yes, Acting Speaker. Acting Speaker, I want to appeal to you. Let's keep the decorum of the House. I always respect you when you say that. And
What
you've
rule are you
always
rising
kept
on?
The decorum of the House.
Yeah.
When members speak here, let them keep to the topic. When they start talking
Yeah.
about other party
Thank you,
leaders,
Honourable
it tells
Reddy.
you that they have no substance.
Yeah.
They cannot talk about their own
Thank you, Honourable Reddy.
captured leader.
Yeah, thank
That's
you,
the
Honourable
problem.
Reddy. We're ready to move on. Let me remind you that you and other members have used your speaking time today to put out some advertisements for a future event, which is not part of the topic. But you're quite correct. Let's try and all stick to the topic. Honourable Gadebe, please continue.
The IFP welcomes the fact that the department spends 99.8% of its available budget. Moreover, we note the improvement from the previous year with compliance with legislation as the department received an unqualified audit opinion with findings. However, the IFP notes with concern the delayed water and sanitation projects with reasons such as unresponsive service providers, lack of monitoring by officials, community protests, and construction mafias. Furthermore, the IFP is concerned about non-performance and failure to meet targets on the bucket eradication program in the Free State and the Northern Cape provinces. In conclusion, the IFP is committed to carefully monitoring the performance of this department and will not hesitate to demand accountability. Considering all the stated issues, the IFP in general supports the recommendations. Thank you.
Thank you. The PA.
No declaration from the PA. Thank you, Chair.
Thank you. The FF Plus.
No declaration. Thank you, House Chair.
Thank you. Action SA.
Thank you, Honourable Chairperson. It is on very rare occasions that we as opposition support the BRRR report outright, but I'm inclined to believe that a large part of the failures of water service delivery and sanitation systems are caused by dysfunctional municipalities. And the denialism of on SALGA's end is a slap in the face for millions of South Africans who are on the receiving end of poor service delivery on a daily. Indeed, Minister, it is not within your ambit to go into municipalities and fix leaking pipes, but to abdicate responsibility entirely cannot be allowed. Your department must ensure effective oversight of grants and provide support to municipalities who struggle to ensure service delivery and ensure that proper water quality standards are met. In a sector that has never been professionalized, Minister, a great deal of work lies ahead of you to turn the situation around, but Minister, I can assure you that there is hope. A shining example of a municipality that has had a positive turnaround in service delivery is the city of Tshwane, led by Executive Mayor Dr. Nasiphi Moya, showing how municipality should ideally be when professionals are at the helm. A municipality where in the past 8 years under a DA-led government experienced a devastating and deadly cholera outbreak, tragically claiming the lives of innocent people in Hammanskraal. But today, there is a turnaround, and this work that has been neglected for years has been turned around by this professional. With our support of the BRRR report, our condition is that, Minister, can you make South African municipalities turn around and be a success story like that of the city of Tshwane? Serious reforms are needed to achieve this. Beyond professionalizing the sector, we must tighten revenue collection across all municipalities with progressive water charges for high water users, and we must apply legislative sanctions and enforcement against municipalities.
Thank you, Honourable Member. Your time has now expired. The ACDP.
Thank you, Honourable House Chairperson. The ACDP understands that the legislative mandate of the Department of Water and Sanitation is to ensure the protection, management and development of the country's water resources. The ACDP agrees that austerity measures affecting water and sanitation will impact its critical underpinning of other sectors such as health, energy, human settlements and agriculture. We do question the committee's noting of irregular but not criminal expenditure by the Trans-Caledon Tunnel Authority, but welcomes the Hawks investigation into the Water Department uncovering serious malfeasance involving some 2.6 billion rand, which could have funded amenities for communities still lacking water and sanitation services. There are numerous delayed projects due to unresponsive service providers, lack of monitoring, community protests, not forgetting the criminal action of the construction and water tanker mafia. Poor maintenance of infrastructure is causing high water losses, revenue loss, and service delivery failures. The National Action Plan to address infrastructure maintenance must be prioritized, including a funding model and strategies to employ local people and develop skills and businesses. South Africa has regressed in attaining the Sustainable Development Goal 6 targets on water and sanitation access. There are toxic sewage spills in many towns, and incidents of school children falling into pit latrines, and government struggling to provide adequate, equitable sanitation and hygiene for all. Sustainable Development Goal 6 appears to be unattainable in our present circumstances. I thank you.
Thank you. The UDM.
Ndiyabona sithetha nobhebs wamanzi ngoku kuyanetha. Ndakhensa mutshamo wesitulo. The Department of Water and Sanitation, an institution entrusted with ensuring South Africans' most basic human right, access to clean water and proper sanitation, continues to struggle to fulfill this mandate. These challenges do not only undermine the dignity of citizens, but also exacerbate the deep inequalities and the socioeconomic injustices that persist in our society. The report highlights the department's poor record in achieving key performance targets, delays in critical infrastructure projects, and inefficiencies in service delivery, which have left thousands of South Africans without adequate access to sanitation and clean water. For instance, a program which is very dear to us and close to our hearts, the Bucket Eradication Program, a key initiative aimed at eliminating bucket toilets, has made very little progress, with fewer than 1,300 systems replaced against a target of 12,000. This underperformance is symptomatic of systemic challenges where promises made to communities are routinely broken. The department has also failed to achieve its target in several vital infrastructure projects, such as Mokolo Crocodile Water Project and Mkoma's Water Project, both of which have experienced delays for years. Such delays do not only add to the backlog of water demand, especially in provinces such as Limpopo and KwaZulu-Natal, where scarcity is an ever-present problem. Furthermore, the maintenance backlog is staggering, with only about 40% of the 1,224 planned maintenance projects completed, further exposing the vulnerability of our water infrastructure to more challenges. Umsebenzi wakho ke thola uzaba nzima apha izathu ufuneka unyuse igawusi usebenze uqiniseke uba le department iyalunga. Camakho.
Thank you. Rise.
Nakhensa mtshamo wesitulo, not declaration.
Bosa.
Thank you, House Chair. As BOSA, we support the BRRR, but we do so noting some serious concerns. The first is around the eradication of bucket sanitation. There's a backlog, and the feasibility to eradicate 10,798 backlog bucket sanitation systems in 1 year between 2025 and 2026 is unrealistic. To address decades-long infrastructure backlogs within a year that already, in a department that already has a serious infrastructure handicap, seems quite impractical. So we'll be closely monitoring this over the next year and on a quarterly basis. The second concern is around the over-reliance on local governments. The report's approach on how to solve the water crisis is quite contradictory because on the one hand, it relies heavily on local municipalities to implement changes, while in the same breath, acknowledging that there are serious issues of governance, capacity, and accountability at local government. So how does the department suppose that a municipality like Mfuleni in Gauteng, which has actual fountains of sewage flowing through its communities, is going to be able to implement any measures to provide people
My
with
apologies,
water
Honourable
and
Member. Will you
sanitation.
please take your seat for a moment? Honourable Reddy, why do you want to be recognised?
Thank you, the Acting Speaker. But will the Speaker be willing to take a question?
Honourable Webster, are you willing to take a question from the Honourable Reddy?
No.
Thank you. Please proceed.
So the recommendations on outputs, rather than addressing the systemic issues of failures such as procurement inefficiencies, corruptions, and municipal mismanagement, is actually what's at the heart of the water crisis. So as BOSA, we will not support any band-aid recommendations that have been made because the water crisis is too serious, and we really ask that the Minister ensure that the oversight role of the department when it comes to municipalities is taken seriously. I thank you.
Thank you. The ATM, Al-Jamar, the NCC, the PAC, the UAT, good, the ANC.
House Chair, I rise on behalf of the ANC to support the PLENARY report. The department have achieved 70% of its predetermined targets during the year under review, and are convinced that the department will improve its performance in the current year as a result of the implementation of the continuous improvement measures. During the year under review, the department achieved a milestone by successfully completing the Nandoni-Tsami bulk water pipeline project, paving the way for residents in 22 villages to receive water directly from their taps. The ANC were concerned about the regressing audit outcomes and were further concerned about the numerous major water and sanitation projects that are experiencing delays due to various factors, such as poor contractor performance, delays on procurements, community protest, and disruption by the construction mafia. Our concern is raised on the basis that our people need water like dry desert needing rain. For the year under review, the department, through its various regional bulk infrastructure grant projects, created 722 jobs across the country and provided much-needed water in drought-stricken areas. Additionally, the department allocated 35% of its procurement expenditures, totaling 3 billion, to majority-owned black businesses. Furthermore, 2.9 billion went to majority women businesses, and 93 million to majority youth businesses, and 94 million.
Thank you, Honourable Member. Your time has now expired.
The ANC support the report. Thank you so much.
Honourable Members, I put the motion again. Are there any objections? Honourable Paulsen.
Thank you, Chairperson. While our people have to live side by side with
Honourable
sewage,
Paulsen, just
while our
declare,
people are
please.
denied access to clean drinking water, while our people must use
Thank
pit
you,
latrines,
Honourable
we
Paulsen.
reject this BRRR.
MK.
On behalf of the millions of people that don't have water tonight,
thank
MK
you.
will vote against
Don't
this.
follow bad
BRRR.
examples, Honourable Reddy. You were doing so well. Honourable Members, with those objections noted, the report is accordingly agreed to. Honourable Members, the last item on the order paper is a decision of the question on the draft resolution in the name of Mr. S. Tambo. Honourable Members, I wish to remind you that this draft resolution was debated in a virtual mini-plenary on Friday the 15th of November, but that a decision thereon can only be taken in the full plenary. I now put the motion. Are there any objections? The DA?
Thank you, House Chair. The DA objects.
FF Plus.
Please note the objection of the FF Plus, House Chair.
The ANC.
Chair, the ANC objects the motion and we still stand on what we said during the debate and we met with FFC this morning. Thank you.
Thank you. Honourable members, I see a further hand there. Is it the IFP?
Chairperson, the IFP objects.
Thank you. PI?
Chairperson, the Patriotic Alliance objects.
Thank you. MK?
The MK supports.
Yeah, thank you. I didn't ask for that. Honourable members, order. Honourable members, in terms of Rule 109(2), given the multitude of objections, I now determine as the presiding officer that the division will take place to determine the vote in this matter. The bells will be rung for 5 minutes. Order. Honourable members, please take your seats. Honourable members, the Speaker has determined that in accordance with the rules, a manual voting procedure will be used for this division. Firstly, in order to establish a quorum, I would request the table to confirm that we have the requisite number of members physically present in the chamber to take this decision. Party whips will then be given an opportunity to confirm the number of their members present and indicate if they vote for or against the question. A member who wishes to abstain or vote against the party vote may do so by informing the chair. Honourable members, having confirmed that we have the requisite quorum, we will now proceed. The question before the House is whether a motion in the name of the Honourable S. Tambo, debated during a mini-plenary session of this House on the 15th of November 2024, is agreed to. Voting will now commence. The door to the chamber will be locked and members will not be allowed to enter until voting is concluded. Whips, could you please confirm the number of your members present in the chamber and, when called upon, indicate if they vote for or against the question? The table will assist if necessary. Are party whips ready to record the votes of their members who are present? The ANC?
Thank you, Chair. The ANC, with 99 members in attendance, is voting against the motion.
Thank you. The DA. Order.
Thank you, House Chair. The DA, with 64 members present, votes against the motion.
The MK. Order. Honourable members, let's be orderly during the division.
Coalition, please keep quiet. The incoming.
Yeah. Honourable Marquee, please assist us.
The government in waiting party, the MK, with 28 names, votes in favor of the question.
The FF.
House Chair, the EFF has 8 members present in the House voting in favor of the motion.
Thank you. The IFP.
We will also send the
Order. Thank you, Honourable Paulson. Order. Please take your seat. The IFP.
House Chairperson, the IFP, with 8 members present, we vote against.
Thank you. The PI.
Sorry, Chairperson, 9 members present, we vote against.
Thank you. The PI.
House Chairperson, the Patriotic Alliance, with 4 members voting against. Thank you.
The FF Plus.
Thank you, House Chairperson. The FF Plus, with 2 members in the House voting against.
Action SA.
Thank you, House Chair. Action SA, with 4 members in support of the motion.
ACDP. The UDM.
1 in the House voting in favor.
Rise.
The entire caucus of Rise present, 2 members voting against.
Bosa. Rise, will you just repeat?
I did say, Chair, that 2 members of Rise present vote against.
What is your vote, Honourable Ghana? We didn't get that.
2 members present voting against the motion.
Thank you. Bosa. ATM. Al-Jamar. The NCC. The PIC. The UIT. Good. Is there any member that wishes to abstain or vote differently to their party? Thank you. The voting session is now closed. Honourable members, the result of the division is as follows. Those in favour of the motion being adopted, 41. Those against, 180. There were no abstentions. The question is accordingly not agreed to. Order. I request members to stand and wait for the presiding officer and the mace to leave the chamber. This concludes the business for the day, and the House is adjourned.